As you probably know, we have a lot of events going on. This is the second time we do this event each year, and it's really, really exciting because it brings people together from all over the globe. And as I get into the audience and see who is here, we're going to hear where people traveled from, what they're doing, and how they're making an impact in the health industry today. So we are streaming live on YouTube, so if any of your family, friends, or colleagues want to see your panel, your topic, your conversation, or even some of the opportunities where you will be receiving some awards and recognition, YouTube is a great place to start. So I'm going to give you all that information. So I'm going to be with you for 3 days to give you everything you need to make this as fun and informative as possible. How's that sound? Okay? Great. From a show of hands, who's on social media? Everyone on social media in this room? Everyone's using the phone, right? Okay, great. Show of hands, who's on Twitter? Okay, wow, amazing. Who's on Facebook? Anyone on Facebook? Oh, right. Who's posting on Facebook? Who's just looking at the pictures of all the friends on Facebook? Right? Okay, who's on LinkedIn? All right. This is my favorite platform because at the end of this event, I want you each to build your personal brand and connections professionally. And there's no better way to do it than LinkedIn. It's the only platform that has succeeded in connecting all these professional people. So I'm going to be reminding you how to do it, how to use it, and how to maximize your personal brand while you're at Health 2.0. Okay? We do have a hashtag called Health2Conf. It's too long to write conference, so they just wrote CONF, hashtag Health2Conf, on all the platforms. They're on Instagram, Facebook, they're on YouTube, they're on everything except Snapchat and TikTok. Any TikTok? Oh, we got one. Snapchat? Not one yet. Okay, great. Okay, we're talking to the right demographic here. So I highly recommend, if you find someone on stage valuable and their content incredibly inspiring, take a picture of them, post it on your LinkedIn profile or any other profile, hashtag the event, and then the event organizers will find you and reshare. This is a great way for other people to know us. So we all are here to grow professionally, right? Raise your hand if you're here to meet professional connections. Absolutely. Who's here to make some business connections? Great. Okay, so the only way we're going to maximize is not only here live, which is great to do after COVID, right? We're going to meet people, but online digitally, there's a lot of people to meet. So if you can, and if you have any questions, please allow me to support you in growing your personal brand digitally during the next 3 days, okay? So we have dedicated researchers, policymakers, forward-thinking organizations and businesses here that are all coming to do groundbreaking work in the health industry. I'm really excited to share all their efforts. There's so much effort needed to really make an impact in the health industry and to affect people's lives around the globe. So I, first of all, applaud you. I want to give you applause, just myself, for amazing work in this amazing field. And we're going to recognize you guys in the next couple days. I'd like to also express my deepest gratitude. We have a silver sponsor, Bajil Hospital in Abu Dhabi, which has made it possible. Where are you guys? Raise your hands. Oh yeah, the bad boys in the back. I got it. I love your hospital. Fantastic hospital. Great, great, great reputation in town. They're doing incredible things, and we wouldn't be here without them. So thank you so much for your participation. Thank you again. We're going to hear more from them. Welcome. Keep on coming in. Okay, people are going to come throughout the day. You see there's a lot of empty chairs still, and I saw hundreds of badges just waiting to come on in. So as people are getting up in this town, we'll be inviting them in. So as I mentioned, phones, please do me a favor, 2 seconds, just put it on vibrate. I know everyone's multitasking these days. Just put it on vibrate so no one's up here and all of a sudden the phone goes on. Take that minute. I'll give you a minute to do that. We have coffee available all day. The Intercontinental does a fabulous job giving croissants and a whole bunch of other additional food that you can enjoy. So if you haven't had any, you're welcome to bring it inside here, okay? Leave it anytime. If you have questions about where the restrooms are, they're right by the front. Very simple. We're gonna break for lunch. We're all gonna go downstairs, have a nice buffet meal together. You'll have the opportunity to meet some of the other professionals in the other rooms that are here. Again, 6 events happening at the same time. So without further ado, I'd like to invite to the stage our first panelist moderator who's going to be here to just guide us in the first topic of the day. It's a great way to start the day because it's all about collaboration, right? I think strategic partnerships and collaborating professionally is the way forward. So we're gonna find out how all these different people inside the health industry are going to connect and actually get engaged to be successful in all of their efforts. So can I invite to the stage the moderator, Pranay Grug, for the founder and MD of HealthCong. You see everyone has a catalog. Oh, give him a round of applause. He's right here ready to go. How are you doing? Welcome to the stage. I'm going to give you a microphone.
Thanks.
Okay, this should be on. Hold on. Guys, microphone, please. Let's see, that one's going to be for you.
Hello, yep.
Okay, I'm going to let him announce everybody who's coming up to be on part of his panel for a good half an hour conversation. Everyone has a catalog. Read along, see who these professionals are. It came in with your bag this morning when you checked in, and that's going to be really informative to understand who's here and a great way to bring them into the conversation digitally. So without further ado, thank you very much, Pranay. It's all over to you.
Thank you very much, and good morning to all of you. I'd like by saying that alone we can do so little, but together we can do so much. And to get started, I'd like to invite Dr. Ajay Ganguly onto the stage as a participant. Reem Alkari, Karen Rosenstein, please. Well, we'd first start with a round of introductions, and I will have each one of them introduce themselves, what they do, and what they're here for. Thank you. Reem, you would like to go ahead?
Good morning, everybody. So I'm Reem Alkari. I'm the founder and CEO of 360 Smart Lingo. 360 Smart Lingo is a language service provider. We allow businesses to develop their global brand, and also we believe that communication is not only about language and rendering words, but rather rendering emotions, rendering cultures, and rendering everything that comes with it to understand something. So we provide language solutions like interpretation, translation, and localization. And yes, that's 360.
Good morning, everyone. I'm Dr. Ajay Ganguly. I'm the medical director at Muljibai Patel Urological Hospital in Gujarat in India. I've just joined them. I've had over 3 decades of experience in healthcare. I was in the Indian Army. I then worked in some hospitals in Bombay for about 7 years, and then with the Apollo Group in Hyderabad in India for about 5 years. A lot of experience of hospital operations, patient care, and I look forward to this conversation and, of course, interacting with all of y'all.
Karen, you like to go ahead?
Hi, everyone. Let me start by saying that that's the first time for me speaking in a large audience, so I'm truly excited. Thank you all for coming. I'm Karen Rosenstein. I'm from Israel. What I do is basically I devoted my whole life in the past 3 years in order to provide a unique model. It's a technological emergency room. It's a unique model that provides high quality and time efficient care to remote places. So we provide health medicine, we provide fast blood tests, we have state-of-the-art imaging center. All of this basically because I truly believe that the basic right that every person have is the right to get a really high quality care as soon as possible, because we never know when we're going to need it.
Absolutely fantastic. So fundamentally, thanks for the introduction. We're going to be looking at 3 different segments of how we are going to be building collaboration between patients, providers, and the equipment. And that's really when we start looking at what we've gone through in terms of the pandemic. We're sitting here post the pandemic. Nobody's untouched is what I would say. So first I'd like to put it across to a clinician, who is Dr. Ajay Ganguly, in talking about a sort of a overview and challenges as far as the healthcare industry is concerned, more from a clinician's perspective. Dr. Ajay Ganguly.
Thank you. As you're all aware, healthcare is an extremely complex work environment. We have different stakeholders. I think the first time somebody actually spoke about the stakeholders in healthcare was Donna Bedian from the University of Chicago, who in the 1960s took up a study on health outcomes and spoke about the various stakeholders. And he spoke about the hospital management, he spoke about the clinical providers, and he spoke about the patients. Each one of us brings their own perspectives, their own biases, their own cultural aspects into this mix. And it's important that all these are dealt with. Obviously, collaboration is the key here. And this is what actually will bring about a great outcome for a patient.
Yeah, great. So given the focus on patient centricity, I'd like to now have Reem give her views on the emotional connect, the element of trust, and what is the perspective from a patient's side.
Thank you. So I'm a former clinical pharmacist and a former medical interpreter. And by that, and also a former patient. So everyone here was a patient, hopefully never again, but you were a patient at some point. I wish that you have never had this encounter of being a patient in a foreign country that you don't speak their language. This is where actually the pain manifested for me. I'm an expat living abroad in a country that I don't speak the language. Living there during the pandemic, even pre-pandemic, I got sick. I went to a hospital. I want to be treated, but no one speaks the language. No one speaks my English. No one speaks Arabic. This is my mother tongue, so I couldn't communicate, and that's where it started. I can't understand what's going on. I'm a room full of doctors here, and I know that at least 50% of this audience has experienced that as doctors or as patients. Having the inability to communicate as a patient is frustrating. You're sick, that's frustrating, but not being able to understand or communicate what you're going through is too. So what I'm trying to say is, pre-pandemic, telehealth wasn't as prominent as it is now. During the pandemic, telehealth has accelerated. We have seen a shift in the healthcare services from in-person, to a more remote format. And for me, it is still picking up. This also consequently increased the demand for consecutive medical interpreters. A trained medical interpreter is someone who will be able to convey the communication properly. So if I'm sick and if I'm frustrated, I want my doctor to know that I'm sick and I'm frustrated, not only that I have a stomach ache, because maybe my agitation is a symptom, or maybe not. So this is the communication is the key for doctors to understand what we're going through.
Yep. Thanks, Reem.
Tell me, thank you.
And I'd like sort of Karen now to come in with a personal story, which is going to be accentuating what Reem brought out on how she went through, from a patient's perspective, the gaps she found, the challenges she faced. To talk a little about your own story, as well as why you are in the business right now. Yeah?
Well, I used to work at the Israeli parliament. I used to write speeches, and I was a spokesperson. I wanted to be the Minister of Welfare, as naive as it sounds, I know. But a few years ago, I had 6 cardiac events. My heart was at 230. So, and I've done nothing. So if you think about it, a person, when he runs a marathon, his heart is 170 when he runs. I just sat and I had 230. So my family and I immediately realized that something is completely wrong. Like, you can actually see my heart through my shirt. I couldn't breathe. That's how I said yes, and that's how I said no, because I couldn't say the words. They rushed me to a hospital. Luckily, I live close to Sheba Hospital, which is the 9th hospital, best 9th hospital in the world. And over there, they inject me adenosine, which stops the heart for 6 seconds. I'm sure all of you guys are aware of that. So my heart went from 230 to 0 to 90 in less than a minute. I was just terrified. So for 2 years, I was scared to leave my home, because what I will do if it will happen again. That made me realize that I looked at what I had, and I had a arrhythmia problem. So 50% of the population in the whole world, every one of us, I'm sorry to be the one to say that, but 50% of the people here will or had or will have an arrhythmia problem. It can be really easy. The majority of us won't even know that, but I had a pretty severe problem. So if 50% of the population will suffer from that, and it can happen at any point in our lives, what do people do when they're not lucky enough to live close to a hospital or to a good hospital? So it can happen at any age. People can have 200 in their heart rate, and they can be in their 60s, 70s, 80s. All of us in our own countries suffer from difference between the center of the country and in the outskirts. So I can tell you that in Israel, in the north, there's people that suffer from a problem. They have to drive for an hour and a half to the nearest hospital, and unfortunately, that hospital won't be good enough. So if you're lucky enough to survive an hour and a half, you might not be lucky enough to get the best treatment. And from my own experience, knowing how terrifying it is, I thought to myself,
Hey, Karen, Reem's got a question for you.
yeah, sure.
Yeah, I actually, since I was talking about telehealth, don't you think that telehealth contributes to the solution more than having a technological emergency room? Wouldn't it be more convenient for me to get a telehealth service? It will be faster, more efficient, a trained person, a companion to be with me at my home to handle my emergency if I have a recurrent emergency. What's your take on that?
Well, it's a good question. I struggle with that on a daily basis, because I think, especially in health field, there are some things that can never change the look in a doctor's eyes. When a young mom has a child and that child is 1 year old, she doesn't want through telemedicine. She wants the doctor to actually feel the heart, to look at the kid's throat.
Great perspective. So we've heard the doctor, we've heard the patient, and now we've got to be hearing about the equipment. Let me take that upon myself a little. And so I've got to flip the moderator's role onto something that I can do as well. So what we've now realized is the doctor is where he is. There is a patient at the center of it. The patient has a problem of language barriers, access barriers, and bridging this little gap between the doctor and the patient. And that's what we've seen now, is the increasing need for point-of-care devices. That's really where equipment comes in. Well, the hospital equipment is where it is, but it's as long as the patient can be sort of subjected to that kind of a diagnosis. But point-of-care diagnostics is something that we see coming to the fore, a kind of a enhanced need for point-of-care devices. What can these devices do? How simple can the user experience be? Because when we're outside the hospital environment, it could be community health workers, it could be health supervisors, may not be nurses, or caregivers basically. And that is with limited expertise. So your user experience has to be getting as much as possible, platinum 10 minutes, golden hour, or whatever you call it, to save a life. So that's really where we find that if the care has to move away from the hospital or bridge that little gap between reaching the hospital and being cared for. That is really where I think challenges lie and solutions need to be sort of brought to the fore. Yes. Now that we talked about challenges, I think I'll take a minute and move across to digital transformation, because digital transformation is something that has raised its head pre to post-pandemic. When we talk about technology is not about, it's about people. It's not about tech per se, and it's not toys for boys, as we would call it in the Air Force. But coming back to digital transformation, I'd like to kind of push it across to Dr. Ganguly once again to give his perspective on this very aspect of care and care delivery.
Thank you. As you're all aware, technology in all industries has been advancing at a tremendously rapid pace, and healthcare is no exception to this. The kind of devices that are coming up, and particularly patient monitoring devices, have advanced tremendously rapidly, and particularly I think in the pandemic, what we are now calling as point-of-care devices is something that has gone through the roof. I think with some of them, there is an issue of trust or possibly validation on the reports. So particularly monitoring devices, there is a little, from a lot of clinicians, we do have a little lack of trust on the actual figures that are relayed back to us. The other thing is, during the pandemic, of course, we all know telehealth and telemedicine was such a fantastic innovation that provided access to people everywhere. Subsequently, we come back to that earlier saying, I think we spoke about the fact that healthcare is personal. At the end of the day, no matter what you do, it is something that is extremely personal, affects, as she just said, you want the doctor to look at your child, or you want somebody to actually physically see. And that is something that is starting to come back. A lot of clinicians do tend to feel that they actually can get a connect with the patient if they see the patient in person, not as a virtual meeting.
But doctor, allow me to ask you a question here. I understand the connection. I have a personal story towards that connection, but don't you think that telehealth has solved a problem that has manifested during the pandemic, which is the safety of the medical staff for unnecessary encounters? I don't need to be with the patient if it's not a necessity, an absolute necessity, and pandemic has proven that. We don't need another pandemic on our hand. So I understand the connection. It's really important. It's really important to see the doctor, and the doctor sees me, but not as important as the safety of the medical staff and the patients.
Interacting with patients, of course, will bring some risks for staff. I mean, there's no getting past that. Obviously, there's an element of training. So staff do need to be trained to make sure that a communicable disease transmission does not happen in a standard OPD encounter. The key to actually dealing with that is, of course, training of staff. But coming back to the telemedicine and virtual consults, the real plus point for me actually is that it ensures access for patients. You ultimately have to get in touch to do something. But the access is something that is a real boon, and this is something I think that is what I feel is a game changer for people across the world.
Absolutely.
At least your first access can happen immediately.
Absolutely agree with you, Dr. Ganguly. And while you asked him the question, I think now I'd flip it over to you, because he ended with a queue of access. Yes. And what Reem brought out in her introductory remarks was that clear access, that enabling access through both language as well as trust. So you want to talk a little about, sorry. I'm terribly sorry. So I just flip it over because Dr. Ganguly ended with a cue on access. And Reem has been talking about access, how language barriers sort of do not efficiently enable access. So Reem, you want to talk a little about digital transformation from your perspective?
Of course. So digital transformation has improved the quality of medical interpretation. During the pandemic and post, the boost in the digital transformation has boosted the performance of an interpreter. And the medical interpreter is someone doctors and patients tend to oversee in the encounter. They are there, they are the reason you're communicating, but you don't give them, I'm not going to say generally, but most of the time they are not in the picture. So video remote interpretation has also improved that. If now me as an interpreter, I can see the physical cues of a patient, I can convey more. As I said in my introduction, communication is not only about language, me rendering a word from a language to the other, but also conveying the emotions and conveying the culture. So a motion with a hand could be offensive in a culture, but it's not offensive in another. An interpreter is the one who bridges that gap. So being a former medical interpreter myself, I always wanted the doctors to acknowledge that, please understand that I'm not an AI, I'm not a machine translator, and I have to take my time to understand what you're talking about. I have to inquire. Doctors or patients get frustrated when you say something or you ask for a lot of clarifications. But I need to facilitate this communication.
Great opportunity for you to speak a little about yourself, your pain, and why you really got motivated to get here. A person's story, I think, would really mean a lot.
Of course. So the reason I started my business is because I live as an expat, as I said, and I don't speak the language of this country that I live in. In the first month I moved there, I got really sick. I was admitted to a hospital. I didn't speak the language. I needed an interpreter. It was really late at night. No interpreter was available, but when the interpreter actually finally showed up, the doctor and the interpreter spoke for 10 minutes, and then they looked at me and said, "You're fine after 10 minutes. It's gonna be okay." I kid you not, because I am from a medical background, I'm a clinical pharmacist, so I understand some medicine. Clinical pharmacists were good. So I pulled up my chart and I looked at the lab results that just came in, and I realized I was actually having a miscarriage. And I've been bleeding for 2 days and I didn't know. So at that point, I said, no, this got to change. This country, in the US, language access is a right. It's a law, it's a legislation. But in other places in the world, it's not. And as 360, actually, our vision is to make language access a global right. Because if I cannot communicate what I'm going through to my doctor, and my doctor cannot reassure me, be it physically or telehealth, I'm not going to be able to pass this emotional and mental distress that I'm going through. So that's
great. And I kind of completely relate in terms of not having access, because while you have the doctor and the patient together and you're not able to communicate, that is a barrier.
Yes.
You want to talk a little about the barrier or the event that you went through in your personal life and what motivates you in this particular time in terms of bringing innovations to health, Karen?
Yeah, sure. I feel like for me, understanding that the health field, as everyone here knows, is really static. It doesn't change a lot. And what COVID showed us, by the way, I think fintech and transportation changed so much in the past years, but for some reason, we at the health field stay really static. I think what COVID showed us, COVID just accelerate an inevitable process that will have happened no matter what. I think we all understand that new challenges will always come every few years, and we need to be better prepared than we used to be. So speaking about telemedicine, yeah, for us, our model is to be really efficient, not letting people wait in the waiting room where they're exposed to germs. Waiting for days and sometimes months to see a physician to consult with, so, or a blood test, they can wait for hours. So what we do, how we implement technology in our technological emergency room is basically a patient come to us, he or she sees a doctor, they get really fast blood tests. We have two. We have MIMED or SITE. I'm not sure everyone is aware of that, but these are two blood tests that can provide answers between 10 to 15 minutes. They can tell you if you have bacteria or you have something viral, and also to measure everything you need to know in your blood test. If you need to consult cardiology or any kind of field, you can do it by telemedicine. At that point, you can actually consult with everyone. We have the best people, the best professors to do so. And if someone needs to have their CT scan or any kind of imaging test, they can do it on the spot.
I'll pick it up from here, because what I hear from you is while you're there, what you want is quick access and effective, quick case taking in terms of what is the prognosis, diagnostics, what we can do to be able to move the patient into the continuum. So from a perspective of, I spoke about point of care devices, and I spoke about communication as well. So pulling all of that together, so what I think we need at the point of care outside before I can reach Dr. Ganguly is to be able to converge in terms of communication, in terms of information that is being passed on to the doctor, and to be able to interact between the interaction between the doctor and the patient, be it remote. We talk about remote patient monitoring today as one of these trends that are coming in now, post-pandemic. So the equipment that we talk about has to be, what shall I say, portable, extremely portable, accurate, and you talked about language barriers. So a little more use of iconography, where the community health worker who's not considered to be at the level of a nurse, but can understand icons, use her or his mobile phone, which is connected, to be able to screen and automatically send the updates to the electronic health records or the EMRs. So we talk about equipment which can be connected with your phones. We talk about Bluetooth, we talk about Wi-Fi, which can easily be operated within a low or a no bandwidth kind of environment. Because today, in the developing nations, when we talk about base of pyramid, we do talk about fundamental enablements like a 2G signal or 3G signal. We talk about 5G, but that's much later. But if we can communicate, if we can screen patients, and then update this so that the doctor can see remotely. And then, of course, there is a video interface, there's EKG or ECG interface, there's trends available. All of that, the doctor can effectively at least guide the care provider or caregiver at the point of care to be able to save that life during the first 10 minutes or the first hour. So that's really where I see digital transformation transforming care delivery at the last mile. As far as the digital transformation across hospitals, across equipment is concerned, that is for the big corporates to do. But innovation perspective, innovation per se, needs to come in outside of the hospital towards underserved communities. That's my point of view.
Yes.
And that being said, unless you guys want to challenge me,
Actually, no, I just want to add also that telehealth has improved the quality of care that the mobility impaired patients are receiving. Mobility impaired patients, they existed pre-pandemic, but they weren't able to get the care. As a massive increase in their quality of care has been reported post-pandemic, and that's because of telehealth.
We got out of it and we're sitting in the conference, so
yeah.
Very good. So now we come to the last part before we conclude, and I'm sure there's going to be people going to be telling me about the time here. So we now want to talk about the importance of collaboration. We talked about the challenges, we talked about digital transformation. And now I'd like to hear Dr. Ajay's perspective on collaboration. There have been questions, there have been challenges.
And we're all trying to work towards making your life easier, so.
How we can bring it together to be able to sort of create impact, improve the patient experience. And that's really what matters, is what I think. So, Dr. Ajay.
It's really interesting and important to understand the way health has transformed from interaction between a doctor and a patient to a healthcare team and a patient. It's no longer really one person doing something. You got the diagnostic services, you have the other paramedical workers, and invariably there are multiple doctors who are generally treating every patient. Obviously, with this, what happens is the concept of collaboration, because it is a multidisciplinary system which is treating a patient. It's, again, very critical to understand the difference between a multidisciplinary and an interdisciplinary. Multidisciplinary, we're talking of multiple teams involved, but the decision-making is possibly likely to be with one person or with one department. Interdisciplinary, where each department is doing their bit to make the patient better. This does create a little bit of a legal issue because at the end of the day, very often it's one department or one person who is responsible for the care of that patient. This, I think, is a discussion for another day because each country has its own take on how this happens. But the take-home message from this is that since there are so many departments or teams and people involved in care, collaboration between them is key to making sure that the outcome is good and that the patient goes home happy.
Absolutely, absolutely agree with you, and thanks for your perspective. So that's really what we want to take forward. So, Reem, you want to talk a little about your perspective on collaboration?
I couldn't agree more with Dr. Ajay. It's, at the end of the day, we are shifting towards, there's a paradigm shift towards the patient-centric. It has always been a patient-centric, but the pandemic has opened our eyes so much that healthcare, as Karen said in the beginning, cannot just stay an offline hospital, a patient coming in, going out, and that's it. Every day, every minute, every second, there's a lot of patients. And there's a lot of patients with with a wide spectrum of problems, from the mobility impaired to the language limited proficients, to people who are with disabilities, to people who have speech also impairment. Speech impaired people are facing a lot of problems, even using interpretation, and they need, in the same language. Interpretation is not about from one language to the other. It could be from a dialect in the language to the other. It could be from a problem to the other. It could be ASM, like sign language. There's a lot of types of interpretation in the medical sector and other sectors too. So this is where we come in, technology comes in, this is where the digital transformation comes in. I've recently heard about an innovation, someone is trying to create an interpretation AI to actually help these stuttering patients. It's an AI that interprets from stutter to regular speech so they can communicate more effectively. And since that shift in the mindset of people that healthcare now has to be an innovative, and not only innovative in clinical trials and this and that, but in technology, I believe the patient is reaping all the benefits at this moment.
Fantastic. Could you talk a little about the solutions that you have, given the pain that you've gone through? A little about your solutions that you brought to the impacted people?
As 360, as I said, we are a language solution provider. So as a language solution provider, we offer any linguistic abilities, not only to the medical sector. I'm here as in the health conference, so I have to talk about medicine, but we actually do help also businesses, because the communication doesn't know a sector or a vertical or a domain. It's in everywhere. This is our day-to-day. We talk for a living, most of us, so we need that. We offer this We offer this interpretation, consecutive, simultaneous, whisper, any type of interpretation, basically, in any domain. During the pandemic, also, the remote simultaneous interpretation has picked up its need. Conferences were all now online. Now the borders are becoming just a line on a map. Like it's a global.
It's that much.
It's that much, exactly, you know, so it's just a line, you know. You could be here attending a conference in San Francisco. Someone here was from San Francisco, I heard. Yeah, hello. So I could be attending a conference at this moment from San Francisco without any problem, and someone who, or in Japan or in China, and I don't speak their language. RSI technology has improved that I can just tap into that conference and now hear it live in my own language.
Awesome. So it's all about collaboration. I'm sure she's brought out a perspective. There's plenty in the audience who would like to kind of catch up with you and the work that you've done. I understand that there is trust and vulnerability from what Dr. Ajay and you have brought out. Talk a little about collaboration from a trust and vulnerability of the patient perspective, Karen.
Thank you. I think in matter of collaboration, first of all, there has to be trust, right? But I guess I heard there's a lot of representative from different hospitals here in the crowd, so I do want to convey this message. In terms of economic models and the way we will see how the medical field will run in the future is only through collaborations. I guess that in everything that has to do with health, we're really conservative, especially hospitals, and hospitals needs to know that in order, at the end of the day, we all have the same incentive, right? We all want to provide good care for patients. We all cherish and understand how crucial it is and how fragile our lives is. So I guess if you guys have to take something from this panel, please take this. Be more open to collaborations. I met so many CEOs of different hospitals in the past 3 years, and everyone say, yes, we understand, but honestly, no one actually willing to be open-minded. What we did in the past 3 years is we took one of the best hospitals in the world, in the top 10, and I was able to get them understand the importance of collaboration with technology. I researched so much about everything that the health ecosystem has to offer in terms of technology. We chose the best of the best, and we actually created a beta site. We have a beta site in the north, in the periphery, and we tried to learn from that. We developed a system that shows how crucial it is, that development. Once you have the support of a hospital and you have someone that actually done the research and know the best technologies, and there's no compromise in terms of the services, then just one last thing, then the patient, and that's what we all want, at the end of the day, will be happy and we can actually save lives. So the collaboration is crucial.
Fantastic perspective, and thank you very much. Quite an emotional appeal to the audience here. What we understand is there is a structure, but the structure is loose. We talked about hospital settings. We talked about ambulatory clinics. We talked about patient vulnerability. We talked about trust. But we also want to be talking about the gap, the care delivery gap in the last mile. We want to be talking about how we can bridge that little gap outside of hospitals through community health programs in a public health setting. So we definitely want to be focusing on that as well, because most of the developing nations, as brought out by the World Health Organization, there's 57 countries which we've just passed the Universal Health Coverage Day on 12th of December. There's many billions of people who do not have access. We spoke about access. We talked about how we can reach the last mile. So collaboration has got to be starting from that point within communities, coming to clinics, then coming to hospitals. So there's a huge gap there, and there's the basic pyramid still does not have basic access. So I appeal that we collaborate to be able to reach those, both from a preventive perspective or a curative perspective. So there's a lot that needs to be done. And while we sit in this august company, there's a lot of thinking people here. We definitely want to be appealing to them to be looking at the last mile and looking upwards. So with that, I think we'll come to a conclusion. There's been takeaways. There's been emotional appeals, which you guys have heard. So I think I will open it up for a Q&A session now. Is that okay now? Yeah. So you're welcome to ask your questions. Address it to the panelist that you want the question to be answered by. and we are happy to be answering questions.
Round of applause, a great panelist. Come on, guys. Okay, cool. Thank you. Thank you. A lot of information there. Collaboration is key. Collaboration is how you grow your business fast. And I want to open it up for people in the audience to start engaging. I'm here to light the fire to make sure everyone can. I see hands already going up. There's a microphone they put in the middle of the room. If you don't mind just getting up and coming on up to the microphone, I want to invite you to move and be a little active. I mean, we're talking health. You got to walk 10,000 steps a day, and I want to get you there to be more healthier during the next 3 days, okay? So come on up. Ask your question on the mic. Good morning.
Yes, good morning, everyone. I want to congratulate you. It was excellent, excellent panel. My name is Dr. Ludmila Schaefer, and I'm a medical oncologist. So I see patients every day, and thank you for doing this. One obstacle that we see is insurance. In the current healthcare, we have a lot of financial burden. And when we invite interpreter, first thing also we ask, what's covered by insurance? How is going to cost to the patient? Can you please share your perspective, or maybe we can hear internationally how we can help our patients? Thank you.
This is very true. One of the problems that people don't get language access for or communication access is because of insurance. I guess we should do better, but I honestly don't know how.
Dr. Ganguly is a CEO of a hospital. You want to share your views on it?
The financial burden of care is something that I think across the world is an issue. In our hospital, of course, since we do a lot of charity work, we generally tend to cater for the patient. Whatever shortfalls are there, we generally put in and manage. I think the WHO has been speaking about the financial coverage for patients, because obviously giving great care is a cost. And how to do that is something that is a struggle. A lot of countries are talking about it. Obviously, insurance or HMOs are one of the ways that it happens. They have their own constraints and on the limit to what they go. From a, I think, accessibility point of view, what we're looking at is 100% coverage for all people. I think as of now, that's still a goal to be achieved. It's something that we're not there yet.
Yeah. So
it is increasing. I think the WHO is estimating by 2050, they're likely to get more than 80% of the global population who will have some sort of coverage. And if that really happens, I think that's a fantastic step. I think it will obviously cover aspects which includes interpreters.
Would you want somebody from the audience to answer
I think
that?
we all want to hear whoever has the knowledge, right, to answer some of these questions that are going to be brought up today, right? So is there anyone in the audience, just show hands, if you have direct connection to insurance issues and concerns, payment processes, and how that actually you do. I got a hand back there. I'm going to come over to you or welcome you up. Come on, let's get those steps in and see how you can help answer this question. Yeah, please introduce yourself. We'd love to know who you are and help share some of your expertise.
Sure, thank you. I'm Jignesh Bhuta. I'm currently the COO of Smart Future. It's a health tech company based in Singapore, but I essentially have about more than 15, 18 years of experience in health insurance, different aspects of health insurance. So I thought probably this is kind of just relevant to kind of give my 2 cents. Fundamentally, there's a lot of negative connotation associated with the insurance coverage. And the sense is where the policy needs to pay, it doesn't really pay. One of the ways to tackle around this, and specifically for the question with regards to the translation, it's as simple as this. If you're able to demonstrate with the translation, A, better patient outcome, B, savings in cost, and C, the operational efficiency, the insurance or the third-party administrator of the insurance will actually cover it. And I've seen this I've seen this model working in a couple of countries in Asia. It is not as smooth as one would like it to be, but it does engage a fair bit of communication. The positive point is, if today many stakeholders are open for kind of ideas and open to kind of willing to test what you're willing to promise. So in that sense, I think the future is hopeful. The future is bright. It just takes more communication in terms of just establishing this and get it covered under insurance.
Thank
Cover
you.
interpreters, please.
Sorry?
Cover interpretation, please.
Yes.
Please. It's not a luxury now, so please do that.
Absolutely.
I do also, if that's okay, just want to answer about, the physician for, I completely agree, and that can be extremely frustrating. I think that the answer relies in the fact that we need to change the economic model, and I think technology can do that. Technology can provide services that can cost less, and therefore all the HMOs can provide better services and cover more services for people who actually needs that. I personally, I work a lot with people from the health ministry to try to do exactly that. We try to build a model that will be extremely efficient so there can be more money to cover other treatment. I know every country is different, but I think we can all, once we implement technology and understand that that can be really, can save a lot of money, then the budget can go to people who actually need it to provide better services in other fields.
Well,
Good luck, it is a struggle.
Yeah, I hope that answers Dr. Schaefer's question. Thank you very much. Any other questions?
Yeah, come on up. Come on up. First one to the mic wins. That's how we're going to play this. Microphone, is it on?
Can you hear me?
There we go. We're ready.
First, my name is Dee Katz-Shachar, and first of all, I want to say thank you very much. That was a very thought-evoking and provoking panel, really. So, like Karen, I come from Israel, and I have to say that we're very lucky. Also, like Dubai, the state really provides very, very good care. One thing that I noticed on myself is that I now tend to choose to see doctors online. Also for my daughter, also for myself, it's very easy. I go online, and I do want to address the issue as a public health promoter of digital orientation. The people who need the care most have trouble the most with internet and digital orientation, like I just said. So I think that not only covering interpreters, which is so crucial, and also in our country, we see, in Israel, we see that it is extremely crucial. It's the difference between life and death, interpreters. But also, it is crucial to teach people how to actually push the buttons on the most basic level. So if you have anything to add to that, I think that's also very important. Thank you.
Appreciate that, and appreciate that point of view. Thank you very much. Sorry, you want to say something?
I was saying, actually, you were talking about that. I believe that this is something that you are working on.
Yes, while I'm working on it, I'm hoping that it is being addressed globally as well in a public health setting. We spoke about how the community health worker would be at ease from a user experience perspective to be able to use the equipment on hand, to be able to kind of screen as well as medically help the patient within communities. Thank you so much.
I'll just add to that. Actually, the surprising burden is the switch that is happening now from communicable diseases to non-communicable diseases. And the cost impact of non-communicable diseases is actually much more. It's a longer treatment program and affects everything, right from the equipment and the treatment that is necessary. That's something I think as a global population we do need to look at.
Absolutely, and I see another question from Dr. Sora.
Yeah, I just, I'm sorry, just want to say one thing. It's an amazing point. You're absolutely right. What we're trying to do is we actually provided a room that people that struggle with that technology, and there are so many people, whether it's a matter of education or age, then they can actually come to us. We have people that will put everything in front of them and then can sit in front of the TV and consult a doctor, but we also thinking about maybe providing hubs all over the country so people can come and get that assistant technology and consult a doctor. That's an amazing point. You're right.
Yeah, that's the hub and spoke model, which is in vogue right now. Yeah, absolutely agree. Thank you.
Microphone. Sorry about that. Hold on. It's not on. Mic, please. I'll try it again.
Good morning, Dr. Sural Rawas from the Sultanate of Oman. Thank you for a wonderful panel discussion about a very important topic. You mentioned some really good points about collaboration, and I wanted to highlight the point you mentioned about the economic model and to really advocate for value-based care. As you've mentioned, with universal health care, you have alignment of interests between the population and the healthcare providers, right, and the healthcare service industry in terms of everybody wants to cut low costs of care and have high value care. So how can the private practice industry benefit from the same thing? How can you have private partnerships with insurance companies to bring this value-based care model so that the economics bring alignment of interests and create win-win situations? And what I would love to see, one of the outcomes of this conference to be, is to see more collaboration between the insurance sector and private hospitals and really see how we can bring the value-based care model into the private healthcare, where the alignment of interests benefit the patient and the money being spent brings high value to the patient. And I think that will really help the digital transformation component by creating win-win scenarios. Thank you.
Absolutely agree, Dr. Sora. Good point.
Great.
Yeah, I think that was a statement more than a question. This is a call for what we should be doing.
Call to action, yeah.
Yeah, collaborate. The takeaway is the keyword, collaboration. Everyone should collaborate on everything for the best interest of the patient.
Absolutely agree.
For the future, we got another question coming up.
No, this is just a comment.
Okay.
My name is Sanjeev Sahani, and I'll change the prism now. I'll come from the equipment side of the topic. You know, between the suppliers, the providers, and the payers, there has to be a very strong integration. I've spent 40 years, and I got in about 4 to 5 new therapies in the country and the region. In 40 years, I have not seen technology has ever brought down the prices. It doesn't. Providers want to upgrade themselves and they want to get the best. It'll not get you profitability. It'll give you investments only. Suppliers have to research over the years to come with a new equipment. And insurance will not pay from their pockets. The challenge is still there. When we say value-based pricing, I think we have to treat the supplier community, the provider, and the payer who monetize together and see them as one entity and not as 3 entities. It is not easy to bring in the best technology at the cheapest prices and all 3 remain healthy. It is not.
No, yeah,
Thank you.
That's a great statement, as well as a great learning coming from Mr. Sanjay of 40 years of experience. And believe you me, I share the pain as well, because like I said, while I am a veteran and otherwise a business person now into health and med tech, the one point that I want to bring out here is collaboration. Actually, if you're talking supply, of course, that's another question. But if I'm talking innovation, if you are breaking ground, then there is collaboration at the design, from a design phase. And when that design phase collaboration comes in, there is a clinician, there is a tech person, and then there's a business person. So I'm hoping that, and if your products and services are a solution or filling a gap, I definitely think that there is willingness to pay. Depends on who pays, that's a different question. But yes, value-based pricing is something that is definitely, depends on the value that you bring in. and most of the players are the governments or the public-private partners. So.
Thank you.
I'll just add on that. Actually, what he said again emphasizes the fact that non-communicable diseases are the ones where technology and equipment it's making a change, obviously, in the way things are being treated, but it comes at a cost because the equipment is expensive. I think somebody else spoke about efficiencies. So from private care, we are trying a lot of methods to make the whole service efficient, trying to reduce wastage. Of course, the drawback is that with the number of people involved and again, the fact that healthcare is personal, so each patient has something slightly different.
Absolutely.
So actually bringing a factory line system doesn't really work out. Ultimately, it does need to be customized for each patient. It's something of a challenge. You do need better equipment to treat patients, and that's something I think that is going to continue. I don't see change happening very quickly. It will need a lot of possibly government intervention to find some kind of solutions to this to make sure that it is accessible for all.
Exactly. Thank you very much.
Thank you very much. And let's give them a round of applause. Final for our first panel of the day, talking about overcoming challenges. Thank you, guys. Well done. We're going to see some of these faces up here again in the next couple days, but I would like to invite you to go back and take your seat as we continue our program. We are streaming live on YouTube, so if you haven't shared the link, you can find it on YouTube, Health 2.0. I see that someone's already posted on LinkedIn. I do want to recommend, come on. Oh, they're going to do a picture in the meantime. Who posted on LinkedIn? Where are you? Where are you over there? Okay, we got it. Make sure you're using that hashtag. Make sure you're following our page so that everyone else can see you. And are you enjoying hearing who people are in the room? Who are the people sitting next to you, right? I want you guys all to walk away going, I met so many people at this event. That's really the great opportunity. Well, next on our agenda is actually what we call our recognition. This is a time in the show, we do it 2 times a day, to recognize the experts that are here in the room. This is an incredible opportunity for each one of you that gets on the stage to take 1 minute, and I'll cut you off if it goes longer just because we have a packed day, but really 1 minute to introduce yourself, who you are, and I want you to think about what is the value you bring to the world. It's a big ask, but what is your value when you're up here so that everyone in the room understands how they can really engage with you, how they can ask questions during the breaks, and what they can really talk about so that you can really highlight that very simply. I like to call it the elevator pitch. If someone's in an elevator with you, what are you going to say in 1 minute? So think about it so that you can be really to the point and strategic when you get up here and your name is called. So without further ado, we're rethinking the healthcare landscape. You're here. If you come on in. I did hear a telephone, so I'm going to remind you, put those ringers on vibrate, please. You know who you are? I will find you. Okay, if it rings again. So put those ringers on vibrate. I can't vibrate the baby, unfortunately, but welcome. We got people of all ages here in the room today, and it's so nice to be a part of the healthiest room in Dubai, no doubt, right? Okay, so as this industry grows, it's important to recognize everyone, and coming to the stage next to award everyone with me and present these awards is someone from the luxury real estate industry. So Samina Chowdhury, is she here in the room? All right, great. We're going to bring her up to stage. The luxury real estate agent of Keller Williams Lucido Agency. She's going to come and award some of these awards. Come on up to the stage with me. We're going to just start calling out the award winners for their recognition of what they're doing in the healthcare industry. How are you? Good. How are you? Nice to see you. Nice to see you. Yeah, thank you. Okay. So the first winner, I got a long list here. It's going to be exciting. Your hands might get a little tired, but as I say, it's good exercise. So the first award person of the day, we're going to invite up to the stage. First, Hazel Khan. Hazel Khan, are you up here? All right, we're going to invite you up to the stage, please. Presented by Hazel Khan, the Astor Hospitals UAE. Come on up to the stage. You got your steps over there. Hi, I know this was a sudden welcome. Come on over here. I just got to change the things, but I'd love to just invite you. Thank you so much for coming. And I'd love for people in the audience to know what Aster is. Do you mind giving a little brief overview of what you guys do here in town?
Sure. So hi everyone, good morning. So I am representing my organization, Aster Hospitals UAE. So we have been in business for the last 36 years. And we are, as an organization, we believe in, we'll treat everybody well who comes to our hospital or the clinic. So we are an organization wherein we believe that, we want to give accessible and affordable quality healthcare. So we are catering to each and every economic segment of the society, just to make this place a better, to give treatment to everybody who comes to our doors. That's what Aster is. Thank you.
Wonderful. Well, we'd like to award this to you. We'll take a minute. Step in the middle of the stage, please. We'll take a picture. Okay. Please step in the middle so we can grab one picture. Everyone's getting an opportunity to just talk about what you're doing, and this is a great way. You want to go over and please present her with the award so we get a great photo shot. Everybody that does this, please do share it on social. This is part of your credibility journey of how people are going to trust you and what you do, right? Because this recognition is not easy to get. So well done again. Thank you. And at the end, we'll invite everyone up to the stage. Thank you. Thank you. All right. Next to the stage, I'm going to invite Ravi Ramaswamy up to the stage for our next recognition award. Welcome.
Hey, good morning, everybody, friends and the organizing committee of the Health 2.0 conference. My name is Ravi Ramaswamy. I have been in the healthcare domain for close to about 40 years with GE, and with my last assignment was with Philips, where I was running the health systems innovation team out of PIC in Bangalore. What I have been sort of striving for was affordable healthcare, which serves the quadruple aim in terms of enhancing patient satisfaction, enhancing the caregiver satisfaction, driving positive outcomes, and also lowering the cost. Been over 70 countries to understand the on-ground implementation of healthcare solutions so that we can come up with products and solutions which really make a difference and impact life. Post my retirement, I am a consultant to several global organizations in terms of strategy and diversification program in decentralizing and federating healthcare. Thank you.
Okay. All right, one picture. Thanks for everyone's patience as everyone gets their moment to be a celebrity. Right, all these pictures, paparazzi. As I say, we're streaming live, so it's great to share with everyone you know to watch you on stage. Come on in as we got latecomers. Thank you very much. You can come on this side. I'd like all the people I announced to come up on the stage from that direction and walk over here so we can just do it seamlessly. Next person up, Abdulaziz Turkey, come on up. We want to recognize you and what you're doing for the industry. Abdulaziz. Oh, he's coming from the back. He's coming from the back. All right, I feel like it's Academy Awards. We should have music, as people make their entrance, right? But it's a great opportunity to, once we don't have everyone's name up here, but once they talk about who they are, I encourage you to connect with them at the event. Come on in. We got lots of seats throughout the panels. Come on in. All right. How are you? Come on over, yeah, and then we'll give you your award.
Good morning. Okay, can you hear me? Sorry. I'm not good with the speeches, so I apologize. So I'm a chief operating officer in Saudi Arabia for one of our medical care facilities. It's called Integrated Medical Care. What I bring to the table is actually, I'm not from the healthcare industry. I wasn't. I come from a management background. And probably that was my added value. So having a different perspective at looking at things. And in probably 3 years, I made a significant impact in the healthcare industry. And that is what I bring to the table. So congratulations to all of you for doing a great job. And that's it. I think that's everything. Thank you very much.
We'll go give you your award now. Okay, thank you. She's going to give you your award right here. Great. this way. Thank you. Hello, hello. Oh, there I go. I got technical difficulties. You see what's going on here? Okay, guys, keep the microphone on for me, okay? So I can help everyone during this process. If you feel too stressed to get up here, what's my value? A lot of pressure, right? I don't want it to be pressure. I starting out the event, Health 2.0.
To have accessibility of one of the most important things we have, that is health. We are here for a reason, to make the difference, and on my specific field is to make difference on women's work. So to give them tools to improve their daily healthy lifestyle. So I would like to dedicate this award to the 40,000 women that have decided to be part of my experience, and to all my team that is working hard every day to achieve results. So thank you so much.
Well done. Come on over to the middle of the stage. Okay, amazing. Who's following her on LinkedIn now? Interesting. When people are making an impact like that, great opportunity to get there. Share your business. Upbeat kind of thing going on, don't you think? All right, just, I hate to be the police, but I kind of feel like sometimes the host has to do that. Again, we're going to invite you up from that side, get you off on this side, get you guys to do a nice loop. I'm making you walk 10,000 steps today, whether you like it or not, okay? We're the healthiest room in Dubai. Next person I'd like to bring to the stage, Cinderella. Come on up here. It's time to be recognized. Let's find out what she's here to do and get done at Health 2.0. The hashtag we're using is hashtag Health2Conf. Who used it? Anyone use it yet? All right, well done. Well done. Anyone using it, I'm going to call you from the microphone, find out exactly how you're impacting this industry. Come on up. How are you? Welcome. I know all the way from the back of the room. How you doing? Did you travel to come?
Thank you. Hi, everyone. My name is Cinderella. Fairy tale name. Thank you. I'm happy to see all of you today. I work in Salamati Home Health Care. I'm the Chief Nursing Officer. So, as per today's discussion, we take healthcare to the client, to their home. Every health solution that you need will come to you, either at home, hotel, gym, or office. We do all kinds of healthcare solutions. So, I'll be happy to meet whoever is interested today.
Wonderful. All these professionals. Looking great. Okay. Thank you. We're streaming. Come on over behind me. Thank you very much. Hello? Okay, I'm still here. All right, next person up. Can I invite to the stage Anasur Rahman? Come on up to the stage. It's time to be recognized. Thank you very much for being here. It's great to have you in the room. All right.
Hello, everyone. It's very inspiring to come over here. I too don't belong to the medical background, but I have recently joined a company called Eon Dental 3 years back. It's a aligner manufacturing company, and I'm a director of revenue operations over there, working on changing the way the operation works with the data, the infrastructure, the SDFC, as well as I'm also working on the marketing stack. I'm a digital marketer by profession as well as a business operation. I have a decade experience over changing the infrastructure in general for operations and marketing. You know, very excited and would be helpful here in 3 days. You know. Thank you.
Great, thank you. All right. Smile for the pretty camera. This is really a great opportunity to just be recognized. And there's nothing better than having an award to really say, you know, well done. Oh, wrong way. Whoop, there he goes. All right, so I think we're gonna change this up a little bit to make it flow a little bit better. I wanna make this work for everyone. Next person I call up will ask you to just accept the award, take the picture, then get to the mic, and then go down. That might work. We'll flow a little bit better, okay? I wanna make this work better for everybody. Next person onto the stage, please, can I invite Dr. Henna Kutty. Dr. Henna Kutty, come on up. There's no doubt if something happens and you need a doctor, this is the best place to be, right? How many doctors in the room? All right, well done, well done. As we welcome the first doctor on the stage for the award recognition, give her a round of applause while she accepts her award, okay? Then we can take that picture for the paparazzi. Well done. Okay, come on over here. We'd love to know, what kind of doctor are you? Come on over to the microphone for a second.
Good morning, everybody. It's a pleasure to be surrounded with a room full of, innovators. I'm Dr. Henna. I'm an American board certified lifestyle medicine physician. Well, today I'm in a room, I'm hoping to meet people who believe in the idea that lifestyle medicine could pave a way to digital health. Because we, as physicians, I think I've been a part of a community where we believe in risk management. That's where the insurance companies are all working towards. But I think it's time that we change our perspective and look towards risk prevention. And that's where the digital and health technologies could come in. I'm looking up to collaborate with companies who could help me take the technology on board to empower my patients for a better health outcome. Sorry about my voice, very bad time to get laryngitis, but thank you. Have a nice day.
Congratulations, awesome. I like that. She has great delivery about what she's looking for, what she wants to achieve. Didn't you enjoy that? Now everyone, who wants to talk to her after we break for lunch? Oh, we got a couple hands. See, this is great. We're gonna make the most out of this event in the most effective way. Next person to the stage. Can I invite another doctor, Vivek Lan? Come on up to the stage, Vivek. Round of applause. Wonderful to have so many doctors here. Feeling a little bit celebratory, maybe similar to a high school graduation, right? This is a big moment. This is recognition you could use for a long time. Thank you for being here and congratulations. Okay. Well done. Come on over to the mic. It's your turn to shine.
Good morning, everyone. I am Dr. Vivek Lal from Ambujanagar Multi-Speciality Hospital in Gujarat. And it's a privilege getting this honor here after almost 33 years in healthcare. So I've been into hospital leadership also and in medical academic leadership also. Currently, we are working in this Ambujanagar Hospital, which is, I think it's a very noble task of providing affordable healthcare in a very semi-urban setting. So I'm thankful to the organizers to give me this chance to come here and kind of highlight the services that we are doing in a semi-urban setting in India. So thank you so much, everyone, for this honor, which is a privilege. Thank you and have a good day.
Okay, moving along. Next recognition is going to go to OP2 Labs. Come on up, Eric Pillard. Give him a round of applause. OP2 Labs, you got to know your data, right? You need to know what's going on. Every human's different, so really nice. He's coming from the back, so I'll be up here for a while till he gets here. I promise you won't get sick of me by the end of the time that this event is through. We're going to have fun. I hope you're enjoying. Thank you, Eric, for being here in OP2 Labs. It's great to find out how you're affecting the industry of health. Well done. All right, give him another round of applause. It took a while for him to get up here. Hands got tired. Well done. Congratulations. Okay, we're good. Well done. Congrats.
Appreciate being here. We are a clinical nutrition company looking to engage with healthcare professionals that are having issues with wound care. We produce a product that when we started out, we really wanted to bring the most powerful protein and most effective wound care product to the world. We've been in business about 25 years now. Really our compliance, our outcomes, everything else are greatly improved with our product. Currently shipping to 5 different countries right now. We're going through regulatory approval here in the Middle East. And again, we appreciate the recognition, but more importantly, we want to engage. We want to get our product into your hands so we can, improve the overall well-being of your patients. So if that's something that interests you, I'll be here all week, and definitely come back and introduce yourself. I'd love to meet you, and again, appreciate you. Thank you.
Well done. Okay, next on the mic is Dr. Dirk Svens-Kitcher. Please give him a round of applause. Come on up here, recognized for what you're doing in healthcare. Health to come is that hashtag, right? If you see somebody, well done, come on up over here. If you see somebody you want to connect with, it gets busy out there during break time and coffee break. So you may want to take a picture, make a comment, right? And then they'll recognize who you are. You are who Google says you are. Well done. We got paparazzi shots before you come over here. Well done. All right, come on over. As we're streaming live, we want to keep on moving. Come on over. Hi, doctor. How are you?
I'm fine.
Congrats.
Pleasure to meet you.
Here's a microphone. Tell us what you do.
Hello, I'm Dirk. I'm very exciting, and I'm glad to be here. So thanks so much. And I'm a bit less economic health economist, but I'm really from the base. I'm a nurse, and that's the reason why I'm here. So I'm fight for the staff shortage. It's very important, because I think we need to change a bit from the economic side, from the efficiency to the human side, to keep and the stuff here. What is better, searching for new stuff or keep it? And what is cheaper? I really want to pronounce it's cheaper to retention management than and to keep this stuff. Nursing stuff, it's very important also, is a system relevant healthcare, also from the nursing staff. Physicians are important, but also the nurses are important. To keep them, in my opinion, that's our biggest task for the future. That's the reason why I'm here. So I'm nice, and I'm very happy to be here.
Yeah, great.
So thanks so much.
Thank you, doctor. Okay, keeping nurses, that's what he's talking about. Next person up to the stage, we're going to go quick. I know it's exciting to get on the mic to start talking, but we got to keep it short so we can make sure everyone gets into the agenda today. I don't want people waiting too long, so thank you ahead of time for your understanding. Dr. Faisal Rahman, come on up to the stage. It's your turn to shine. Dr. Faisal, are you in the room? Oh, there you are. All our award winners today are coming from the back of the room. Taking a while to get here. They'll be here shortly. And like I said, it's great to say, this is who I am, this is what I'm doing, and this is what I'd like to get done while I'm here. Those 3 ways of letting us know is a great way to connect. Give him a round of applause while he takes the stage. Paparazzi moment to shine. Dr. Faisal Rahman, making waves in the healthcare industry. Well done. Come on over to the microphone. I'll give you a minute, actually less than a minute, as our timer is moving fast. How are you? Okay.
Hi, good morning, everyone. My name is Dr. Faisal Rahman. I'm from Dhaka, Bangladesh. I'm the Chief Operating Officer of a chain of primary healthcare units all over Dhaka city and 2 other cities in Bangladesh. The objective of getting into primary care was to reduce the burden of people going into hospitalization, because our country does not have anything whatsoever regarding medical insurance. It's less than 1%. Everything is out of pocket. So the objective was stay healthy, don't get admitted, it's less of cost. Thank you so much. And thank you to Health 2.0. Thank you so much.
Fantastic, thank you. Okay, next person up, Dr. Galit Godfarb. Dr. Galit, are you in the room? Okay, we're moving along. Dr. Najib Zahran El-Rawawi. Oh yeah, come on up to the stage. Dr. Najib, wonderful, straight from Oman, I can tell. Traveled very close by. Today we had Bangladesh, now we have Oman. I like to know how we're a global business here today in Dubai. Welcome to the stage. Please smile and take your recognition. All right, it's just going to be a moment. Hi, Dr. Najib. Come on over here. Let's find out. We're going to welcome everyone. Give them a second. How are you?
Thank you very much. I'm Najib Rawahi from Oman. I'm the founder of Arrhythmia Service in the Sultanate of Oman. I work now in National Health Center at the Royal Hospital in Muscat. We're happy to collaborate with anyone interested, and hopefully we'll see you all. Thanks.
Shukran. Okay, as we move, Dr. Yusuke Taminari, come on up to the stage. Dr. Yusuke? There you are. Welcome, welcome. Since you're come on up. Where's he going? Oh, someone take a picture of this guy. Dr. Yusuke needs a picture. We're going to give him the good professional ones. Everyone that gets up here is going to get the good ones from our photographers. But in the meantime, must be an immediate need, wife, child. Everyone needs to know what's happening and how you're being recognized. Smile straight ahead. As I said, there are streaming live so people can see globally what we're doing here in Dubai, making waves. Welcome, doctor. Come on over. How are you? Where'd you travel from?
Hello, everyone. So I'm greatly honored to receive this award. My name is Yusuke Tominari, CEO of Hymex. So actually, my daughter is a pediatric cancer survivor, but her hospital roommate didn't survive. And my grandfather and aunt were dead due to the lung cancer. So not only them, but also the 10 million cancer patients have exhausted all available cancer therapies and die. So this is because the 66% of disease-causing protein remain undruggable. So to pursuing the drugging undruggable target, we founded Hymex 5 years ago as a spin-off company from Takeda. So we our focused technology, the targeted protein degradation, can access to the undruggable protein by destroying the entire protein directly. So we have established a proprietary platform for the efficient drug discovery, and we have a confidence to deliver the drug candidate for the game-changing drug to broaden the cancer patient. Thank you very much for your kind attention and giving a great opportunity for the organizers. Thank you.
Thank you. Okay, next to the stage, Tushar Patnaik. Come on up, Tushar Patnaik. Give him a round of applause. There's my music. All right, I know each one of you has a personal story to share, and I love to hear them because this is how we connect with others. There's no doubt cancer has affected many of us, and we're going to hear how that actually conversation continues. As we smile for recognition, this is usually those catalysts that gets us involved with what we're doing and what we're meant to be doing, right, in our life. So I applaud you. Welcome, welcome.
Thank you, and good morning to all of you, and also to the organizing committee for organizing the International 2.0 conference. I think myself is Tushar Patnaik, and I'm heading a manufacturing company, FMCG company, is called Dabur India Limited. For the last 23 years, I'm in the field of health, safety, and environment and sustainability. To make a healthcare system which is sustainable, the backbone of that things is to make your environment and health and safety of the employees. And worked in this field for last so many years, and during COVID time also we served to the entire country and the nation, and also working very passionately for this profession, and also helping people not only in terms of making a good environment and also health, but also advising many of those industries to how to make an healthcare system as sustainable. And I'm in India also driving one of the major component which is for the sustainability is called the waste management, which is also backbone for the healthcare systems and driving across this pan-India for the last 3 years. Thank you. Thank you.
Congratulations. Okay, we did, our presenter before, Samina had to go. She's on another panel. I do want to invite up the second presenter that's going to help give the rest of our awards this morning. Elsa Malouk, please come on up to the stage, please, so that we can get your support here with the awards. Give her a little round of applause. She gets to walk from the room. Welcome. We'll have a moment to hear from her later. As we continue, I'd like to invite Jignesh Batu. It's time for your recognition. Give him a round of applause. Jignesh, coming up to the stage. All right, little transition coordination we got going on. Okay, well done, well done. We're gonna ask you to smile to the paparazzi here as everybody online sees that this is your time to shine. Well done, Jignesh. Okay, and we'd love to hear from you first for a minute. Jignesh, we're ready to hear from you. How are you? Congratulations. How's it feel to win? Come on over.
Thank you so much. It feels great, and essentially, I'm kind of passionate about healthcare and do my bit in whatever capacity I can. So if any of you are looking for any digital health solutions, be it remote patient monitoring, be it telehealth, be it population health, anything at all, let's just connect. Thank you.
Okay, next to the stage for recognition award is George Kavalakis. Come on up here, George, right in the front row. Well done. Well done. I can't wait to hear what George is doing. Congratulations. And we're going to hear from Elsa momentarily to find out what she's doing as well. Everyone up here has a purpose and a role. Okay, paparazzi ready to shoot? And just look ahead, say hi to the world as they're all online watching you today. Take this recognition award for your input. Thank you again, guys, for a little bit more clapping while he's up here. Thank you for the support. Congratulations.
Hello, everybody. I'm very happy to be here. I've been more than 50 years in the healthcare industry, but I'm a tech guy. I'm the guy that brings drama, okay? So if you want anything about cloud computing, cybersecurity, or if you want to check if you can be hacked, come talk to me. Thank you, everybody.
Okay, next recognition. Can I invite to the stage Goel Jasper? Goel Jasper, please give him a round of applause. Smile to the paparazzi, come closer so we can get a good shot of you. Great moment to be recognized. Hold the award. Smile. This is your moment where all that hard work is really recognized. Well done. How are you, Goel? Shalom.
Thank you very much for this award. I accept it on behalf of my Finn Partners team in Israel and around the world, and on behalf of the incredible health innovation ecosystem of Israel. I want to acknowledge Ritesh Patel, my Finn colleague, who we'll all be hearing from shortly in the next panel discussion. Ritesh is one of my teachers. Thank you, Ritesh. I also want to congratulate the other award winners and say we're all in this together, all of us, because we are all helping to improve health, save lives, and extend life. My company plays the important role of communication about health innovation, and we know that each of us playing our role in health innovation will make a difference in the world. It also unites us all. Finally, I want to thank the United Arab Emirates for making peace with my country, Israel. It's for that reason that I'm able to be here today, and I truly believe that peace will play a role in helping Israeli innovation make an even greater impact on the world. Thank you.
Well done. Out of curiosity, who in the room's from Israel? I know there's a lot of Israelis. All right, well done. It's great to have you here. What an exciting time to be here. Next on stage, Tetsuya Nakagawa. Tetsuya Nakagawa, come on up to the stage. It's time to be recognized. As we move along, give him a round of applause. Well done. So I always say it's not who you know, it's who knows you. So now's the time. If some of these people really excite you, get in. Wow. All right, sorry. Wow, I guess that microphone was excited. Give him a round of applause. It's a great moment to stay up here. Can't wait to hear how you got this. Congratulations. You're welcome.
So much appreciated. So I'm Tetsuya Nakagawa, CFO of Ambis. Ambis is the largest hospice provider in Japan. So right now we have around 60 facilities. So we mainly focus on terminal cancer patients. Unfortunately, there is very few facilities which can accept terminal cancer patients, but we have very unique business model. So we are outsourcing the services provided by doctors and hire lots of nurses instead of that. So we are accelerating the opening plan. We have around just only 60 facilities, but in the near future, we plan to increase the number of facilities to around 300 facilities. So we strongly believe that so our existence benefits all the parties, including government and the local communities and the doctors. So given the shortage of doctors in Japan, I hope so our business model is a kind of reference to other countries which accept similar problems in the near future. So thanks again.
Thank you. Okay, we're moving along. Okay, and next to the stage, Jamana Atwani. Let's come on up here, get recognized. It's time, Jawana. She's coming from the back. It is a moment to shine. So we're looking forward to seeing everyone shine here. And as I was saying, it's not who you know, it's actually who knows you, right? So it's really important to make these connections here at this event. Well done, thank you. She has your award. Just look at the paparazzi. Take that picture that you can share professionally, publicly, digitally, for the rest of the world to see that you know what you're doing. Come on over here. I'd love to hear what you're doing. Congrats.
Hello, everyone. Good morning. My name is Jumana Atwani. I am the Director of Partnership and External Affairs at Evercare Group, and I am also leading on the Evercare Foundation. The Evercare Group is one of the leading impact-driven healthcare groups in the emerging market. We invest in healthcare to change the life of people there and to make sure they have access to affordable, high-quality healthcare. For 20 years, I have been working with the United Nations and also working with one of the largest health institutions in the world, the Global Fund in Geneva. managing health programs and investments in low and middle income countries, including as well in conflict settings. I was driven through my work and through my career by the passion to make a change in the life of others and to make sure everyone have access to quality health care. This is based on my personal experience. Today, with this recognition, I think you give me again a motive to continue on this path and to continue to help others to make sure everyone in this world have access to health care. I would like to thank my mentors, my colleagues throughout who are part of this recognition. I would like as well to thank Health2 and the award committee for all what you have done and for this amazing conference. Thank you, everyone. I look forward to working with all of you during these 3 days to see how we can work together to ensure health care is accessible to everyone. Thank you.
Well done. These missions are strong. It feels good to be here. Okay, next on the stage, Rohini Kasavan Kajiv. Come on up, get your award. It's time to be recognized. We only have a few more to go before we continue our agenda. Keep those claps going. Look, everyone's dressed up so nicely to accept this recognition. And you're right, these awards should drive you to the next phase in your life and your career. Well done. Well done. Okay. Well done. Thank you and congratulations. Come on over here. Let's find out what you're doing to get this award.
Good morning. My name is Rohini. I am from India. We have a mental health company, both digital and non-digital. We're here to change the social narrative around mental health. There isn't anybody here who can deny that they've experienced emotions. I don't want to take in too much of your time, but I'd like to tell you that the best thing you can do for yourself is to prioritize your mental health. Please turn over to page number 52 on the magazine, and you will have more details. You will have the QR code for our app, and you will know exactly what we do. So please join us in this journey to make life better for everybody, because there is no health without mental health. Thank you so much, Health 2.0 Conference.
No doubt. We see that in the media today. Mental health is taking center stage over and over again. So well done. Looking forward to hearing more. Next on stage, I'd like to invite to the stage Harataki Mazutani. Harataki, oh, there you are. Come on up to the stage. Time to be recognized. Health 2.0 has handpicked some of the individuals in this room as leaders of their industry to make sure that we can bring a really great content of agenda information from digitalization around this industry to more. So I hope you guys really enjoy it. We love to hear your feedback, and it's great to have that opportunity to be recognized. All right, come on over, come on down. We'd love to hear more from you. Hi, congratulations.
Good morning, everyone. My name is Hirotaka Mizutani, CEO of One Step Beyond Company Limited in Tokyo, Japan. I'm doing management consultant to support small and medium enterprises in Japan, including our healthcare industry. My strong aspirations is to encourage and motivate small and medium companies in Japan to be globalized and to connect healthcare industries in the world. Thank you very much to be honored today.
Moving along, we got Najib Khaba. Come on up, Najib Khaba. It's time to re-recognize. Give him a round of applause, please. Thank you, thank you. All right, paparazzi ready? Okay, take a couple of pictures. Smile to your family and friends online. Well done. Come on over here. Congratulations. How'd you get this fabulous award?
Hello, everyone. I'm Najib Shabam from Morocco. I have spent my last 26 years in manufacturing good drugs for the Middle East countries. I'm working for GSK since that, and in the last 15 years, I have been growing teams and growing people to deliver the best of what they can do to give drugs in high quality to all people needing this to be better in their life. Thank you.
Okay, moving along. Mr. Mark Levitt, come on up here. It's time to be recognized. I saw your hand go up. Traveling from Israel, probably first time in Dubai? Second time, okay. Fantastic. Health 2.0 is happening in Las Vegas, California, Nevada later this week. So we're having people around the world come together around health, which is a great, there's too much, right? But it's great to be recognized in here. And really part of that reputation. Well done. Thank you, Mark. Come on over. How'd you get this great award?
No, thank you very much. Good morning, everybody. I started my career as a basic researcher in lung cancer. I'm an oncologist by training. Continued to develop into a clinical researcher in lung cancer. Left academics after a while, went into industry, developing new therapeutics, and also in business development and strategy, and I eventually transitioned over to having my own company, Levitt Oncology Associates, which it consults to the pharma and biotech industry. And more recently, with God's help, we will have a new fund up and running, hopefully in the first quarter of this coming year, to fund high-risk but potentially disruptive new biotech startups in oncology. Thank you.
Okay, exciting. Not oncology, but like in general, you know, I mean, it's an exciting topic. Everyone has their little specialty, but anything connected to cancer, tough job, guys. Tough job. So let's call to the next stage. Pranay Garg, come on, it's time. You saw him up here moderating the first panel. Give him a round of applause. It's time for him to be recognized and take home this great award. Well done, well done. He's going to be coming up on day 2 as well. Come on over, just in case anyone missed you. I saw all these latecomers. Please let them know.
Yeah, sure.
How'd you get this award?
Thank you. I am Pranay, the founder of a health and medtech startup in India by the name of HealthCon. Our solutions, we are open innovation partners for corporations as well as public-private partners. Our solutions are predominantly focused on public health settings, which reach the underserved in developing nations. We have touched more than 5 million lives over the last 5 years and counting. I would like to connect with any and every organization or company which is interested in public health and taking sort of healthcare to the last mile. Thank you very much.
Okay, great. We're going to keep that energy up. We got 2 more. 2 more. You guys ready? We're going to keep on going. Okay, can I invite to the stage Ritesh Patel? Ritesh, it's time to be recognized. Ritesh, there you are. All right, I'm looking in the back, and here he is in the front. Give him a round of applause. Take your time. Take your time. All right, thank you very much for coming today and being recognized. Great recognition. Congratulations. Say hi to the world as we stream live. Okay. Okay, Ritesh, I'd love to know how'd you get this amazing award? What'd you do? We can hear about. Hi.
Hi, everyone. Thanks to Health 2.0 for this. My motto is, if it moves, digitize it. So I focus very much on digital health. If you're interested in anything regarding digital health and the USA, which is where I'm based, come and find me. I was sitting in the kids' table at the back. So come and hang out with us children back there. Thank you very much.
Okay, wonderful. And last for this morning's awards, congratulations again, Rajiro Hashimoto. Please join me on stage. Give him a round of applause, guys. The last person to be recognized in our morning session at Health 2.0 for their impact in the health industry. And as you can hear from our award winners, there's really a range of people, range of experts, range of knowledge to connect with at Health 2.0. Give him a clap while he's up here, standing in front of you today. Say hello to the world. We have one more picture here. Come on over. Congratulations.
I appreciate having this honor. And my name is Reijiro Hashimoto, the CEO of the Medical Inc. in Japan. We are providing authentication of the good to view healthcare information, which is provided by the healthcare, medical, and media companies. And the review is doing by the 1,000 doctors, which is helping us every day. And they are following the 3 protocols. Is there evidence? Is there reproductivity of the medical industry, or good expression? And we are offering a certification mark, which is calling the medical mark, to the contents, which is a good to view content. And also we are providing the medical doctor's comment, which is attached, which can be attached to the contents. And it is very important things to make clear which content is good to view or safe to view, because most of the people cannot understand which content is based on the evidence, and which content is based on a safe evidence. So we are trying to do this business and make the world better. Thanks so much.
Well done. Okay, that's it for our morning session of recognition. We do this for 3 days just to get everyone really excited about who they are and the impact they have to this industry and to the world. I always love the moment where you get up here and start talking and finding out who you are and what you're doing, because I think everyone in the audience is probably wondering, especially if you're not in the catalog. So with heartiest congratulations to all the honorees. It's great. Your hard work has paid off, so well done. Now let's welcome, and we'll continue this agenda as we welcome Dr. Miriam Tabule, who is a founder and CEO of MT Consulting and Innovation Section Head, Ministry of Health, Oman. Welcome. She's a passionate dentist, so anyone that's struggling there and wants to chat about some teeth, she's on a mission to empower women. So come on up. It's great to have you here. Thank you so much.
So, can you hear me? Is it low, high? It's fine. I'm very excited to actually be here standing in front of all these renowned leaders that are in aim of shaping the future. And that could not be a better place to talk about the topic of innovation and the most trending topic, management of innovation. Did you know that the global innovation management market size is expected to reach by 2025 $1.97 billion? So that means it's around 25% increase till 2025. So this means we need to put a lot of attention on it. And to be And the topic is going to be about pioneering innovation management in healthcare to drive efficiency. How many people here are from hospitals? Raise of hand. Healthcare providers, primary, yeah. Okay, this is going to be a very interesting topic, and I'm so excited to share this passionate topic, the topic that I'm very passionate about since 2019, since it emerged. And the importance of this topic rises from the increase of demand on innovation. But before we can talk about innovation, we need to clarify what is innovation. And once we clarify and we share similar grounds, we then know the importance of the management of innovation and the steps of it and how it can impact us in terms of the services that we provide. So the presentation that I'm going to be sharing with you, I've actually prepared it just to give me integrity and credibility, but what I really want to do by the end of the session is talk to you from my heart to your heart, hopefully that it touches your heart, and to believe in yourself that you, every person of you sitting here, whether they're high-tech experts, whether they're just normal technicians or physicians that have no idea about technology, just like myself, can be innovative in their own organization. And the need and the reasons that are forcing us to innovate is the recent government regulations. As you can see, we're moving towards digital transformation, and that's creating a lot of stress and a lot of change. There's a global competition, and there's the new technologies, and the evolving customer demand, which makes it all very important in the 21st century for every one of you to incorporate innovation in a way or another. And I'm very glad that I came after the panel that we're discussing the importance of collaboration. Because like you know, one person cannot be the sole source of innovation. There will be a need to collaborate even with competitors. The business models have changed recently. You need to find a way to collaborate with other people. So I'm going to be focusing on the innovation part that is related to the minimal changes in your organization that could lead to efficiency. However, you can talk to Mr. George, the tech guy, and other people that could specialize in technology and digital health. The other very, very, very important reason and force that's causing a lot of stress for healthcare providers. The light is in my eyes, so sorry, I'm not sure whether I'm blinking a lot or not, but it's very disturbing. So in the 21st century, there's, as you can see and you can observe, there's a lot of global health challenges. And these are forcing us, whether we like it or not, to be part of the innovation journey. The environmental degradation, demographic shifts, the increasing population of aging population, and of course, as we can see, in every house, there's a person, at least one person, at least, in every age, especially between doctors, that are suffering from chronic illnesses, such as obesity, diabetes, cancer, Alzheimer's, and you mentioned it. On top of all of these changes, there's reduction in cost and cutting cost and limited resources, which means that the healthcare decision makers are under so much stress to provide what the quality of the services, plus accommodate the demands of the patients, but with very limited resources. With that being said, that's an added pressure. Plus, going through the pandemic of COVID-19 crisis, it made it inevitable to go through the healthcare services provision without rethinking on how we prevent, track, and respond to crisis, and to be ready for the future. With that being said, putting in mind that it needs to stay and remain human-centered service. So why do we need to manage innovation? Before I go there, I want you to understand that innovation is not the digital transfer. It's not, sorry, I'm drying. I haven't slept well. I was traveling, so I hope I could manage to forward my message in the best manner. So the innovation, why innovate? Why manage innovation? Have you been in settings between like healthcare decision makers in a closed room where you're bombarded with innovative ideas to apply in your hospitals, your clinics, from artificial intelligence, applications, using artificial intelligence for diagnosis as well, like in radiology, and then you're just bombarded with so many of these ideas that the decision makers just sit there and they're not aware which of them to take. Have you been in that experience? Has anybody been in that experience? Or like, just 2 people? Okay, I thought it was more. So once you understand the pathway of innovation management, you will be able to have a better idea on how to select and how to reach the efficiency without increased costs, which is exactly what my colleagues were raising just in the panel discussion before. So we need to manage it because a lot of the organizations are struggling to innovate, and if they are innovating, they're dissatisfied with the performance. How many of you are in your job, you've actually incorporated innovative solutions, but yet, by the end, you didn't get the performance you wanted? It was like a waste of money. Did you go through that? Okay. So that's why it's very important to use a systematic approach to for innovation management. Because not every innovation is actually the solution for the problem. And sometimes we spend a lot of money on very expensive innovations when actually what you need is small changes incrementally along the way. And if you notice, if you do not have a shared language in your organization about what innovation means, you would not be able to manage it properly. I've observed in a lot of the meetings that I've been in, the discussion of innovation for me seems like very confusing, because we'd be talking about an innovative solution, but then each one of us is perceiving innovation differently. Have you experienced that, where different people have different meanings to innovation? Thanks for that are interacting with me. And some people confuse innovation, and health innovation particularly, to be just the digital health. And I'm here today to highlight that it's not. And I'm here today to also highlight that not every innovation and not every invention is an innovation. So, creativity is needed to innovate, whether it was minimal, whether it was drastic, whether it was middle approach, doesn't matter. It needs creativity. But for an invention to be an innovation, it has to be implemented and it has to add value. So just so that we could all end up having a shared terminologies and definitions, invention is the original idea. It's never been produced before, and it needs obviously creativity. Innovation also needs creativity, but it's the process that generates values through the creation and implementation of new technologies, products, and services, or modifying the existing product, process, or systems. And this is where I would like to emphasize today. I would like to talk about modifying and how you could modify it as you go in your daily process. So what is health innovation? It is, as the WHO defined it, it's a new or improved solutions with transformative ability to accelerate positive health impact. In simple words, you need to do changes that not necessarily would have a return on investment in terms of finances, but it has an added value. And usually in healthcare, it's not only finances. It could be the healthcare, the quality of the services, and that's why it's under the umbrella of social innovation. And it's to optimize the performance of the healthcare system by generating scalable solutions in 6 areas. This is what I really want to highlight. Every area of this is a place and an opportunity for creativity and innovative solutions. And anyone in the organization could create that change. So it's an infrastructure in the areas of technology, consumables, systems, HR, and patient experience. What's the ultimate goal? Of course, to improve efficiency, health policies, effectiveness, practices, quality, system, maintain sustainability, delivery methods, technologies. Why? Because we want to have better treatment, better diagnosis, continuous education, better outreach, and of course, quality of delivery and access to healthcare. How can we become an innovative organization? The process needs to be managed. And if you realize the management process is more like a funnel. It's taking you to one goal, but it's a funnel. It starts off with a lot of ideas, and like many, that just confuses you on which one do I take on board, which is my priority. Considering that I only have half an hour to talk about this topic, and each pillar of those is actually a workshop by itself that's not less than 2 days. Each one of these pillars are like, has different tools. But I want you to have the gist of it. So you would need to search for solutions in your organization and opportunities for innovation. A lot of the times, if you realize, the staff themselves that are in the field are raising innovative ideas, are actually incorporating things that makes their waste less and their performance better. What we need to do is we need to start as a process identifying these gems. What usually happens in healthcare, and I'm sure you've observed it in the last few years after COVID, we've been losing a lot of good caliber and a very high turnover. And the reason is because a lot of people are burnt out, just like me now. A lot of people are burnt out, and they are trying to find a place where they could exit. And we need them now more than ever. So we need to search for the innovation opportunities, but then when we do get them, we need to be able to select. And this is like a decision maker's role. They need to sit and see that these are the options to solve X, Y, and Z. What are my priorities on a strategic level? Which one do I need to choose? And each of those has its own tools. And then you go and you implement it. This is a very critical, this by itself has probably 4 steps. And it kind of includes, the major step is the evaluation and monitoring. You need to know what outcome you want to get out of this innovation, no matter how simple it is. Like for instance, I'll give you an example. We went to audit a hospital in one of the regions in Oman. And it was actually a meeting with the leaders, and they wanted to advocate and promote for the efforts that have been done by their staff. And there was one thing that really caught my eye. We have a very structured primary healthcare in Oman, like they're all the same in terms of their structure, infrastructure. But there's this one region where the flow of the patient takes them 4 hours to finish their journey to get the diagnosis, the test, and then the treatment. And the staff were really exhausted because if you looked at the journey, it's like they're going from the reception to another building to see the doctor. Then the doctor sends them to the other building. There are 2 buildings, but they're separate, to do the lab tests. And then they have to go back so that they could get the lab test results from the doctor, and then they have to, so all this time is waiting time. So what they did, after giving them the training of lean management and applying the tools of lean management where you need to cut resources and time in particular, what they did is that they just rearranged the flow. They made one building just for the doctor and the checkup and the blood tests. And then the other building for anything extra that's not within the journey. It reduced their waiting time in the primary healthcare from 4 hours to half an hour. Can you believe it? Just by change, they didn't change the infrastructure. We did not recruit more staff. We did not get more resources in any sense or manner. They've just restructured the flow of the patient. That in itself is an innovative action. They've saved a couple of thousands for the Ministry of Health with that initiative. So then when they've assessed and they've evaluated, they've realized that this is a good thing. So now we're trying to see where of similar primary healthcare centers are facing similar problems, and then we want to scale it up. And that's the capture, where you get the benefits from it, you've assessed it, you see that it got the outcome it needs, it reduced the time, reduced financial waste, and voila. However, the first thing that you need to ask yourself, are we as an organization having an innovation strategy in the first place? Do we have an innovative organization overall? So what are the elements of having a clear innovation strategy? You need to have, in terms of innovation, not just the strategic plan of the organization. Within the strategic plan, you need to have a strategic roadmap of what innovations you want and for what outcome. That alone in itself is not going to give you the benefits you want. There has to be sharing with your staff. And the sharing needs to ensure that every one of them understand what innovation you're talking about. So the definition of innovation in itself needs to be clarified, so that everybody would have a shared language between themselves. Are we talking about disruptive innovation in this process? Are we talking about minimal incrementals? Are we talking about examples of disruptive innovations, for instance, the digital transformation and the AI incorporation? So they need to know what you're talking about when you're talking about innovation in that strategy. And they need to know their role in that journey, because each one of them has a role to fulfill. And then you need to, of course, train them and equip them with the right tools and techniques to enable them analyze, select, and implement. And of course, the first people that need that, and that's where I come for, is that you need to help the leaders know how to assess, select, and then implement. Because if you don't have the support of the leadership, a lot of the innovations die once that person, the innovative entrepreneur, leaves the organization. And that's a pity. That in itself is a waste. That in itself is an extra expense. Then you go and you ask yourself, like if you're all like decision makers or you're the business owners, ask yourself, am I incorporating an innovative organization? Am I a leader who has a clear vision for my organization? Do I give direction? Is the structure that I provide actually equips people to create that innovation and be creative, or does it kill the talents? And of course, motivate them to continue so that you could build and sustain the culture of focused creativity. And innovation needs both people and practice. The takeaway message as I'm wrapping up is that if I give you all the innovations in the world, every technology, and your people are not motivated, you're not giving them space to create, you blame them for every mistake, they cannot, you have a blame-shame kind of a culture, the just culture is not applied, you're going to kill the innovation, your gadget, whatever it is not going to work. So what we need to emphasize and how we could help you is actually first identify the talents of these people. MT consultancy with all their team can help you give the right mindset and deliver innovation from within an organization rather than get it from outside. So first fix your inside before you get the outside. So to wrap up, what's next? You need to understand that innovation is not for instance, it's not the government's, like the digital transformation is probably the government's regulations and stuff, but innovation in general is the role of everybody. And everybody needs to contribute. Allow your staff to do that. And the way to get started is to quit talking about it and begin doing. Search, select, implement, capture. I hope this was very useful. We can talk about it later. So initiate, innovate, and elevate. Thank you.
Wonderful, fantastic. Thank you very much, Dr. Miriam. I just want to make sure everyone knows how to contact her. This font's a little small, but if you can't see it, www, where'd it go? Where'd it go? Hello, where'd it go? We're going to get Miriam's email and website. You're on LinkedIn? Great, okay. So how can we anyone find her on LinkedIn? Same name under LinkedIn. If you find her on LinkedIn, raise your hand. I want to make sure that we can find her and connect. MT Consultants are helping the way people innovate. So if you and your organization are struggling with innovation, they identify the people and they help them move forward. So really important to have these experts on your team involved, and thank you very much for that. I want to let you know that as we move along, if for any reason our timing starts to change, what happens is we have a screen up here for everyone on stage, and the time is showing so you have full visibility of how much time you have for your presentation. So I kindly ask for you to adjust it accordingly. We have to adjust everything as time goes over throughout our event. So thank you so much for being patient as we do that and just adhering to the time, or else I come up behind you. Okay, so we're moving forward fast on this morning session. We got a panel discussion. I don't want to waste any more time blabbing on, but we are talking about remote healthcare. Everyone's getting remote. These phones are more powerful than we think. And the solutions paving the way for a better digital patient journey is really at the forefront because everybody wants their health on their phone, right? So let's welcome to the stage Alice Veglio, who is the CEO and founder of Bright and Fit Fitness Program, who's going to be the moderator. You saw her up here earlier. Give her a round of applause. Making headway here. I'm going to let you introduce the panelist, okay? I think you got microphones up here, and take it away. You got 20 minutes on the clock, and after that we wrap up for lunch. So you want to come up to, you got the microphone working? Okay. I just want to make sure one's working, so you have.
I think that is
nothing.
Working. Yeah.
Hello, AV, please help me out.
Okay.
Yeah, you guys hear her?
It's working.
Thumbs up. Okay, really quick before we get to the panel, anyone find Dr. Miriam on LinkedIn? All right, I'm coming back for you. I'm going to find her before you do. Okay, thank you for the stage. Take it away.
Okay, thank you so much. It's such a pleasure to be to introduce such interesting panel. We know that the background of this panel is our daily life. What happened 2 years ago? Our life changed, and healthcare professionals had to take interest into technology, because technology is not just a solution, it's a way to improve the healthcare system. In 2018, when I just graduated, I thought to do something different in my field. I was passionate about fitness, I was passionate about women empowerment. So the question was, how I can give a solution to give accessibility to women from every part of the world to a better lifestyle. The solution was Bright and Fit. Bright and Fit in the years has reached more than 40,000 women that can add essence to an app, innovative app, in which is included fitness, nutrition, mindset tools. So today, during this panel, and I'm gonna call all the other panelists here with me, we are going to see how the experience of a patient from the prevention side and also from the cure side can be implemented with the innovation and technology. So I ask kindly to all the panelists to come here with me. Thank you so much. Okay, so the flow of today is going to follow three main aspects of the technology and how technology can help every healthcare professional to improve the experience of his patient. So the first aspect I think that is mainly important is accessibility. So to help everyone to reach his audience. So have the opportunity with technology to bring hospital inside the ISIS, to bring healthcare and also well-being inside the ISIS. So in my case, in my specific case, the solution was through the app. I created an app because we can reach the app with our phone. So what happens with everyone when everyone can reach an application anytime? It can stay committed, it can stay consistent. So if a patient or a woman can stay consistent on a healthy lifestyle, which is the results? The results, the improvement. So in this case, accessibility to an app, a digital platform can be life-changing. So what I'm asking you is to introduce yourself, and I'm looking at Rini because she's working like me on the preventive side. So to offer all the tools to prevent diseases. So I kindly ask you to start and then share with the other wonderful panelists that are here with me today.
Thank you so much, Alice. Good afternoon once again. My name is Rohini. I am from India. We have a mental health company called the Able Mind. We work in the area of proactive and preventive mental health, like Alice was saying. And we've been in the field in this company for 7 years. I've been a mental health practitioner for over 22. Proactive and preventive mental health is really critical for us because, as you know, mental health is always looked at as the last resort for seeking help, right? So this intervention is what everybody knows, and when the problems reach a point of no return is when people sort of reach out for help. And the more you let problems fester, it results in all kinds of physical health issues, as Dr. Wasim will also agree that cardiovascular diseases, gut-related issues, all kinds of stress and burnout-related issues, everything can be prevented if only we figure out that, yes, let's talk about what's bothering us. Let's not let it eat us from within, which is why, reaching out on your own proactively to talk about what's bothering you is really important. That's the area that my company, The Able Mind, is really working towards, handling that particular issue of preventing problems before they become too difficult to handle. So what we say is that solve for the molehills and not just the mountains, because if you let it fester for a period of time, then you don't know what are the difficulties you're going to be dealing with. So I would like to pass on the mic to whoever would like to talk next.
Yeah, sure. Thank you. Well, I am Silvia Micalos. I'm CEO and founder of Sunshine Oxygen. It's a health tech company with headquarters in Spain and with applicability international. And as the two first panelists, and Alice, the chair, what we do is solutions for patients. And in the end, it's what all of us do. And remote care, it's a core in this essence. And the fact is that there's no pathology burden unless the pathology is occurring. So we are all here to move the care until the early phases and the early stages of early diagnosis. That it's all what we do. And in these terms, I would say that patient should be the center of all what we do. And this is what we do in Sunshine Oxygen and all what all of us do, for example. But the thing is that we could say that the center of all what we do should be around patient empowerment, the empowerment of the patient, to make the patient more capacitated to understand his own healthcare condition and to be able to manage it with genuine and trustworthy information. Why not? Sometimes it's simply a matter of training the patient in the very early stages so that we can early detect his or her situation. So, well, this as a first introduction, and I move the word to my colleagues. So, please, Guy.
Good morning, everybody. My name is Guy. I'm the founder and CEO of GS Enterprises. and also the CEO of MedConsole Group. We are established here in the UAE. Actually, what we are doing in the last years is locating startups, new startups, especially in the healthcare industry, because we understand that the world goes to new things, new innovations, mainly in the field of remote healthcare. We're involved in a few critical projects in the remote healthcare, mainly hospitals here in the GCC. The requirement is remote healthcare because during the pandemic, everybody understood that face-to-face healthcare is not the new frontier, is health remotely. And this is what we are doing, and I think that the world goes to those steps, and hopefully we'll find new innovations that can help everybody to do healthcare better.
Yeah, thank you, Guy. My name is Wissam Yassi. I'm an imaging cardiologist. Before COVID, I had a very lovely life, smiling the whole time, doing innovation mainly on CT and MRI and echo. But after COVID, we were confronted with challenges at the hospital in the Netherlands. I work at the St. Jansdal Hospital, blessed with one of the best systems in the world, the Dutch health system. The challenge was exactly what Guy said a few moments ago, telemonitoring. It was pressing, so that led me actually to start a company called the Med Company, because created by a doctor, that's why, just like the coffee company, then well, Med Company. And we created a telemonitoring app to monitor patients at home with actually two of the best people I know, my best friends, and we got it regulated. And we connected multiple devices to the app, and then we connected the app directly to the EHR of the hospitals, and we presented to a wide range of user cases, from heart failure, which is my main concern, rhythm disturbances, post-myocardial infarction, COPD, post-COVID, and these user cases. One thing about the insurance companies, starting next year, telemonitoring going to be reimbursed in the Netherlands. So not all what the insurance companies are doing are bad. So it's a very bright future, and we are expecting innovation much more in that direction. So I would be more than happy to talk to you about the possibilities after the session or during the session. Thank you very much.
Thank you. I'm Jignesh. The fundamental question is, who actually likes to go to a hospital, right? Every patient, especially in an acute setting, wants to be treated at home. And that essentially was or is the genesis of kind of joining healthcare and having this company. We started with prevention. So we started with health kiosk, and the difference there was the medical devices were connected via Bluetooth. Comes in COVID, and it just accelerates the pace and the adoption as well. So we kind of got into telehealth, pods, and the periphery from a tech perspective, which includes the platform integration and various plug-and-play modules. The adoption saw an increase. We thought where we are struggling from a prevention perspective, stakeholders started engaging more and more. The space that we are in right now, it is eventually evolved into remote patient monitoring. Again, it means a lot different to a lot of people in different markets. We've just entered US end of last year, and being in that market has essentially given us a better understanding of what actually can be achieved through digital health services. And again, I believe technology, not only from a software perspective, not only from a technology perspective, but even otherwise, plays an integral role if anyone has a doubt whether this technology, all the innovation that's happening in the medical space, it can only evolve and it can only accelerate. So happy to share more experiences about remote health monitoring in general.
Hi, last but not least, Ritesh Patel. I work for Fin Partners in New York. My colleague Goel is here as well from Israel. So I have a completely different view. First of all, I'm never as accomplished as this lot right here next to me. But what I do is look at consumer behavior. We are all used to using our phones. We are all used to using QR codes. Right? You want to order something in a restaurant nowadays, you have to get your phone out. So our behavior has changed. And I think we in the healthcare industry need to get rid of the words remote patient monitoring and just say we are going to provide care to a patient where they need it, how they need it, when they need it, because we have that capability. We're about 5 years behind, in my view. I think the adoption of digital by people, not patients, is huge. And you're already doing it. So why don't we fit into that workflow? I don't get up in the morning and decide I want to be remotely monitored. I get up in the morning and say I'm not well, so I use my phone and I call the doctor, because in the US, Wasim, it's the best medical help money can buy, I think, right? So better than the Dutch. Only kidding. So, you know, I think we here and you guys out there need to think about this more from a how do we provide care to the patient when they need it, in the form that they can get it, rather than saying it's remote patient monitoring or it's rural health or it's, you know, whatever. The only thing that's standing in our way at the moment is infrastructure. There's a lot of infrastructure requirements, and there's a lot of countries that are doing that. So thank you for allowing me to be on the panel, and I'll talk to you later, by the way.
We're going to do that.
Yes.
It's very interesting because we understand from what this interesting professional told us from now is that technology is not just the solution, it's the implementation, is to take care on a better way of the patient, because the patient starts to be comfortable on taking care on himself, to try to provide a different kind of lifestyle. So technology is not just the quickest solution we can find after the pandemic. It's a way to adapt our nowadays world to new needs. And a second aspect that I think that will be really interesting is the implementation. How technology offers us the opportunity to give something different. From a side, the first challenges I found is that fitness is not easy. I don't know how many of you train daily. You can raise your hand. Okay, some of you, but training is not easy, right? Because you have to reach the gym. Doing the diet is not easy because it's not the easiest choice we have. We have one apple, we have one pastry, we choose the pastry, right? Okay, so my challenge was to make it interesting, make it easy. So I decided to implement inside my app new tools that I call gamification. So how to make it fun while training. So all my subscribers are earning badges. So after you train, you earn badges. It makes it interesting because after that, you want the certification. You want to earn more badges. So it's a way to make fun something that is very helpful for patient, and is a way also for me to cooperate with healthcare professionals. So we found obesity, we found many heart problems, heart disease that need the help of other professionals to change the lifestyle first. So yeah, in my case, gamification is a way to improve through technology the experience of patients. Also, giving the opportunity to have some masterclass in my case is a way to reach as many people as possible, 2,000, 3,000 people per time, to give information, to give not just an experience of understanding the tools to feel better, but also to have a better knowledge. So I don't know from your side how the technology can give implementation in your field. So if you want to share, will be very, very interesting.
Yeah. So similar to what Alice was saying, that gamification is a way for her to reach out to her audience. One of the things we do at the Able Mind using our app is get people to talk about their issues. So we have different options apart from anonymous chat that we actually, we get people to talk about. We have counseling conversations with our team of qualified mental health professionals, which takes care of helping them resolve their daily issues. But apart from that, how do you create awareness? How do you create people to, talk about their issues? We help them share. So we have on our app, it's called the Able Mind app. It's available both on Google as well as on Apple iOS phones. Our QR code is there on page number 52, which I'm insisting to say once again. If you look at it, there is an option called Your Story and Mine, where we are encouraging everyone, mental health professionals, layman users, people who've had experience caregiving people, those who have health issues, mental health issues, physical health issues, and those who have individual, lived experiences with problems, to share their stories, talk about it, write a, share a letter, share a poem, share an audio, share a song, anything, talk about it, so that, people all over the world who download the app know that, okay, I'm not alone in this. That's where digital tech comes in, the reach that you have, the power of technology. Like Ritesh was mentioning when he got the award, that if it moves, then digitalize, right? I mean, isn't that what you said? Yeah. So, which I think is very significant, because if it's possible, you should do it, and that's the only way you can reach people. That's the only way you change the social narrative. You use the best of tech and the best of human experience to make life better for everybody.
Indeed.
Would you agree?
Indeed, I absolutely agree with you. And the thing is that both of you have crystal clear examples of preventive medicine. And this morning I raised a question here in the room, and it was, how can we make healthcare more sustainable and affordable for everyone? Because why we are here if not? So I think that the enablers, it's us. We are making it possible. How? Through digitalization. And how? Through health tech. We are here creating the solutions that will enable more sustainable healthcare systems. Our solutions, in the end, are going to be integrated in a healthcare system and are going to help the healthcare systems of the future to be more sustainable. The hows? Through prevention medicine, through creating healthier habits, through catching the pathologies in the very early stages, and with all the solutions that you are sharing with us, and myself also in Sunshine Oxygen, also we are creating solutions in these lines, creating these better healthcare outcomes of the future. Because we are creating not only technologies, but we are creating validated technologies, clinically validated technologies. Because it's not only about saying, okay, my solutions does this, does that. No, it's about operating since the very beginning with best practices and creating solutions that at short term can be applicable and consolidated in a region area, but in the near future can be scalable. And how is possible this? By, since the very beginning, considering the highest standards of care. The highest standards of care, and when I say in between us, in between public and private collaborations, by recycling, reusing, and redistributing. It's not only about me, my region, my country, it's about thinking globally. We are changing the model, the healthcare model. So let's think big since the very beginning, since the conceptualization of the technologies. And we need to embrace and integrate the healthcare professionals when we design the technologies, because they are the ones that are in the field. They are the ones that are touching the patients. And they are the ones that know the real unmet needs that will bring value to our technologies. It's not about launching technologies and again, and then getting pools of technologies. It's about getting technologies that really bring value. And if I find another technology that brings the same value as than I do, why don't learning about these best practices, learning by others and going together and doing better? Because sometimes we can bring a lot of value in what we do. We are speaking about remote health, but let's look at the countries, what the ones that are leading this remote health care, what they are doing. Maybe they are just integrating a matter of training in their health, not remote. So sorry, because I'm standing so much. Sorry. Thank you.
Cross-border collaboration. You're from Spain, you're from India, you're from Holland, right? Singapore. There's a lot going on at the moment that everybody can take advantage of.
Yeah.
Same in the room.
Yeah.
But the only thing I'll say, Wazim, is the radiologist is going to be replaced by AI, right?
Well, I don't think so, because cardiologists, do you follow The Hard Guy on TV, the series? It's the most watched TV series by women, I think. So we want, cardiologists won't be replaced by artificial intelligence. In the
Just
near
asking.
future. Artificial intelligence is going to help
Maybe in the
us.
future.
They're going to help us. Because we have to implement the technology to the people which they need it. I'm going to tell you something. September 2021, something has changed. The European Society of Cardiology has introduced for the first time telemonitoring, non-invasive home telemonitoring in the guidelines.
Wow.
So please go and Google it. It's right now, it's class 2B, which you could do that and you couldn't, but you should actually consider it for your patients. This is the same class of indication when the CT and MRI was introduced in 2011. And right now, both of them, they are class 1A. So it's randomized, evidence-based, good technology to diagnose patients. This path gonna be the same for telemonitoring. Just mark my words. We are changing fast.
But are they changing the standard of care as part of that? Is there a regulation around, okay, we'll allow telemonitoring, but then the standard of care will
Yes.
have to change as well?
May I comment on that? Since May 2021, all the telemonitoring apps in the Netherlands, they should meet certain criteria and should be CE marked. So they are been treated as medical devices. And this is also the bottleneck for many startups and companies. If you pass that, you have like, the starting point to the market. We did the process by ourselves. And right now our app, Medcore4U app, is CE marked. So it's officially a medical app. And we can introduce it in the market. It's a good way of regulating things to reduce the smoke in that aspect.
That's very interesting. I think that the implementation is something that is touching every kind of field. And as we are running out of time, what I'm asking you is that we have understood that digitalization is the best option, but it's not easy. It's not always easy. From my side, the challenge is to differentiate, have the certification. We got the medical certification, but it's not easy. You have to provide high quality service or also the patient data. So what you think about these challenges, how you try to provide a solution in this case and how you face these kind of challenges?
I believe the biggest challenge today in the healthcare space is the widening gap between an increasing need for affordable patient care and a decreasing clinician supply. And that is essentially what needs to be tackled, right? The approaches from governments and from regulators, if we have to kind of just think a couple of years back and now, it is changing tremendously. There's so many initiatives that are happening at government levels, and healthcare is something that no country is able to kind of, avoid, and a lot of initiatives are being taken place. So the talk about certifications, there is a positive approach while it's required and it's difficult, but there is more engagement from all stakeholders. That's one change that I've seen over the recent years. And patient education. The patient is far more demanding and far more aware. Something as, say for example, the patient security, someone mentioned about patient data. And a couple of examples, and there are so many examples of patient data breaches that's happening that it needs to be tackled adequately. So I think unless and until, and again, it's an evolving space, but these are areas that needs to be considered properly, however painful it might be for some of us. But I believe there's good progress happening in that space as well.
True, for sure.
Yeah, you know, I think that because I'm dealing with a lot of startups in the last years, I can see that we can tell that the main problems that we're facing is patients that are still afraid of technology. You know, if we're going to present an idea that you can 4D an organ and print it in a printer, then you can implant it in one of in a patient, then you know, patient goes nuts about it. They're afraid of it. You know, this is an example of one of the companies that we are dealing now. You know, it's not just to help patients, it's also to control patients, to educate them, and to let them know that technology is nothing to be afraid of, especially in the healthcare industry. We have to, you know, we are 21st century, we are going there. I think that the pandemic made all of us a huge leap in the understanding the needs of the world in the healthcare. And I think that education and for patients, and not just patients, also for caregivers, is very important, and we have to deal with it strongly and independently.
But Guy, don't you think user experience has a lot to do with it? I mean, there are so many crappy health apps out there, right? Hundreds of them. If you made the user experience better, why do people order Uber? It's a one thing, right? The user experience is there. I think some of the problems we face in the healthcare industry is we look at healthcare, not the experience. We approach it from how do I want to do it as opposed to how does the patient want to interact with it. And if we can fix that piece, I think the fear of using apps or digital health will go away. So that's one thing I would encourage us to do.
No, I don't want to tell you that sometimes, sadly, I can tell you that a few of the products that are out there are not what they're actually saying that they are. Yeah, I'm speaking gently. But still,
I'm not that gentle.
Still, we do have a lot of apps and products and companies that they are actually doing something new and innovative in the world. And with those companies, we have to stand behind them and to educate people and to educate caregivers to promote them and to help them to go, you know, in the world.
Thank you so much for sharing, and yeah, I agree with you, Guy, because the technology is not just about educating people, it's just educating ourselves, entrepreneur, professional, to face future challenges and try to provide what we want the most, so the best experience for our patients. So thank you so much for sharing.
Fantastic panelists. Health 2.0, what a great panel today. Hate to rush you guys, but I'm sure everyone's getting a little hungry. I want to open it up for 1 or 2 questions. Is that okay? Anyone ready to ask some questions? Come on up to the microphone. First one wins, and just be a gentleman, let the ladies go first, probably the best. We got a tiny few minutes of time before we take a huge big group shot we're going to go downstairs to do. So I invite you to the mic.
Hi,
good morning.
Good afternoon, everybody. This is Dr. Sarah, the Medical Director at GEMS Education Corporate. My question is, as the innovation and the technology is rising, which is amazing, my only concern would be patient privacy and confidentiality. The information is going all over the network. This is my only concern. And the second one is, as a co-founder of a telemedicine clinic back in 2021 in University of Sharjah, at first, during COVID, it was amazing, it was working, everyone was accessing the service. However, Post-COVID, I noticed that patients started to prefer to come to see me in person, and to, like, telemedicine clinic is not that beneficial as in person. So what do you think we should do to promote the telemedicine again? So privacy and promotion, health promotion, to use the telemedicine. Thank you so much. It was amazing. Thank you so much.
Thank you for raising that. Before we start, I don't know if you saw, I got a little cut time there. Who wants to answer that question? Just by show of hands. Someone have some answers? You got some answers? Okay. I'm going to invite you to take this conversation actually to lunch. And I only ask you to do that because we're running low on time, right? But I appreciate you coming up here. I know there was another question out there. I'm not going to invite you up yet, but I would like to get to you, okay? And I want to make sure that you get to the people up here on the panel today. So do find them during lunch. Again, I want to give you a round of applause. These conversations have to continue off stage, but thank you very much for all your expertise today. Really fabulous. Thank you, thank you, thank you. Now you know who to find. I know some of these guys are up here on stage getting those recognition awards. Oh, one panel picture. Can't go anywhere without a picture these days, right? Make sure that you're here. So what we're going to do, if pictures, you know, if you haven't gotten in a picture yet, guess what? All 6 events are going downstairs, down the escalator. Once you walk out these doors to the left, down the escalators, out to the water. We're in Dubai, Festival City, which is across the street from Jeddah. This is the creek where the history is that, thank you so much, everybody. Their history is this was pearl trading, and this is where it was all happening. So you're going to go downstairs on the water. Everyone's going to take a group shot together picture. And then once we get that picture, they open up the buffet for lunch. There's a number of different stations, so everyone can enjoy a delicious lunch by the Intercontinental. We love that you're here. That was the beginning of first round of our first day. We got a lot of stuff to do. Thank you so much for being a part of Health 2.0, guys. I'll see you downstairs. Let's get down there so you can be tagged and share that you were here and making history in Dubai today. Thank you again. You're welcome to leave any of your belongings here that are not personal items that you're worried about, like the brochure, on your seat so you save your spot, right? So that you don't lose it if anyone comes back to take it, okay? So feel free to leave some of these items here that are not something personal, like your wallet. Please take your wallet with you and head down the escalator, okay? But save your seat if you're not coming back, or if you are coming back and you love your seat. All right. We'll see you down there, ladies and gentlemen, for lunch.
Sure. 26 ആണോടാ? ഇതൊന്നും കൂടി എടുത്തോളാം അനസ്, ഇത് മുഖത്തങ്ങുമല്ല. ഇതിന്റെ ഫ്രണ്ട് ഫുള്ള് തുറന്നു കിടക്കണേണ, ഫ്രണ്ടിലേക്ക് ഫുള്ള് നീണ്ടാണ് ഇരിക്കണ. അതൊരു പകുതിക്ക് വെച്ചിട്ട് ടൈറ്റ്. ഫുള്ള് ഫ്രണ്ടിലേക്ക് കിടക്കണല്ലേ, അത് ഇത്തിരി ഉള്ളിലേക്ക് വെച്ചിട്ട് ടൈറ്റ്. അപ്പൊ ഇത്തിരി സ്പോട്ടാവും, അപ്പൊ ഇത്തിരി വെട്ടാൻ കിട്ടും. അത് ഡൗണാ അപ്പാകാനങ്ങാണ്ടൊക്കെ ഉണ്ട്. ഡൗൺ ആണ് അപ്പാണെന്ന് പറഞ്ഞാൽ അതിന്റെ ഫുള്ള് കോല് തുറക്കാണ്ട് കയറി. അത് മതിയടാ, വെട്ടമില്ലേ മുഖത്ത്? അത് ഡൗൺ ചെയ്തേ.
Hello, welcome back. I'm going to get started. How's everyone doing? Everyone awake after lunch? Anyone full from lunch? You had a good lunch? I like the people that don't look at me like I don't see you, you know? I'm here, right? I'm Rachel. I'm running Health 2.0, and I'm so happy you're here. I want to have a good time. How was your lunch, sir?
Awesome, thank you.
Amazing. What'd you eat? You have some of that biryani? Look good.
Yeah, biryani, potatoes, and some salads.
Salads. Okay. All right. We got doctors in the house. Watch what we're eating. We're going to talk about it, right? But he knows where I'm going. I know that. You knew that, but biryani sometimes make you tired, so no sleeping. Not really. Not you. You know. They put this in the baby formula, right? You have? Okay, we're going to be ready to rock and roll. Want to make sure everyone's awake. Sometimes those lunches, oh, you got coffee, though. You know what to do. You got the remedy. How are you guys doing? Had a nice lunch? We're going to get started if everyone starts taking a seat. Uh-oh, trouble over here at Burj Al Hospital, Abu Dhabi. How are you guys doing? Great? Amazing.
The panel is going to be the talk of Dubai.
I like it. I like it. I want posting, I want hashtagging, I want engagement. I want to see you guys all over for Health 2.0. You got it?
I'll only pay 200,000.
Oh my goodness. Well, we're so happy you're here. Thank you. Thank you. We're going to see you next year too, right? Hey now. Okay. Who in the room first time in Dubai? Anyone? Dubai first time? We got a lot of regional people. First time in Dubai. Welcome. As they say, Salam alaikum, right? Thank you for coming. How you doing? Okay, we're going to get started. Grab your seat. Where'd your baby go? Oh, sweet. So sweet. Look at you. Taking babies to work is the future. I'm telling you. All the mamas know. What about the husbands and the fathers? You want to take your baby to work? No comment. Oh, no, thank you. Right? How was your lunch, sir? Okay? Yeah, good. All right. How about you guys? Great. Where are you traveling from? Singapore. I'm going to be there next week. Is the weather similar to this? A little warmer. Okay, I love this. Health 2.0, bringing people from all over the globe together to share their knowledge about the industry. We're ready to rock and roll. Okay, people are coming back. We have people moving in and out throughout the day. Second half is going to be just as exciting as the first half. So if you are here in the morning, you're going to keep as excited as I am to keep you moving for the afternoon. So I hope you enjoyed your lunch. Right? I'm going to ask everyone to make sure your phone's on silent so it doesn't interrupt anyone that's coming up here on the panelists. And we're going to jump right into learning more about the future of healthcare. This is why we're here. So let's hear from some more people. So we know on-demand healthcare is really crucial. Since COVID, everybody wants to say, hey, I want a doctor now. I need my answers now, and everything is more accessible and attainable. And so the next panelists we're going to have on stage are going to talk about 24/7 access to healthcare, right? There's a lot that goes into this. There are pitfalls we're going to identify, there are challenges that have been overcome, and a number of different things that we're going to discuss, and hopefully have enough time for questions. So as I mentioned, hashtag Health 2.2conf, Health 2conf is the hashtag. Use it so that the organizers can repost and other people can see your content across all social media. We're streaming live on YouTube. We got the channel going live so people around the world can see you and highlight your expertise and listen to what you have to say. So without any further ado, I'd like to first invite our moderator up for first panel, second half of the day to the stage. Let's welcome, round of applause for Fatima Shokoya. Come on up to the stage. On-demand healthcare and plans is what we're talking about. You good? Nice to see you up here. Is this mic on? This mic's not on. Use this and invite everyone.
Perfect. Thank you. Everyone, I'm really excited to be here and share the stage with all the amazing professionals today. Amongst two amazing women with me on the panel today, discussing on-demand healthcare solutions, as we see in the post-COVID era and just generally with digitization, the world has opened up. Patients are more in control of what they want and how they would like to approach their health and their healthcare solutions. So it's definitely a field that has rapidly evolved, and there's a lot to discuss about it. So first of all, I would like to invite Sylvia Mikalo on the stage, who, yes, please, round of applause for her. Who is a health tech sustainability specialist. So very happy to share the stage with you, and also with Dr. Amal Al-Hafadi. Please join us on stage. Who is an associate professor, especially specializing in women's health. So thank you very much, ladies, for joining me. Please take a seat. I think I'm going to come onto this side. Thank you. This is a bit more intimate setting with you. Oh, yes. So thank you very much. I think it's a very important topic to discuss, and I think one of the main takeaways from Dr. Mariam's earlier presentation for me was to really define certain topics, certain expressions that we use on a day-to-day basis. So my first question would be, how would you define on-demand healthcare plans and available solutions today? What are the ways you see this works at the moment? How would you define it?
You want me to start? I will go first, then the expert will give you her opinion. Thank you so much for you and for the conference. As a physician, this is a very difficult question for me. Demand is not a healthcare term, it's an economic term. So demand is dependent actually on what the people want and what can they offer, or they are happy to spend on it, which is not the case usually in health. Usually we hear it more in other markets, but we are now seeing it in health very clearly. So to answer what the patient or the customer they are looking for and they are willing to pay in healthcare is not an easy. But one of them actually, as she said, they are looking for 24-hour service. This is one of them. But actually to define it, we have to look more. So we need to know our population and their needs, and we need also to know what are they willing to pay for and what are they looking for. This is from their aspect, but we have another aspect from the health caregiver or the policy maker or actually the government. There are a lot of aspects, but it's a matching between the customers who are the patient in our case and the caregiver or the policy makers. And they will keep it for you. I think you are more familiar with the term than me.
Well, as all of us, I suppose, nothing special, I would say. We are all learning by doing in this field, in health tech, every day. And I would say that when we consider this, well, I totally agree with Amal, that it has to do with purchasing. In the end of the day, it's the pocket that is important. And every day, more and more, patients are paying from their own pockets. And this is important. It's an important issue because medicine is advancing at the speed of light. And medicine, every time more and more, is more personalized. It's ad hoc. And more than this, we are covering pathologies at a rate that would have been inconceivable before. We are having these digital twins where we are testing our drugs, and we are treating at the right moment, with the right drug at the right amount. And this is something that it's the progress of medicine towards translational medicine, a more personalized medicine, and a more ad hoc medicine. And if you permit me, we could say predictable medicine towards this progress. And according to this, and what concerns to us, which in the health tech field, I would say that, in my opinion, we are the enablers of all this. I said it before and I repeat it. We are the ones that are providing these health tech solutions that are answering the unmet needs of the patient in the right moment of the patient journey. And this is helping us to narrow the gap in between the early diagnosis and the better prognosis. So what does this mean in the end of the day? Healthcare outcomes and what Amal was saying in the first place, the purchasing of health. Everything what we do, it's not only impacting health, it's impacting sustainability. And it has to do with expanding the lives of the patients at high quality rates of quality of life. What is called QALYs, quality adjusted life years. And more than this, not only this, we are impacting the pocket of our patients, but also from the stakeholders in the public healthcare systems, because we are impacting health economics and outcomes research, and this should be the headlines that we should have in our mind since the very beginning. The HEORS, QALYs, and personalized medicine. It's not only about solutions; it's about high-tech solutions, and this is what. Maybe it's an utopia, but it's being possible, and it's being possible day to day. And we are on this path, and we should aim for it. We shouldn't aim for a Me Too, something else that is already in the market. No, we should aim for something else, something that covers this personalized medicine of the future that we are all aiming for. And this will enable every single home, every single patient in the world, because all of us are patients, all of us are citizens of the world, and we deserve higher standards of healthcare. And this goes through sustainability. And thank you so much.
I can completely connect to what you just said, Siva. They would definitely have to aspire to something higher, and we can reach it faster and faster as we have evolving technologies. So it's definitely something to strive for. And something really struck me, Amal, when you mentioned patients as customers, and I think this kind of dynamic has vastly changed, and there's actually we're closer to a consumer perspective than to how can I put it, and the patient being a passive participant in their journeys. So this, I think, is really important, and there's so many layers within healthcare. What I see, we are in this field, but at the same time, the patients are within their own lives, have a specific narrative of their healthcare and how they go through life with their health and their health management. So that's something that might help us to put ourselves a little bit into that perspective and try to bring the solutions that will really affect them positively. And that brings me to my next question, which is, how do you see, does on-demand healthcare suit into the current system? Is it going to replace it? Is it competing, or can it exist side to side? What are your insights?
Before answering this question, actually, there are another part which we didn't actually say it, but to start with, we cannot start with it. Part of all of this is access to the healthcare. So access to the healthcare is different from really city to city, from country to country, from insurance to insurance. So to be able to reach that degree, we have to ensure that we have equal access, equality for everybody. And the access is not an easy issue to discuss it, but to be able to answer the question, we need to know it. So from different aspects, we will take it. The patient who can offer their treatment, I think it's easy for them, and it's very easy, and we make it really much easier for them to contact and to choose and to protect what they want. But for those who are really totally dependent on the government health care, or they are dependent on the insurance, so again here we have to really speak with everybody alone. So health insurance, I think they need to change a little bit, and they may need to be more flexible, and I can see that in some of the insurance, but I cannot generalize it. But yeah, we have some insurance, they give their patient the highest quality, they give them the availability to choose whatever they want. But again, health insurance, I think, depends also on which type of insurance would you choose. So those who will pay more, they will have more, and those who will pay less, they will have less. So again, by the end, we go back to the customer preference and how would they deal with that. In terms of insurance, the patient will be able to choose what they are able to go for it, but if we are speaking about equal access, it will not be the equal, but maybe in the future we can do something more. I'm aware that there are some countries, maybe not all, but some of them, they have a really very good government insurance in which they will allow the patient to go to the doctor. They will have the same access. Some of them, they will allow them to choose even the doctor, but some of them no. But by the end, they will have the same facility and quality of treatment. But in other countries, no. They are still, or maybe they are working on it. But I'm seeing a change in the future. Since the patient, they are no part of this, so they will choose whatever they are going on it. So I'm seeing in the future the market for the insurance will change. There will be a lot of competitive, and the patient will be able to choose. Going back to those who cannot offer the insurance, until now, if there is no health government coverage, I think still they don't have the access. Maybe the governments will try to solve it by charity, for example. A lot of actually doctors or healthcare, they have initiation or some initiative to help those patients. And I can see that in India. I was speaking with my colleagues. There are a lot of examples in India, actually, for example, eye hospitals and some of the orthopedic hospital, and they did very well. Maybe they can take that as a model in some other countries. And I don't know about a different country, but at least I know United States, Europe, and even in Saudi Arabia, we have our initiative or charity in which the doctors will go to different areas in the same country or even abroad, volunteering to help the patient. And this is maybe also another aspect. But by the end, there will be still some variety, but I'm seeing it's much better than before.
Yes, definitely I couldn't agree more with you, Amal, and thank you so much, Fatima, for the question. Such an interesting question that assesses a lot of subjects, main topics. As Amal was introducing this equity access in terms of healthcare for all patients, it's not easy. It's not easy, but it's affordable and it's possible. And we are in the early stages of this. We are starting step by step, and we are crossing barriers little by little. One of the barriers is the data sets that we have. When we are speaking about personalized medicine and high standards of healthcare, we also are speaking about high levels of data sets. We need to uplift this quality of the data sets that we do have in healthcare retrospectively, than the ones that we have now, and prospectively, thinking about the future. All of them tokenized, anonymized, and preserving the security and the ethics of each single individual, of course. But this is what's gonna push us towards the next level. And when I say data sets are the house of all what we are doing. And they are very important. And not only elevate the standards of data sets, but also the accessibility of data sets. Because if we treat data sets how we should, they would be accessible. And this is the key to success. And enabling this permeabilization of data sets, we could say. And healthcare cross-border is possible. We are at the first stages, but we should aim for one single healthcare. And this comes from thinking about solutions that can go cross-border. And when we think about this equity and fully access for all patients, we should think about not only ourselves, but also globally. And governments are already permitting this. I see steps every day, but big steps. And this is amazing, because 5 years ago, nobody spoke about this. And still, there are some solutions that are years forward from where we are sometimes. So we should try to equilibrate all this, and also in terms of equity and fully access of highly standards of healthcare, as we were saying. To answer.
Thank you so much for your insights. I think it's you touched on really important points and ways to open the possibility up for more and more people to be able to look after their health, which is a primary importance. I would like to go a little bit deeper into the factors that you see pro or con on-demand healthcare. What would you say are possible pitfalls that you can see in the system right now that's keeping it back or doesn't allow it to grow to its full potential? And what are the big pluses? You already mentioned some. There might be some more that comes to mind that would enable all of us as professionals to either try to get into it or encourage it, or just to shape our views on on-demand healthcare.
Well, what comes in my mind now actually is the virtual healthcare, online access. I think it was a big jump last few years. And although maybe as a physician, we were a little bit hesitant in the beginning, and you may find some resistance from some of us because it's really difficult to evaluate the patient online or by phone. But in the same time, actually, it offered, give access for a lot of patients. Some of them, they cannot offer the same costs in reality, so in person. And in the same time, some of them, they cannot access the facility because they are far away or they cannot come or for different reasons. So when you want to take the cons and cons, I think it helps a lot of patients and it gives them access for a lot of facility which I think they cannot offer it from before. And it shortened the time that they can be seen or they can ask. So some of them, they will call us or they will speak with us, then we'll tell them, no, it's urgent to come now. So it makes a lot of difference, really. During the pandemic, actually, that was the only way to contact our patient and to bring them near to us. We cannot keep the flow in the hospital in the same way. So there are some disadvantages, but I think the advantages is more for us and for them. And I can see that we will have much better in the future. So for example, as a surgeon, I'm thinking that yes, it's possible now to say that we can do virtual OR in the future. So instead of asking the patient to travel far away or to spend a lot of money to be treated, it can be doable in the same area in just the near future. I'm thinking just only to solve the gap of the internet and it will be there. So yeah, I'm with it. This is, for example, nothing is complete, but we have to balance the stuff, and if the advantages is more, I will be with it.
Okay, I totally agree again. I couldn't agree more, and I would add that from my point of view, artificial intelligence is the key. Okay, I really think that we should delete the fears that we have towards artificial intelligence and embrace it, because artificial intelligence is the jump, it's the bridge towards this optimization of the patient journeys and this equity in terms of accessibility. And when I say artificial intelligence, I'm speaking about all the stakeholders of the value chain, not only the patient, but also the healthcare professional, because for example, in a short period of time, maybe it's already happening actually, decisions that take less than 2 minutes to take are going to be fully automatized when we speak of healthcare physicians. And what does this mean? This is going to enable the healthcare professionals to have more time to attend and to humanize their patients. And this is speaking about empathy and the beloved humanization of the patient. And when we speak about patients itself, when we speak about artificial intelligence, it's what's going to enable us to be able to have at some point this equity, fully universal access, higher standards of healthcare. How? The how has to do with including, and this is something that we should remind because we forget, the less favored populations in our algorithms. The less favored populations, because it's not only about creating our algorithms more ethical, but also including these subpopulations that sometimes have biases or present biases in the outcomes of our artificial intelligence algorithms. Yeah? And we should also prepare the data set since the very beginning, before creating the algorithms. Prepare them so that we can get the outcomes that we are looking for. And this is, well, this is my opinion of what's yet to come and what's the next step towards our homes and our health techs, I would say, because I think all of us here are physicians, technicians, and we could say managers, no, around health tech field. So this is my humble opinion. So thank you.
Thank you, Sylvia, so much. As a startup founder, I think AI is definitely a buzzword. It's definitely something that's creeping in as kind of inevitable sooner or later to be integrated, and I think it's great you brought it in. I do sometimes, feel this kind of gap between innovation and, let's push forward and let's enter the new era of health tech, and then the traditional, patient goes to primary care doctor dynamic. So there's definitely a space to close up there and make everyone familiar with both sides and also reap the benefits of both sides. And what also came to my mind is making healthcare more efficient is through AI, through digitalization, it does also mean different things to different populations, I believe, and being more effective could mean that, yes, someone gets an answer in 2 minutes, and it's amazing that that it's possible to have that kind of assistance, and hopefully that it will be available to more and more people. But it could also mean that someone needs that human connection with the doctor, that face-to-face. Maybe it's something more, deeper, like a cancer patient. It's not a yes or no. It's not a few data that they'll read and they can get on with their lives. It's something much deeper. So I think that's probably a good direction to kind of involve the whole spectrum of people and their needs, and I guess on demand comes in very well in this sense to that patients.
Just as a clarification, when I speak about this artificial intelligence enabling more time for the physicians to take care and humanize the patients, I'm not only speaking about the face-to-face in between the physician and the patient. For me, we are in an hybrid world. We are already remote telehealth is already happening, and for me it has the same value as a face-to-face. Of course, there are things that needs to be done in place in hospital, whatever, but we are moving towards this model of inpatient care. And inpatient care has to do with remote. So for me, this artificial intelligence applicability, it's not only for real-life consultancies, but also for remote healthcare, for remote telehealth, whatever. So this also, just to clarify, thank you.
No, thank you. Thank you for the clarification. I think, there is definitely space for more and more, clarification. Let's get down to the nitty and gritty and just explore the possibilities and the new ways that we can operate and be better in our professional lives and give more to our patients at the same time. As a last round of questions, I know we also touched on this about how it can be integrated in the future, and if it's I think we agreed that it's definitely something we should embrace. Yeah. If there would be a final, thought that you would like to share about on-demand healthcare, about the future, how you envision it at its full capacity, and I would just encourage all of us here to try to make this happen. If you could share these closing thoughts.
Back to the term of demand, actually I'm one of the people that I think there are a lot of things which patients they need, I believe that it's not only a medical treatment. So we are speaking now about medical treatment only, but in reality, no. The patient, they need more than that. We still need to focus on mental health, nutrition, a lot of aspects which I think demand will help us to apply it and to give our patient access to it. And back to the future, I'm thinking that we'll have more option, more digitalized health, but we don't mean that the quality should go down. So to just ensure that you understand it and you are all with us, we are with everything which can improve our situation, improve the access, improve the quality. But we are actually, for me at least, I'm against anything affecting the quality. But using this to facilitate our work and to success in our plan and our treatment and to give the patient what they need, not only what I want to give them, is very important.
Thank you.
Yeah, thank you so much. As a last thought, I would say that from my point of view, we should consider since the very beginning the respectful of the lifestyle of the patient. When we create the technology, integrating it, considering the lifestyle of each and every single patient. And this has to do with, respecting the patients. And when I say this, I also would include the essential or fundamental from my point of view that will enable sustainability in healthcare happening, which is something that it's like, oh, okay, is it possible? And it has to do with patient empowerment. For me, patient empowerment is the key. We are every time more and more connected, and we are all patients, and we are more demanding, and of course we are more demanding. We require the highest standards of healthcare for us and for our families, and of course. So patient empowerment has to do with enabling the patients understand their own healthcare conditions, and in consequence, be able to take action towards it. So this relies on our heads, on our health tech companies. We are the ones that are gonna make this possible. The house, of course, for example, if I have a telehealth solution, for example, just to say something, I can include inside a patient support program. I can include in every call, after the call, some highlights for patients so that they can understand with genuine and trustworthy information, not something that I just invent, something that really worth it. And it's on our heads, the training of the patients, this empowerment, so that they can understand their situations and take action, and they are the ones that are gonna give us the solutions. So these, as final thoughts, I would say these two concepts from my point of view, they are essential.
Thank you, Sylvia. Thank you, Amal. I think for me personally, it was a great panel, and I definitely take a lot with me. I think, the highest standards we should apply to ourselves as sitting here today in Dubai as leading edge of, of the industry. Most of you are doing great work already, so I just encourage you to carry on with it, and thank you so much. Thank you for the panelists.
Thank you, Fatima.
A pleasure.
Okay, that was amazing. Hold on. Okay, amazing. Thanks, guys, for a great panel. Girls, excuse me. Take a seat. We're not done yet because I know there's I put extra time for questions. I don't want anyone coming up here and not feeling like they don't have the opportunity to answer questions. These guys are experts at what they do. They brought to you from around the world. I hear all these accents, Hungary, Spanish, right? I think from, you can hear a whole bunch of accents from different areas. So we're taking our knowledge globally and bringing it together. I invite anyone who would like to ask these ladies additional questions about what the topics they've talked about, customer-centric being the focus here. Please take the mic. Right there, that one in the middle of the room. I'm not pointing to you, I'm pointing to the microphone. Would anyone like to ask the ladies some questions? Come on up, great. First person to the mic wins. I put a couple minutes here so you can engage, okay? Great, because I know you guys have questions. Yes,
Hi,
sir.
Thank you for the great talk. I'd like to share with you a little bit of experience of us. I'm from Israel. My name is Yves Biton. In 2009, we launched a service called Pediatrician Online. The first night of the launching, 3,000 calls. 3,000 calls the first night of the launching 2009. Since then, millions of calls of Pediatrician Online. Why? And by the way, nobody pays. Why? Because we design it, and you talk about design services that are logic to the government, to the population, and you can design them that people will not pay anything. Why we design them? Because at the middle of the night, in the weekend, when there is a child with fever, do you go to an emergency room? It takes time, it costs money, so immediately putting a pediatrician online solves those problems, and it was very logical to our government and to our insurer. So this is one of the things we did. The other thing, you talk about artificial intelligence. What we're doing now, the service is a triage of a physician to people who wants to go to emergency room. Should I go to an emergency room? So we have a machine that do artificial intelligence, but eventually the one who decide is the physician. The machine is looking at the data and telling the physician whether it's a risky situation or you can manage it online. So this is the way that we interact with those things that you talked about. Thank you.
Great, great. Thank you for that. Though I didn't hear a question, but let's get some questions for the ladies. I'm sure it starts a conversation after you're off the panel, but one more question? Yes. Keep it to a question.
Yeah,
okay.
I do have a question.
Perfect, awesome. Thank you.
I'm the Chief AI Officer for Twill Health. So I have a question for Sylvia. You mentioned AI and the fears of AI, which I'm very familiar with. I would say there are justified ones. You mentioned biases. That's for real. There are fears that have to do with romanticizing AI and sci-fi and popular media. And there's also just the resistance to new technology. And I wonder if we have any magic solutions as to how to deal with those fears and help embed AI in more and more solutions, because there's a great benefit to it.
Yes. Fantastic, thank you.
Wow. So what's such a question? I don't think I'm capacitated for answering it. But I would say, from my point of view and my expertise, is that we shouldn't aim for panacea, something like it's just a matter of doing simple, small things. For example, what can we do? When we train our artificial intelligence models, we only think of healthcare data sets. Why? Why only healthcare data sets? We have lots of data sets that are available, fully open access. For example, we have the Copernicus in some satellites, these satellites that are collecting real-life data sets from quality of the air, quality of the water, radiation, all these data sets that are open access, as I say, in different countries. And why not incorporating them in our artificial intelligence models? It's not about creating the super artificial intelligence that will change the world. No, it's about simple, small things of daily lives that can improve our lives. And artificial intelligence is speeding them up at the speed of light, because it does what we can't do as human beings, of course. And we need to take the good part of it. The house, making the proper questions. We have the tools, and we need to, as humans, to make the proper questions that will make us move forward in the next step in terms of healthcare. I'm saying Earth observational data sets because it's the ones that pop up to my mind, but why not other data sets that are multidisciplinary, and that they can expand the value of our products. It's about, I have a product, but how can I expand the value of it? How can I expand the matrix of value of my product? And this has to do with incorporating other disciplines, thinking out of the box. What do we need? What's happening in the world? There are emerging communicable and non-communicable diseases, some of them that we hadn't even heard about them before, and they're appearing. So this needs to be included in our AI algorithms, because this is how we are going to be able to face them. Otherwise, we won't be able to. Right? That's simple, because we have the tools, let's use them properly, but let's use them.
Incredible. Give them a round of applause, these ladies. A lot of information. Thank you, ladies, for your time. Thank you for a great panelist. We opened up a can of a whole bunch of worms there, right? From AI to the future, right? Oh, don't worry. Don't worry. From the future of what technology and the impact of technology, private versus public, what are we going to do? How do we impact this? How do we move it forward? I mean, these are great conversations that we're bringing to you at Health 2.0 Winter Edition. So please, I invite you to definitely connect and continue these conversations, because this is where the change happens, right? I got shaken of the head. Yes, you're right. And these are why these events are so important. I love when people highlight what they've done around this industry so other people can hear new information that maybe they have not seen or heard of in their part of the world. That's why global events are so impactful. We miss them so much during COVID, right? It's not the same thing to do it online. It's nice to see people face to face. So, you know, here locally in UAE, I know a number of us are new to this area. I always like to bring in facts of what's happening here in the region, especially around the topics that we're talking about. So in 2022, in October, there was a survey conducted to residents, around 23,000 people that live here, and it revealed that 77% of UAE residents of the country, they were very happy with the healthcare system. It was good or very good. So that is a great accomplishment, and understanding that information from the people living here to affect the way forward. And you saw this panel, customer-centric is the way to go, so that we can move in the right direction, that customers get what they need. And we're all those customers here in this room. So I thank you for keeping tune. Hope everyone is still enjoying today. We got a bunch of stuff to attend to this afternoon. So without additional further ado, I'd like to bring up something that was mentioned earlier, is a workforce around the healthcare industry. And our next panelist is going to address this, because it's not easy keeping good talent. It's one of the most expensive costs to any business. And so how do we do this effectively? And we're going to bring up some panelists that's going to talk about the biggest challenges, what they're facing, how they're overcoming, and hoping that this information translates really well with each one of you. So next, I'd like to invite to the stage the moderator, Masuki Asano, Executive Officer of Excel Stars, Inc. Come on up to the stage. Help me with your panelists. Where are you? Where are you? We're streaming live. Oh, look at this grand entrance. Masayaku, that's you? Give him a round of applause. Masayaku. Whoop, is that you? You're coming this way. You want to bring your friend up too? All right, and you're bringing up the panelists. They all sit and talk about, let's figure it out so we can all, make sure our expertise is heard. Give him a round of applause. What an entrance. He's going to introduce all these panelists to you so you know who's up here, and I can help out with microphone. Time's on the clock. It gets adjusted to make sure we fit in, and I'm putting in a couple minutes for questions, okay? Great. Everyone take a seat. Good morning. Would you like to come and introduce your panelists?
Oh, yeah.
Okay, here you go. Microphone's yours.
Yes. Actually, it's been it's been a couple mistaken. We are going to moderate together. Dr. Sheffer is going to moderate, and I will moderate together. And we have Dirk from Switzerland, and also Naoko Kita is also from Tokyo, Japan, and also Sanjeev, and and also
It's Fatima.
Fatima, sorry. And so we're going to speak up for the panel. Yes.
Everyone could take a seat now, get comfortable. All right, sometimes things change. We love your versatility to be able to, and everyone has a microphone? You ready to talk? You need a microphone. Okay, I'll let you take it away any way you want to.
So, shall we start, introduce yourself and maybe what you do for 30 to 60 seconds, maybe?
Yeah, so thank you very much, everyone, for joining us. And we will be discussing the human element. So what we decided as a panel, we are going to tell about us 30, 40 seconds, because we feel that this very first introduction really going to play a huge difference. So with further ado, I would like maybe to start. And my name is Dr. Ludmila Schaefer, and I'm a board-certified medical oncologist specializing in gastrointestinal cancers. And I've been in medicine for 31 years as a clinician educator. I've learned that we really have a big mislabeling when we present a medical information. Now, I would like to ask you, raise your hand, who is in healthcare industry has a very specific terminology to your field? Yeah, so that's what exactly we all have. So it's a lot of actually mislabeling. So what we do, I'm a founder and CEO of the Dr. Connect Consultancy, where we try to teach every healthcare business defined rather than label. So that's a little introduction, and the next is Dr. Dirk.
Thanks so much. Thanks so much. I also was very glad to be here and to give some more ideas about digitization, of course. But first, I'm Dirk. I want to introduce myself. Yes, I'm a health economist, and I'm a nurse specialized for emergency care and paramedical assistant. So I've got 25 years experience on the base, of course, operational experience. So my most target is to give some ideas to give some more retention management ideas to keep the staff, nursing staff especially. I mean, they are also important for the processes, care processes. And of course, I want to give you one sentence. I think it tells us everything. Analog bad processes, after changing in digitalization processes, they are still bad. So this was my sentence, and I want to put the speak through to my colleague, Kita.
Thank you very much. Hello everybody, I'm Naoko Kita from Japan. So my area is for women's health literacy, and I found a company 3 years ago for women's health literacy. So my concern is of course workforce in healthcare field is very important, but my concern is the female women working environment is very concerning. So I'm looking forward to discuss with you today. Thank you very much.
Glad to be here. Thank you, Health 2.0. My name is Sanjeev K. Sahani, and I'm a healthcare leader for over 40 years. And I'm pretty much in depth with medical devices, especially I would say specialty medical devices in the Indian subcontinent and the Asian region. Very fortunate to have been a part of the transformational journey of 4 therapies, which we have built brick by brick over the years. And what do I do now? Currently, I'm a country head with a innovative German company, which is into design, development, manufacturing, and commercials of advanced tissue regeneration technologies. So in simplified world, we provide flexible solutions to complex wound restructuring. This means that we provide dermal templates, dermal replacements to patients who are acute or chronic, burn, trauma, diabetic foot ulcers, venous ulcers, pressure ulcers, cancer extractions, and scar revision surgeries. The change occurred with new technology. This is how technology changes the life of people. The ability to preserve the biological properties of a tissue is what is the need of the hour, because when you want to replace dermis, you should be able to give a dermis where the structure is not changed. So MedSkin Solutions, where I work as a country head, has a special technology called CryoSafe technology, and we are able to preserve the structure of the collagen so that this has made a remarkable difference in the patient's outcome. Why India? I love India. I've been there for 40 years now in the healthcare profession, and India is an exciting and complex environment about healthcare. So I'm very pleased to talk about our experience of last 1 year with the company, and also learn from the panelists and everybody of you here about the changing world. Thank you.
Personally, I think the more specific problem we identify, the more on-point solution we can provide. And I think when it comes to healthcare, we usually think about the patient-doctor environment and that very specific setting, while healthcare itself is so much broader, it's so many layers, not only when it comes to the care, but also when it comes to organization and structure of the healthcare staff. So I think it's a very, very important issue to bring to the table, and not just kind of manage and juggle and just solve problems as professionals on a day-to-day basis, but to bring in the right expertise when it comes to this. So I think this is definitely going to be a very valuable session. And personally, as I'm also in the femtech space, founder and CEO of Truviva fertility startup. I'm very happy to see female professionals, being there louder and being concerned about these specific problems that emerge throughout these work processes. So thank you.
Yeah, Masa.
So lastly, my name is Masa Asano. I'm in a sleep tech company, detecting sleep and arousal during sleep, and also rhythm. So basically, it's now about like 8 o'clock in the night in my country right now. I have some kind of a jet lag for now. Maybe you guys too. I mean, barely sleepy and tired right now. But just not only the rhythms, we could save people, save patients from not only sleep disorders, and also depressions, maybe schizophrenia, and maybe also even Parkinson's disease as well. So we're trying to save the people and the patients, and also to make products for supporting the doctors, so that those are the basic social issues, so that we can attract people to save those patients and the doctors. Yeah, that's how we're doing right now.
Thank you very much. So we know that it's about 30% of employees feel undervalued. And also for the last several years, we all know that it's a huge medical personnel, healthcare professionals, not only physicians, nurses, everyone, it's a huge shortage. We all developing unbelievable, amazing AI technology, digitalization, but when the patient comes, they really want that feel, touch. So we are trying to bring those solutions because specifically, I live in Kansas City in the United States, and we have about 40% shortage of physicians, and it's anticipated by the year 2030, it's about 100,000 only physicians, and that's not counting nurses, healthcare professionals. So we really would like to bring all together how we all can provide this human element to all digitalization that we see for the last several years. So I would like to start from our first panelist and see what is the human element, what the challenges you see from your point of view in today's world.
Oh yes, first I want to mention the strict hierarchical structures, and we need to change completely. We need to change really completely our healthcare system and leading system. And that's the reason why I want to give you some more details later. But back to your questions. The most important point is to keep this stuff where they are and not put them in out-burning situations and situations they're gonna quit. Also in Switzerland, we got 13,000, we've got 8 million inhabitants at the moment, nearly, or a bit more or less. But we've got 13 vacancies. We need 13,000 more healthcare workers at the moment. In 2030, we're gonna need 20,000. So the demographic developments, of course, and the staff shortages. So this is the most important point. Not to search for new stuff, also to find the right, of course it's important, but the first step should be to keep them where they are. And that's the main focus, what I want to give you some more ideas, especially from the nursing perspective. Thanks so much.
Yeah, so they keep medical staff. So how can we provide a digital technology? Each of you sitting in the room, what can you bring to collaborate and do that part? So with that, I would like to ask what's from your standpoint, the human element and
Thank
challenges.
You. Yeah, so in Japan, maybe I expect not only in Japan, but working in hospital medical institution is really hard. It's very busy, so working from early morning till like late night. So I'm working with like healthcare professionals, like female healthcare professionals, like raising kids or like caring parents, and then some of them like escaping from hospitals because too much work. So it's very difficult to like both private, like raising kids or caring parents, and also like working. So like the AI and digital health like covers the like more area than like the allow healthcare professional to work more flexible or more like more short time or flexible working or remote working. Then maybe more female like worker come back to the hospital medical institution. Then that's one solution, I think.
Yeah, thank you for that. Thank you for that. How about from your standpoint?
Yeah, from my standpoint, from India perspective, you know, before I come to how we manage this challenge of attrition and acquisition and retention of high talent, let me start by saying that in India, 65% of the population is less than 35 years of age. Now, this is a very good problem to have. We have much youth there. They are running into education, high productivity, high consumption, high talent, but with that comes high ambition. And in a fast-growing market, you know, everybody wants to grow fast. So we have a big challenge to, first is to find great talent, and then to retain that great talent in the country where change is happening so fast across board. Now, what we found so far is to first understand the problem. You know, we might start taking steps to improve retention or improve engagement, but what is the problem like? I think the problem is multifold. It's not just one. It's not just one place. Imagine the post-pandemic. The topic of the session could have been the human element of healthcare post-pandemic. Because even post-pandemic and pre-pandemic, I think behaviors have changed. Expectations have changed. People have less patience. I used to hire people all these years, and we would say about a word called career building. You have a career here. Now people talk me back and say, we want to create wealth, not build a career here. You know, we have in us, we want to grow fast. And that's the high energy, high passion people are carrying today. So I think what we have found as of now is how can we find solutions to engage the talent we have? And is this a forced engagement? No. Is this an engagement that's in the environment? Possibly yes or no. But what do we do that automatically people feel to stay on and grow? So one thing my company did was started giving new projects to young people. And that was a fantastic experience for us in Germany. In India also, we did not look at experience like in hierarchy that give the most complex project to a most senior guy. No. Anybody who has talent or passion, if somebody has both, you're very lucky. So I think one is engagement, other is learning management systems, standardized learning systems, so that continuously people learn on daily basis, not one quarterly review and one meeting in a year called annual training sessions. The current youth wants to really make a difference, and for that we have to do things which we win them. There's a saying, someone said, I must salute the person, it says that develop your employees so well that they become most wanted in the industry. And treat your employees so well that they have difficulty in leaving you. And that kind of ambition our company is trying to now aim at, how to automate, how to use digital, use other new processes to find methods of skill development, knowledge development, and also developing leaders around us. So that's my say on this so far.
Yeah, I absolutely agree, especially you mentioned about hierarchy, and we have low-level employees and high-level of employees. So how can we bridge, what can be a liaison? And I think that's what we are all here together. So how about from your standpoint, what is the human element, and what is the difficult part, and what's your solution?
Well, first of all, I was very happy to hear tangible solutions and something that you actually tried and worked. That's really, really good to hear. I come from a little bit different angle from the startup world. It's, it's fast, it's moving, it's very, there's a lot of space for creativity, so that is definitely a blessing to be able to operate in these circumstances. What I do see, and I think it would be a good takeaway from the startup world, is the emphasis on culture and how we start from very little, from a micro level, and you have to make it work, and then you can start moving and scaling and growing and going international. And I'm sure you probably have experiences with that with your own businesses, but from the healthcare side, even though I'm not yet a doctor, hopefully in a year or two, I'll get there, but what I do see within my training is that, the young doctors, they get into a system that they have to learn, and then once you learn it, there's not much space to change it and modify it because of the hierarchical structure that we've already mentioned. And one other thing I took away from Dr. Mariam's earlier presentation about innovation is that you do need, a culture, a system to channel all the potential of the existing people, and retention comes in here as well. And I think it's great work what you're doing regards to this, because definitely, people, once they feel a part of something bigger than what they do, and healthcare is naturally something that is more noble, it's higher than oneself. People want to give from themselves, usually is what I experience, if there is space and if there are systems for it. So what I'm trying to say is, and what I see, as I said, just in a micro environment, is that this culture, it is investment, time and effort, but this definitely pays off, just like a good lifestyle. You won't see it tomorrow and the day after, the muscles won't start growing on your body because you went to the gym twice. But if you have the habits and the good, systems, and you're not just trying to survive, and your hospital or company is not just going for survival, then soon you'll reap the benefits of it, and you'll have a more future-centric organization.
Yeah, thank you. Education, especially right now at the crossroad, and I will tell that the reason I like this conference, because what you just brought up, and each of us from different industry and different level. Actually, we were sitting and having lunch, and I think human element just started, and I'll tell you why. So we were having lunch, and we used to go to medical conference. It's a physician conference, it's a nurse practitioner conference, it's a digital conference, it's a business conference, and here in this room, there are so many of us. And then Masa asked me, what society do you go? So I tell him, my society is American Society of Clinical Oncology. What it tells me that it has been such disconnect, and I just learned how important for all of us to unite. So I started actually pulling up, and I found out what's the society. So how about all of us, take that approach, what just Masa taught me during the lunch, and you all panelists taught me, and we all exchange, and we just go and ask each other, who is sitting next to each other, what's your society? Where do you go? What do you know? So with that, I would like to address and tell Masa, so tell us about circadian rhythm, what's your human element, since you just taught me something, and what's your solution and challenges?
Since Japan is a really aging society, in a couple years, Japan is going to be like more than 30%, maybe 40% of us age over than 65. Since that, we'll be having more of diseases, and maybe a rare disease as well. And just like we all said, we don't have enough physicians, and we need to, have a more productive facing dialogue with the patients, and also to more attractive working environment for patients and for the also patients as well. So what we are trying to do is to solve a problem to for better digitalization for doctors and also for patients as well, so that we could better for patients and better for doctors. That's what we're trying to do, and but since that's so, we're just only facing for Japan. That's why I asked her to where we should go for next another country. Yeah.
Yeah, thank you for that. So in May 2021, in the United States, the federal law implemented all physician notes, and not only physicians, all medical record automatically, lifetime, shared with the patient. So the moment it happened, when I signed the note, that note goes to the patient, who is probably sitting at home on the couch, using digital technology, reading the note, seeing in the note collapsed stomach on a CT scan, gets in the car, in panic, drives in the clinic, getting to the reception desk and tells me, what is wrong with the doctor? I am dying. I have collapsed stomach. Who knows in the room what's collapsed stomach? Who thinks that it's normal? Collapsed stomach, it's normal. It is basically means just empty stomach. But when the patients see this terminology, it's shocking. So we're talking about driving on the highway. The patients basically can literally kill themselves. So by doing that and seeing all this information, so from my standpoint, that's where the Doctor Connect consultancy created, because we are trying to present in the media healthcare approachable information. So where is all terminology taught by all of you, all of us, for the community, for the patients. And it's not just during one patient encounter. I think all of us are responsible, and that is why we're sharing. So what we do at the Doctor Connect, we try to provide evidence-based information and teach the healthcare professionals, business leaders, how to present your strategically structured brand narrative. So when you appear not only on the social media, but on the reputable, different type of media, what is applicable in your country. In my situation, we went from zero being in the media to Forbes, NBC, Fox News. So we basically explain information to the public in a very understandable approach. So that's what we would like to unite all of us and help each of us how we can make patient care better. So what other solutions from your perspective, from your organization?
Yes, first I want to make a question for the audience. What do you think is the most reason to quit the job as a nurse?
Anyone would like to answer? Ma'am, please. Burnout syndrome, excellent. First row.
Thank you so much.
Did everyone hear that? I just wanted to make sure everyone heard what you had to say. Come on with a microphone, okay? Because the people in the back, did you hear that? Give me 2 seconds.
Oh, okay. Did you hear what I said?
Oh, yes.
Okay.
Nearly 80%, what you
Okay. Yeah, so the question that you'd asked is what would make a nurse leave a job or a work that they've been doing and they're so passionate about. And it's, as my colleague over here is saying, that cycle of overwork, overwhelm, not breaking the stress cycle, being in a healthcare system where it's overly managed, and these systems are being created quite purposefully to under-resource, underfund, undermine professional workforces, and people see solutions elsewhere and they're just not willing to make the vocation take precedence over their work-life balance, so they leave.
Thanks so
Thank
much.
you.
Very
I know
important.
he's standing over there, so I'm going to give him a moment at the mic because he stood online. Well done.
I'm Dr. Berneman from Switzerland, and my son is a nurse, so I get direct feedback from him, and Swiss nurses are quite well paid, so you will never hear them complain about how much they get paid. But their problem and why they quit the job is lack of dignity and lack of respect. They don't get that. If you don't respect people, if you don't give them dignity or and show them that you care what they do. And the third thing is civility. Civility of the hierarchy towards the so-called menial job-doing people. And that goes from the highly qualified nurse to the person that disinfects the restrooms. They quit because of that. They don't quit because of the money. They don't quit because their ambitions are not fulfilled. So I think one of the main things to retain people, and I used to be a strategic consultant also with an arm into recruitment of high-level people, my question was always, how do you treat your subordinates? Why do people quit their job under you? And most of the time, they didn't know. And my observation was that when you don't know why people quit, why your people quit their job, it's because of you.
Well done. Give them a round of applause. I see all these
So
heads
we,
shaking.
So thank you very much. So burnout, dignity, the people want to be appreciated.
Yeah, nearly 3 or 4 weeks ago, a study told us the reason from a burnout. They made nearly 200 questionnaires, and the main reason for the burnout is lack or less. What can I tell in English? Contribution and value. Wertschätzung in German. Value and recognition. That's the better word. And that's the main reason why they're going to develop this burnout. As this Mr.
What's your name, sir?
Your name, please? Braniman. Thanks so much. Yes, important point. Not only the money is the most motivating factor to keep this stuff. More the soft facts are questioned at the moment to keep them, and also there are some more factors. I don't know. Did you hear about Burt's organization model? Anybody heard it before? It's a holistic leadership model, and it's very successful and from the Netherlands, and also some pilot projects are introduced in Switzerland together with some universities to develop a holistic, holocratic leadership model with more participation, more transparency, more confidence, self-decision making, and self-steering without leaders, and they produce 30% less costs, and they got 40 hours more per year time per patient. They are self-making decisions, these teams, without leadership from extern. This model is a really successful model, just an example given to have some changes and paradigm change.
Thank you very much. So we are approaching the end of our time, and it ended up such a vibrant discussion. Thank you so much, all panelists. Thank you to the audience. And before we conclude, I just would like to ask panelists, in one word, just describe what's your human element. So we discussed about, burnout, value, appreciation. We all want to feel valuable. It's not that much about money. So just one word per panelist.
I would say respectful.
Define.
Work together, interdisciplinary, together for one goal, and that's the quality of the patient.
Maybe recognition and contribution.
Recognition, contribution, thank you.
I think it's the purpose. At every level, if the purpose is clear, you don't want to have their bosses to manage anybody's behavior. And the whole concept that training and learning is for younger and lower level people is absolutely wrong. The biggest learning is required by the highest level people. I think CEOs like us need to be learning and unlearning and relearning every time. And I would make a statement here which I heard someone, but amazing, someone said that in this. See, today the demographics is changing, socioeconomic things are changing, disease burden is changing. We talk about mental, talk about lifestyle, wellness. It was diarrhea, dysentery, typhoid, TB, cholera.
Yeah.
In the changing times, the learners will lead the world, and the learned will stay behind in the world that no longer exists. This whole universe is moving around. I think there should be continuous learning and development programs, and coaching should be taught to everyone at every level, not just the HR department. Each one of us has a responsibility of coaching each other. So I think I would say purpose. If people have purpose for what they're doing today in a company, they don't require framework or they don't require discipline. Discipline is not absence of freedom. In my view, it is a source of freedom. If there's a purpose, it becomes a source. So.
Thank you, purpose. And in one word.
My word is balance. As just going back to the human element, we are also, as caregivers, are also people, and we need all the right grounding. So, yeah, my word is balance.
Balance. Thank you. Now I would like to invite everyone, think on your one word and share with the audience. Thank you very much. Thank you all panelists. We learned a lot. And any questions, please reach out to us. And yes, sir.
Okay, we did have a couple questions here. I know, come on up here. I know you're first to jump up. I'm not going to let anyone get lazy. I told you 10,000 steps. You got to get to the mic if you want to talk. I'm not coming to you with the microphone. We got cameras all over the place to make sure that I don't get in the way of the online audience. So please, we do have a few minutes.
Yep. First, thank you very much. A very insightful discussion. Appreciate all of the elements and single word sort of comments that have come about. While we're talking about the human element, we're really talking about a very transitional healthcare mechanism. Since we are sitting here as innovators, we're talking about the human element. You talked about learning and continuous learning. But the fact remains that we are in between the old, very enforced process versus an evolving process and a bunch of disruptors. And like you said, you want talent and you want people who are excited and talented. But in the old system, you don't want those people. But in the new system, you want, those people are pushing the boundaries. So my question here is, and more than a question, it's about insights on how you balance. You brought it out very beautifully, that there's got to be a balance between a process, a driven process, versus something that's pushing at the boundaries. So, and that will really define your human element in terms of, what shall I say, motivation, purpose, and satisfaction. So I just thought I'll bring that up. Thank you. Thank you.
Yeah, no, thank you very much, absolutely. And I think that balance that you discuss, I absolutely agree, because we also speak about navigator. So sometimes is that liaison navigator that brings human element. Thank you so much. Next question, please.
Hello, thank you for a wonderful discussion. It's a subject that's very dear to my heart as someone who's left clinical medicine for all the reasons that you all mentioned. My first question was related to what Mr. Pranay was saying, was the how of how you talked about disrupting hierarchy and how important that is, but we all know humans are notoriously bad at giving up power. So I wanted to ask the panelists to share insights about success stories at this destabilization of power that is so necessary for successful change. And so my second question sort of piggybacks on that, which is what do you think of introducing physician resignation or loss of clinicians as a KPI? Like how can you hold physician leaders accountable? So someone talked about how if you don't know why your people are quitting, it's your fault. How can you bring that into the conversation where physician leaders and executives in healthcare systems are held accountable based on the attrition of the clinical workforce that they have? Thank you.
Thank you. I just want to make sure, hold on a second, re-emphasize so one question is how to prevent resignation, correct?
So how do you break down the hierarchy, which you already mentioned is important, but do you have insights as to how to best do it? And the second question, what are the strategies that you think would be good to bring hospital and healthcare system leaders accountable for this attrition of their workforce? Because one of the things you talked about is employee engagement, for example, but the people who are driving this and who are responsible for maintaining their employees, how do we make sure that we're holding them accountable to this very important responsibility? Doctors and nurses are very expensive to train, so losing them costs a lot of money. So how can we make sure we keep them? How do you hold the right people accountable to keeping them?
Can I? From a supplier side, not from the provider side, but I think life is same everywhere. Employees join hospitals or companies, but they leave their bosses. So I think coming back to it, it's a overall cultural development of leadership around the corporate, around the hospital. Then even if something goes wrong, one can counsel, one can talk, and one can divert the energy, which is instead of quitting, find a solution here. Because if you quit, there's no other heaven there. Wherever you will go, you'll find bosses there. If all the bosses, as a community, we are developing everyone else, I think things, so improve awareness about best practices, reward best practices, and try and reward with transparency best practices.
I want to make an addition, so thanks so much. Important. I want to mention the keyword value-based healthcare management. What does it mean? Also the developments in different countries, also in Switzerland, at the moment without a national strategy, but the PROMs, I think you heard it before, so the patient-oriented outcome measurements. And this could be a base to keep them motivated, the work staff. Why? Yes, patient-centered quality measurements as a key performance indicator, the question from this madam before, Dr. Saro. Yes, it's necessary to get the current status, make an analysis, how succeed and how satisfied the customers, in this case the clients are, the patients are. The perspective from the patient-centered, that's important because also for the mainly intrinsic motivated nursing staff, not only extrinsic through monetary benefits, etc. Also important, and also the balanced word, scheduling from the night shift, etc., work-life balance. It's also important, but the most important to keep them in the company, in the hospital or pre-hospital environment, interdisciplinary, to keep them. It's important to give them feedback in a new feedback culture, and the basis, therefore, should be the KPIs, patient-centered KPIs, PROMs. I will want to repeat it, to give them a feedback how successful the taking care and the treatments are. Also, the nursing treatments are important. I want to repeat it. We made this experience in the COVID epidemic phase as well, that they are very systemic relevant. So, back to the point. Give them feedbacks. Also, the quality of life, we heard it from the panel discussion before. The qualities are important, but it's just one KPI. There are a lot more, and also nurses' PROMs needs to be evaluated to keep them, to give them regular feedback, and to keep this staff into this in your company.
Fantastic. I'm going to actually give you guys a round of applause. You've done a great panel. You see, you've triggered some great emotion. I was going to invite you to stay up there, but let's give them a round of applause. We're going to move on with our agenda. Thank you, everyone, for coming up here. I know that someone was up there. I would love to hear your question and open it up for everybody. They're going to take a picture. That microphone likes to roll off that table. Not happening more than once. Anyway, they'll take a picture together. And any questions around this, it's really triggering. I know you have to feel free to get up there. They can't answer it now, but this engages a conversation for later. And this is how you connect. Hi. Mike, Ava, you guys, can we get the microphone is on? Still not on. Give it a second.
I'm giving it
There
a
we
second.
go. Let's hear.
Okay, so when I was in Tel Aviv University as a researcher and a teacher's assistant, I had these two very interesting perspectives. One was where I was teaching public health promotion and understanding the patient to the MD, MPH, or MPH, MD, whatever you want. The young doctors to come. And one thing that I found was that they were already burnt out by us, the public health promoters, talking about how the patient needs their bedside manner to be top-notch, and how their feedback to us was, we're seeing patient after patient after patient after patient. We're young, they're working all the time, more than 24 hours, and we're asking them to smile and to communicate the issues and the diseases, and they're already rolling our eyes at us. That's the young generation to come. We've got the older generation who, they see the doctor or view themselves as the doctor as, what I say goes. That's the end all and be all. So there are both of them who we have to communicate that it is patient-centered. And I just had to bring this note because I think this is really crucial. We had a wonderful young doctor come and teach the young MDs and public health promoters about what she did in the beginning of COVID-19 and how patients were so alone. Everybody was masked up. Nobody saw anybody's face. And the feeling was terrifying for the patients, and the doctors were absolutely burnt out completely to the core. And what she did was she had everybody in her, where she was working in the hospital, it was Ichilov. She had all the patients in the corona ward, all the doctors put their face on, take a picture, put their face on the back, and they were smiling. So every time they were dealing with the patient, they were dealing, but they would turn around and the patient would see who they're dealing with, and that ended up spreading out all over Israel, and that's another thing. So the burnout affects the patient, and so thank you.
Okay. Right, thank you for that. Thank you. There's no doubt cause and effect, right? Every action, there's a reaction, and we're seeing this and hearing and sharing these stories are so valuable. I love that it touched a nerve on so many of us that we were really engaged with that. I want to keep you awake, keep it going. We're changing from how to sustain your staff, because next door they got education, and they're talking about how the education system has to fix itself so that people can learn these tools in school. Right? So we're going to move from that conversation to our next conversation. One of our themes that you hear quite often is sustainability. So I'm going to welcome to the stage our next guest, which is actually a panel of guys standing here. So ready to come on stage. You guys are ready? Come on up. CEO Ahmed Omar. Abdelrahman Ahmed Omar, excuse me. Come on up. Give him a round of applause. CEO, he is our main sponsor, the Burjeel Hospital Silver sponsor. Great to have you here. I'll let you take it away. All right? You've been waiting. I see. I'll leave. Okay, bye-bye.
It's sustainability, I guess, and we need to keep you sustainably awake. After some lunch, I've seen that people start to settle down, and since we spoke to each other in the morning, a lot of people are having some jet lag or just arrived today and things. So we tried to make it a little bit more full of actions. Okay, I have a fantastic panel here. Lovely people. I've got 3 medical doctors originally. One, a genius scientist, and one is a guru who can affect the media and the public. So it's quite an exciting group of people here. Sorry. So, Rogerio Hashimoto, come in. Mr. Patnick, come. Mr. Artico, Dr. Artico, sorry, double doctors. And Vikas, and Dr. Yaiv. He's a cardiologist by trade, and we have an orthopedic surgeon, and I happen to be a colorectal surgeon before going to management. Mr. Hashimoto, can you just give everyone, please, just give a background about yourselves?
Everyone has a microphone. I want to make sure everyone has a mic so we could hear you all the way in the back.
Okay. It's my turn. Okay, hello everyone. My name is Rejo Hashimoto from Japan. I'm a CEO of the Medical Inc. And we are providing the content check system for medical and healthcare industry and media industry. So we are checking the content, whether or not this content is safe to view by 1,000 doctors. And I worked for Japanese television, and at the time I'm gathering the data of the healthcare and healthcare system. So today is a really exciting talk about the sustainability of the healthcare system. Thank you, man.
It's a great chance that somebody like him here, because of exposure to the world. He traveled the world during COVID, been in different places, and mainly also from Japan, which is a very exciting health system that's different to the rest of the world. There is a lot of equality and hitchhiking, the rich and the poor. So his reflection will be quite helpful. And now to my friend here, Patnick.
Yeah. As good afternoon. I think myself, Tushar Patnaik, and I'm from a factory background, the FMCG company called Dabur India Limited. And I have more than 23 years of experience in the field of health, safety, environment, and sustainability. The doctors and rest of the people will come later. Before going to the doctor, how to the environment make it more friendly. So that is my job. So after that, again comes into picture of the so take care of the sustainability of the healthcare system. So working in this profession very passionately for the last 23 years and doing a lot of jobs in terms of COVID by taking care of the health of the employees and many of the things. So after the later on discussion, we'll talk about more things. Thank you.
Patnick is also known as the king of plastic recycling. So I don't know how he's going to recycle our health system and make it sustainable. We're going to see things, right? Oh, Dr. Artico.
Hey, hi, nice everybody. I'm Fausto. I have multiple masters, PhDs. My background is the one of mathematician and computer scientist. Work in Silicon Valley, IBM TJ Watson Research Center, New York. And after I moved to pharma to help people in a different way, pharma was a completely cultural shock. So today, where I can add value with those other amazing people is to try to explain to you what I noticed could make healthcare systems much more resilient, considering that I'm an outsider, and that is essentially where I hope we can have a discussion. So thank you very much for inviting me today.
Good, thank you. And now for our cardiologists who just like caught up with us late a little bit. So you're going to tell us about your background. I know that you're a cardiologist, an invasive cardiologist, but for everybody to know, and how you link to sustainability in healthcare.
Okay, so it's related to the previous talk. I was a cardiologist working in a cath lab. After 5,000, I was completely burnt out. How I was burnt out, somebody entered and asked me, what's the name of the patient? And I said, I don't know. I became part of the machine. So I left. And I decided to do something which is missing to everybody, impact. I built a company. The company is now a hospital at home in Israel. We are serving every day about 2,000 people all over the country, acute patient, chronic patient. acute psychiatry. Everything at home. Instead of people going to the hospital is coming to their home. This is sustainability. Nobody has to drive to the hospital. Nobody has to stay there. The outcome, believe me, are much better. Why? Because the paradigm of medicine is changing. We are treating now chronic disease for many years. In the past, it was 2, 3, 5 years until the patient died. Now we can live 30, 40 years. And the hospital are not the answer for that. The community is the answer, and that's what we're doing. We're developing telemedicine, we're developing digital health, and we're using as tools to monitor and to treat people at home, but also every day somebody knocks on the door and the human factor touched the patient. That's what I do.
Great, great to hear that from someone from Israel, where there is a renowned, excellent health system, one of the best in the region and in the world. We used to take it as a hub for training, as well as a startup ideas and innovation. And now I can hear that there is an idea of changing the whole system. So Rampam and Sheba are gonna go, are they? Right. Now we have our doctor there, Vikas Jan. Oh, Jane, sorry. Vikas is a fellow surgeon. He's an orthopod. We're gonna see what Bond doctor gonna say now.
Thank you, Dr. Ahmed. A very good afternoon to all of you. I come from India. I'm an orthopedic surgeon. However, that's only an orthopedic surgeon by profession. Healthcare management, being an MBA into healthcare, makes me more passionate about healthcare management because I got to learn that if I remain a surgeon and remain myself into an operation theater, probably I'll not be able to work for the people, for all the gaps that I have understood that exist in the healthcare system. And that's exactly why we are here, to understand the healthcare sustainability. I'm also a 3D technology expert, a digital healthcare mentor for a lot of startups in India, and into corporate finance, where I'm into private equity investment. That's a small biodata that I have.
Yeah, that's good. So he left Bones long way. All right. I mean, it's going to be quite exciting discussion. It's going to be most of it an open-ended things to see how each one of them come with an idea and represent how to solve the problem. Because sustainability of healthcare is not an easy thing. It is something that's challenging, and we have to find a solution before 2030. That's our deadline. I mean, one of the most important things that have some experience in the NHS, as well as India, for example, Apollo, the United States, Japan, Far East, always there is a challenge about money. Where does the money come from? How can we sustain the supply of money? I believe that I can ask somebody here who's going to tell us about that. Whom of you is going to be talking about the finance?
That's me.
Yeah, that's you. Yes, exactly.
Okay. So one of the things that I noticed coming from outside pharma is there are not really the right financial incentives to put in place a sustainable healthcare ecosystem. Some of you are pursuing a plan for 2070, if I understood correctly.
Yes.
Right? And my experience is a very complex, multi-side market. It's not anymore business to consumer, it's business to business to business to business to consumer. And furthermore, it's not a linear thing, it's more like a graph. So how you make that sustainable, at least from the financial point of view? Well, the right incentive system is integrated insurances with government and so on, but also the financial aspect of that system from banking is important. I would cure my son, if I would have one, especially if he has a rare disease, and instead of buying a house, I put all the money that the bank can loan to me to cure my son and pay back in 40 years. Today, I still do not see those kind of tools in place. So that is a way of doing things. Another way of doing things is, and I don't know why they are not doing it, but it's not really a regulatory problem. It's more the fact that the financial instruments are not there too, and somebody simply needs to create them. Why we don't all pool some money and after doesn't matter who is going to get sick, that person gets cured, right? That is another way of doing things for the risk of the process. So there are some aspects from portfolio management on how you can de-risk things that today are not using pharma. And banking is still not very happy to put them in place because maybe they don't have the right background, or if something is happening to me and I'm going to die, who is going to pay the loan for my son? But tomorrow with emerging technologies that we can speak more, those things can be taken care of, and it's more a kind of coming together to just discuss what could look like those kind of financial incentives and instruments that we need to create, because really we already have all the pieces. They are simply not connected in the right way, and I don't know why people sometimes and our institutions are overlooking this aspect, that is the financial one. There are other aspects, we can speak more later about the other aspects, but those are just some ideas, and maybe here in Saudi Arabia we can do something that not even in US is still present, because from rare diseases that require one payment off to more long-term cures, all those things can really be the risk to bring to the masses, and especially to people that cannot pay today for cures, the cures that they need in ways that can be essentially amortized across the whole population.
Yeah. I mean, it's going to be a bit of a big challenge. There is so many systems that can finance the healthcare. There is compulsory ones. Could it be the state? Is it private sector? Is it insurance related? Is it a private-public partnership? Is it just printing blockchains and doing things? And
well, so I had the opportunity to discuss with some people at the MIT, right, that are working on those things. And they were saying, really, the major block and resistance is due to the fact nobody ever did those things, and they don't know how they are going to work out if sometimes it's happening to you. So the reality is the risk aversion that pharma has, especially as you were describing, highly regulated and complex environment that have a lot of legacy systems, that is making the situation difficult. But I think that, and I think too, as soon as somebody takes the lead and somebody takes that leap to make possible for some people to pay for cures in much longer term, amortizing costs, the better will be for everybody, because everybody else will follow. So it's always this kind of dynamic where who is going to be the first to take the risk?
Oh,
it's that one really. It doesn't matter if it comes from the private sector or the government, it's more who is
somebody gets the money. Right. I mean, sometimes when you have challenges, we go back to basics. What's the cause of trying to get treatment or health needs? In that stage, I'm going to go to Mr. Padnick here, who is Health and Safety Officer. He's got some interest in environmental impact on health systems. I mean, how can we go the other way around? How could the environment make our healthcare system sustainable? If we look after the environment, are we going to look after health and make it sustainable, or the other way around?
The topic is sustainability of the healthcare system. If you are talking about sustainability of any system, it lies on the 4 factors. One is first is on the environment. Second, as I already talked about, economical. Third is about your social. And fourth is your system stability. So the 4th factor, system stability of the healthcare system. You know, in my left-hand side and right-hand side, doctors, experts, scientists, everybody is sitting here. So when we're talking about healthcare system, when patient has on that condition, going to the hospital, doctor is there to treat it, technology is there, everybody is there. But I am, as a health and safety professional working in this field of 23 years, I'll mostly focus on how environment will reduce your healthcare system in the more reasonable. Because when you're talking about environment, because when a healthcare system will be more, I think, strengthened, that means from the environment point of view, this environment we are living, this environment we are eating, the lifestyle we are maintaining, this all depends on your entire environment. If you're talking about, I'm from India, the people are largely population, and it's a high pollutions in terms of water pollution, in terms of waste pollution, in terms of plastic waste pollution, a lot of pollution around that. And the water contaminated to the ground, and the people are cultivated the vegetables in the ground, and that's eating into the body, that's affecting your health system. And after affecting that health system and going to hospital for the healthcare system. So why, before going to the hospital, why not you take care of the first environment, which is the root cause for the sustainability of anything. So we should eat good food, good lifestyle, good healthy, and so that we should minimize the kinds of a hazards effect in the environment, so that the healthcare system will be sustainable. Because if you think during the pandemic, entire world has been crashed. So no system has been properly worked. Because for that, from the beginning of the stage, people has to learn and educate from the school level in education, how to make the environment friendly. So how to take, what is the water you are drinking, that should be free of contaminated. You should not get contaminated water during the food. Otherwise, a lot of materials is going into your body, a lot of diseases will occur. So that's the main point, is to take care of the environment first and make a healthy lifestyle and make your fit yourself, so that when you'll go to the healthcare system and the other part, definitely the technology and doctor, rest of the part, they'll touch up. So that's the basically I'm focusing about. Firstly, you have to protect your environment with a lot of measures. Without taking the lot of measures in the environment, if we are thinking about that, how robust is our healthcare system, whether government will support or the public-private partnership, it will up to exist in certain times. But before to that, what is the pre-actions to be taken? That is to be action taken about the environment. Unless you protect our environment, in the next 50 years, you know what will going to be happen in the world. A lot of glacier is melting and everything, a lot of temperature is going and going. So in spite of your highest technology and healthcare system, it will not work till the environment is free of hazards.
Oh, thank you. But just like mainly, this is going to come to a second question. Because if you look at our health care system, it's not only hospital. Pharmaceuticals, all right? They are the highest polluting industry for water ever. Hospitals are the highest consumers of plastic per inch, all right? So disposable. And the toxins, the highest toxins available easily in close to the public are in the hospitals and in the chemical industries, chemotherapies, radiotherapy, noise. So we are really, really bad at health care from that point of view. But we cannot go to zero straight away. And also we hit the environment and we're just feeding the cycle. The environment gets sick, we get back again. So what's your personal view about how we can make health care sustainable?
While you're talking about this environment, like the question is saying about, in a lot of pharmaceutical industry, a lot of pollution is happening. And if you see the industries which is using their water and discharging their water into that river, and when that is going to the river and people are cultivating their fruits and vegetables in the river, and the same kind of water drinking into their body. So first we have to eradicate the kind of pollution which is happening in the industry. Second point is that whatever the rejects or whatever the waste is coming out of the industry, that should be properly treated. One of the major things is told about your disposal of different kinds of plastics also into the environment. You know that during COVID and pandemic, a lot of things has been, biomedical waste has been generated. Actually, nobody knows what exactly goes the biomedical waste. Whether it has been disposed of properly or not. Nobody has that kind of data. Tomorrow, you don't know, if the dispose is not done in a scientific way, tomorrow it might lead to another kind of a virus, you don't know. So, kind of an environment, whatever the kind of a dispose you are disposing from the industry, it should be treated in the scientific way so that the hazards should be minimized and should not affect to the environment or should not affect to the water body. So proper disposal mechanism. In that ground, I can say that in the last 3 years, I'm working in the kind of a waste management in India, and people knows me in India as working in many of the waste management, and particularly in terms of plastic waste management declare. So whatever the plastic is generated from the industry, that is properly disposed of and going to the recycling industry, all the co-processing industry, so that the virgin plastic will reduce and the carbon footprint will reduce from the atmosphere. When the carbon footprint is reduced, that means environment moves to be more friendly way. That's why I know this first part, if you've taken care of this system, I know the India is going, and the entire world is emerging, if you, a lot of developed countries, they have very good healthcare systems. But when you are talking about healthcare system, it is not that affordability of many of the people. When you are talking about healthcare system, it should be affordable, it should be easily accessible. So for that reason, we have to find out new technologies, new things, and should be cost minimizations. Okay. So for that part also, healthcare systems plays an important role in terms of a sustainable environment.
Okay, thank you very much. Vikas, I'm going to ask you a question. You are into ecosystem and optimization. So how could that serve us in this idea? We started with the dilemma. There is partial solutions. I'm not saying there's full solutions. How your ecosystem and optimization come into it?
Yeah, so when you talk in terms of healthcare, you know, we just recently heard Tushar saying about environment. Let me say he was talking about the ecological environment, right? In healthcare, we also have another environment, and that is the immediate environment that we have around us. Now I'll focus on optimization. Optimization is a word which is a very important word when you talk in terms of any sustainability. You know, whenever you want any process or any product to be in a sustainable mode, there are a lot of stakeholders in the healthcare ecosystem which needs to be optimized. I am being asked at times on platform as to why a particular hospital has not worked or why it is not, because the resources that are created in a healthcare system, it's a service industry. It's not like any other industry where you have a raw material and you process it and you have a finished product. Here, it's a human being, you know, and a human being has to pass through a process of treating them. So there are lots of processes which needs to be optimized. If you think in terms of ecosystem, we all know apart from we as humans, we have community around us, then we have service providers, we have governments, we have insurance companies, we have regulators. All of them will have to work in tandem, in synchrony, in order to create an optimization so that this healthcare becomes sustainable. I'll just give a 6E concept, you know, and you can just use those E's. You know, the first E is the ecosystem, and the other 5E, one, he was talking in terms of an environment. The other thing is efficiency. So you can use the word efficiency in various resources, and then you would know. So cost efficiency is one, quality efficiency is one. Then comes equilibrium. We do not think in terms of equilibrium. Someone was talking in terms of balance. So that's equilibrium. So we need to achieve equilibrium. Preventive health care has to be in equilibrium with therapeutic health care. It cannot be only therapeutic health care and no one is focusing on preventive health care. Then comes energy and effectiveness. So energy always, you know, we live in this galaxy which is all energy. Even the healthcare is energy. So there are people who believe in energy. So it is the energy which has to be optimized. And it is the effectiveness of all these processes or the products that are going to be in the healthcare system, which again needs to be optimized. So these are the six E's for a simple formula which you can use using an optimization principle. You can put them to different stakeholders, and then you will start to get solutions to the challenges that everyone is facing in healthcare.
Great. I can add another E, which is excellent. Thank you. Hashimoto. All right. So we just would like to see your views about things. Was relevant to your background, because you've got a very interesting background. So can you tell us what you think about the sustainability in healthcare?
Okay, thank you. I'd like to more focus on the human side, or can I say people side, because everyone in this conference room is belonging to the medical and healthcare industry. They're, you know, inventing new technology and a new healthcare system, and it's really great work, and I respect all of you. But may I talk about the people who is not belonging to this industry?
Yes, I'm sure.
So, like me, I'm coming from the media industry, and I studied chemistry in my university, but not studied in medical things. And in Japan, the medical doctors and dental doctors are 0.34% in the whole populations. And healthcare providers, including these doctors, are just around 2.0%. And you know what I mean? 98% of people in Japan is not belong to the medical and healthcare system. It means 98% people don't know many things about the healthcare system or health, you know, these kind of literacies. So if you make a very, very impressive innovation in this field, and maybe it will work very much and help people's life very much. But, you know, let you think how people understand the value of the innovations. How? They don't know much about the healthcare's knowledge. How do they know the value of the innovations? No, they can't. So my point of view to sustainability of the healthcare is the key point is improving the people's health literacy to understand the value of the innovations. So the question is, which side we are standing for? Standing for the medical industry or standing for non-medical industry? No, we should stand for both sides, the medical industry and the patient side, and not only the patient side, and not every people. So that's why we need to improve the health literacy, right?
Actually, the idea of health literacy and health education always played a big role into sustainability of good health, because we talk about universal. I mean, most of us here are fortunate to be coming from systems where there is at least human level care. I mean, like there are certain areas in South America, in Africa, or even in some parts of Australia that just hand washing and fresh water are good enough. So absolutely yes, it comes within. Actually, they say that the eye can see what the brain sees. If you cannot see it in your brain, you cannot see it with your eyes. And if you don't have the knowledge, you cannot go for it, which is very good. This goes back to a combination of a lot of things, knowledge, community, education, finance, and everything. The Israeli experiment is very interesting. Would like you just to give us a little bit more about healthcare at home.
Okay, but let me answer first to what you said. I think the main thing is to flip the pyramid. And what do I mean? Sustainability can be when you put your investment, money, innovation in preventive medicine and not in therapeutic medicine. Therapeutic medicine is in many sense in the top of the pyramid of what we're doing every day, but at the end of the day, if you prevent the disease from happening, you eliminate problem of sustainability. So that's what we have to do, to go from therapeutic medicine to preventive medicine as a concept, as startups, as everybody's trying to get another flip of an ECG that I will know with digital medicine. They're putting million in there. Put the million in preventive medicine. When I was a medical student in Beersheba, 1982, what I did, I took medical students and taught them to go to school and to teach health education. This project is working all over Israel until today. Each of the students get a grant so he can do it. And it starts with education. It starts from the kindergarten. And when you prevent the disease, you are completely sustainable. And that's, by the way, on the other side, we do in a hospital at home. One of the growing issues in hospital at home is palliative care. And what is palliative care? We have about 1,000 people now that we are treating at the end of life. And what we're trying to do there is to convince the oncology, stop treating the patient. Stop using pharmaceutical things. Stop giving chemotherapy. It's the end of life. They don't stop, never. They use technology, they use PET-CT, whatever. But sometimes you have to stop treating. You have to be there to hold the end. So those are the things that we have to take in mind and to start changing. That's what we're doing.
Actually, it's good. We know that it's not a movement only in Israel, but since you mentioned palliation, there is hospice at home, which is quite common practice. We had a lot of people did not come to hospitals, but they're treated at home during the COVID time.
Yeah.
Hospitals were empty, almost.
We treated a lot of people in COVID
mortality rate did not go up if you take COVID out and car accidents, so it just dropped down. Yes, it's got some point. But also the idea of education and preventive medicine. Why people are not chasing on preventive medicine? Because there is no money in it. Why should I do an app that prevent disease? Who's going to buy it? But if I had diabetic thing, a lot of people will buy it. This is simple thing. Every startup wants to be a unicorn.
Yeah, but this is investment
in humanity,
in infrastructure. This what government has to take in responsibility to change the pyramid. This is the investment of any government in the world that they have to do, to invest in preventive medicine, to start to do it with large money. It's true. It needs a lot of money.
I tell you, I'm from the UAE here. This is easier said in UAE and it's practiced. UAE is pushing for health education, preventive medicine, vaccinations, old age care, exercise, loss of weight. Because they have the money. Honestly, we have the money. This is the government. Nobody pays anything, no tax.
Yeah.
They pay from their own pocket. It's easy to say that here. But the minute we get out of here, it becomes a burden. Because the government says like, oh my God, how much of the GDP wants us to put for health? The private sector have to jump in. And the private sector said, yeah, we're private because we want to make money. Okay. There is a little bit of an argument there that people are not truthful to the cost.
So let me tell you about the cost. In our services, people pay zero money. Nobody pays us. Why? We show the government, the insurance company, the HMO, the stakeholders, that we are doing it much, much cheaper than being in the hospital. So that they're saying, take the money, do it.
Oh, you're a good guy. UAE just acquired 25% of one of the biggest health insurance companies in Israel.
We're talking with the man.
Yeah, so it was the man. So it's good. UAE made money now, straight away. So it's good. All right.
Can I add something to what he said? Because I work a lot on longevity. And since he's talking in terms of preventive healthcare, there's a different way to look at it. How many of you in this hall would want to live 80 years, where first 40 years is not having any disease, and the next 40 years is what you have to live with disease? How many of you would want to live that way? Can you think of a life where you have all lifestyle diseases, and these lifestyle diseases come to us at a very early stage of 40 years, 35 years. And this lifestyle disease is a huge burden. It's a socio-economic burden and a challenge to the sustainability of the healthcare systems. So what he says, preventive healthcare is where the humanity has to look at. The stakeholders, the government, the global leaders have to look at it, even if there's no money. if you really want the mankind or a humankind to survive disease-free, first thing is we have to focus on prevention.
This is what I was looking for. Not individualistic thinking. Think as you're part of the human pool in planet Earth.
Yes.
See it from outside. Sit in the moon and look at planet Earth. This is home for everyone,
Yes.
for every human, for everything that lives on it. So it's our duty all to look into it. I mean, like
Planet, people, and profit. All three have to be in equilibrium,
Together.
as I rightly said. It
Oh,
cannot be only profit.
I pulled him out of profit, he went back to it. Okay, so I mean, like I think that we had some nice experiences and point of views. This is by no chance, okay, an answer to all what we call sustainability. This is why we're having more and more talks about it. And it seems to be like the whole meeting is going around sustainability and health quality of care and how to cover the ESGs around and go for the UN Sustainable Development Program aims in generality, which is quite exciting things. We have few minutes, and I think that if there is any challenging questions, please come up with it.
Let's give him a round of applause, please. We had a great panel. Dr. Amen, great panel. And we do invite you up to the microphone. So who's taking those steps in to come get a conversation going here on stage as we're streaming live Health 2 Conf? Anyone for questions?
You can ask questions. We're not going to ask you a question.
You won't answer them? Sustainability. Anyone dealing with that in their business that wants to address or even share their experience? Because this is an opportunity to share. Anybody going once? Oh,
All right,
coming up,
okay.
coming up. Thank you for the courage. Mic's on.
Thank you. Thank you for that very interesting talk. And I know that sustainability is an upcoming topic in health. I'm a co-editor-in-chief of the International Journal of Digital Health. And I'd like to ask, is there any way, or what are your insights with regards to sustainability in terms of health data? Because as we all know, we are moving towards big data, we're collecting data in wearables with all sorts of AI systems, but in 5 to 10 years' time, nobody has really come up with something that's sustainable for data. So what are your insights on that?
Oh.
Can I answer that?
Yes. I'll follow you, don't worry.
That's a very good question. Data basically is an information, and in healthcare, every individual is generating information of their own body in a very dynamic way, right? The whole idea behind aggregation of this data is for the purpose of analytics, where you can bring an inference or a research or a study which would be for the betterment of the mankind, So the people who are working on a digital platform, who are working on data analytics, who are wanting to aggregate all form of healthcare information data, the sustainability, the key thing would be if you are rightly going to use that particular data. First is that the data has to be like, it should not be, it should not be revealed. It has to have some form of a way in which the people whose data is used, they don't feel insecure. There should not be data piracy. But it should be used in the manner which is good for the mankind. And then only it will be sustainable. Otherwise, people are going to avoid other people who want to collect that data, aggregate that data, and work on it. There's a business model that works on data, and that's exactly the reason why it faces challenges as far as data analytics is concerned.
I'm working on big data, right?
Yeah.
So you don't need all that type of data, but from time to time you need to integrate new data sources to understand if those data sources are important or not. So as more and more data gets generated, don't worry too much. You don't need to store and use all the data, but you need new forms of data from time to time to assess how you modify your models or if you can get new insights. And after you continue to focus on only what is most important, as in future you wait for other data sources that you will have to test from time to time. Discard all the rest. Right?
Good. I mean, these are experts in the area, but I tell you from clinical point of view, health system have got one of the most robust and the largest data about anything in the world. Each and every patient went to see a doctor, there's a data, whether it's stored or not. And data is now became the root for innovative work, innovations. AI is coming. We need to know, study the pattern, know what's going on, predict the future. And all these things are data linked. Yes, there is strong regulations about data, leak, usage, what is for, things like that. We have to streamline it properly. But there is no data loss. Most of the time, we have a storage of about 40 to 60% of the data in the world properly stored in digital system. Now in the cloud, we are using Azure, we're using Apple. It's there. People think about using it in AI system for analysis. People think about monetizing it, okay, to sell it to whoever wants it in the pharmaceutical industry to study things on it. This is not the issue. The issue is we're having something that we learn from, and we know the behavior, and we can predict the future, and we know how to prevent things before they happen, and we know how to manage things when they happen. So it is there. It's not only for finance, not only for fun or apps. It is there for the future of humanity, and I think we are doing a good job with it. But you have to relax a little bit on the restrictions. We have to use it as a human owned information rather than a special sector closed up. I think that I've got a big sign here that says time's up. Thank you very much for your listening and supporting us, and welcome again to the conference, and I believe that we'll carry on for the rest of the days. Thank you very much.
Thank you, all of you. Thank you.
Thank you, panelists. Incredible. Thank you very much, Doctor. It's great to have you guys here. If we can ask you to stand up to the stage so we can have a photo. That's a roller mic. Yeah. Drop the mic. It's okay. Over here. It's definitely not sustainable. Awesome. What a great session, having all these great experts sharing all their insight to this big issue that we're all dealing with some way or another. Sustainability is a big conversation, and addressing it in the best way possible is what we're here to do. So thank you again. Give him a round of applause. Thank you, Doctor. Thank you very much. Silver sponsor, we wouldn't be here without him, so thank this guy when you're out there catching a cup of coffee with him. It's great to have sponsors on board to make these events possible. And thanks for turning down the lights. Thought I was going to melt for a while, but really, really nice to see you guys. This is who I am, so if you were wondering or you came in late, who's this lady on the stage taking you through the health journey with experts from around the world? My name is Rachel Muleman. I am with a company called the Business Advisors, and we actually help drive revenue for businesses and love to be a global business presenter, so that we're here to talk about these topics and bring it all together so that you guys can get the best out of these events. My goal is for you to leave and be connected. Your goal is to learn and learn new things that you could bring into your job and to your careers and to your parts of the world. Now, I just want to know from a row of hands, how many people connected with people on LinkedIn? Anybody following people on LinkedIn? Great. Okay, that means that you're using digital. As we're talking about digital, the power of digital is happening, so I want to make sure you're doing it. I am watching the hashtag Health2Conf. Show of hands, who's using it? Well done. Well done. The organizers are going to see you and reshare. That means more people get to know who you are. Okay? I'm a connection catalyst, and I know if I go to Google and I search your name, that is how I know and start judging you based on whatever you're doing. And this is how people are being judged today. So as we're at these events, I want to empower you to make the most out of these events. You are who Google says you are. So Google yourself if you haven't done it. And if you're hashtagging, you're going to find your name comes up with this event. So make sure you make the most of this by hashtagging it and sharing effectively. Anyone you meet, take a picture, post, hashtag them, and tag them in the activity as well. And I love LinkedIn for that because it's the only business portal. But as you know, there's 9 million social media platforms today, and it's probably still growing. So this time of the day is where we have that second half where we love to recognize the experts in the room. So who's an expert in the room? Nobody.
Hands, dead silence. I need some coffee after this break, right? I'm going to ask you again, who's an expert in the room coming here to connect at Health 2.0? Thank you very much. I want to keep you guys awake. I know it's a long agenda, lots of information. In order to make sure that we don't get too stagnant, I'm going to ask you to do a little activity before we start interacting and calling up the recognition awards, okay? So, look to your left, look to your right, really quick. If there is someone that you haven't met, take this moment. I'm going to take a 2-minute activity. Say hello to the person to your left or your right if you don't know who they are, and find out really quick their name. Really quick. We're going to wake up a little bit. I see it's going downhill after lunch, that biryani, those potatoes. All right? The idea is that sometimes it's scary to come into an event. Who am I going to meet? Who are these people? Right? Now, I wanted you to take it a step further. Find them on LinkedIn. Everyone has their phone. I heard one ringing earlier, so try to put it on mute for the rest of the day, but find them on LinkedIn. Okay? While you're connecting, and connect. I know business cards are getting old. You know, people are not bringing business cards around anymore. Now they're doing QR codes to connect. And as you saw my QR code up earlier, you could scan that and find me really easily, Rachel Muleman. All right, see people connecting. It should be all about new connections. So fantastic. Easy peasy? Who met a new person? Okay, so that means you're engaged. Fantastic, well done, and thank you for being here. So moving forward, it's time we start to honor the people for their outstanding contributions made by experts in the healthcare industry and why we're here today. So we are excited to have you here to celebrate, and we are talking about technology, innovation, and we're talking about industry collaboration. So we started the day off all about this collaboration. Let's see where it's going to take us now. We are going to welcome on the stage to help present these awards, Jennifer Williams. Jennifer, come on up to the stage. I need your help. We got tons of awards to give out. Give her a round of applause. Jennifer is CEO of Virtual Career Institute International. Yeah, come on up to the side over here. She is basically going to help me with all these awards. We have all these healthcare industries that are coming up today. I have a feeling you're here for one of our other events, right? Yes. Cool. Which one you come for? You come for education? Great. So much expertise coming and sharing. So it's great to kind of cross over these rooms and meet other people that could really, impact your life. So thank you for joining us today. I'm going to ask you just to stand up here. They'll give you the award. We'll have the award recognition coming up on that side. Take a picture with Jennifer, and then we'll slowly ask you and invite you to the microphone to just say a word or two about what you're here and what you want to get out of this event so people can help you with your mission, okay? Then you can leave from this side. All right, ready to go. First person I'd like to recognize is Dr. A.J. Gangoli. Dr. A.J., give him a round of applause. Come on. We're going to find out what he did and what's he doing in health. All right. Music got a little better? Yeah? Thumbs up if you like the music. Thumbs up. Okay. Wonderful. Now time to smile for paparazzi as the photographer help guides him. Come on in. I love everyone shows up for recognition. This is a great time. All that hard work is paying off as people watch live on YouTube and see you shine in this moment. Thank you. Great. Come on over here. Let's find out, how did you get this great recognition?
So, good afternoon, everyone. I'm Dr. Ajay Gangoli. I'm the director at Muljibai Patel Urological Hospital in Nadiad in Gujarat state in India. And we're a hospital which specializes only one organ. We treat only the kidney. And we've been in existence for 44 years. We were the first, one of the first hospitals to actually do a transplant in the country. And we're looking forward to, of course, advancing that and doing the best we can with the organ. Thank you.
Congratulations. Wow, first transplant. Interesting. Great conversation piece, right, during coffee break? All right, next person we'd like to recognize, Dr. Benedict Brunemann, MD. Come on up to the stage. Dr. Benedict, give him a round of applause. From Switzerland, I heard him on the microphone earlier. Lots of information to share, I'm sure. All of this hard work finally gets to pay off when you have this great award of recognition, right? You could brag to friends, colleagues, look what I got, and it's gorgeous. Congratulations. Hi, congratulations.
I'm Dr. Brenneman from Switzerland, and I've spent about 26 years in medical devices and more recently in food supplements and I'm here because I think there is a lot to do in wellness and aging healthy. So nobody wants to die, but I think we all have to. And if we can die healthy, I think that's a good thing to do.
There is no doubt food is directly connected to this industry, right? I'm sure that's a whole nother conversation. Don't want to open up too many cans of worms, but we'll keep going. All right, next up, please welcome to the stage Dr. Med Otilia Gudana. Come on up to the stage, give her a round of applause. All right, she's going to take a picture here. Say hello to the world as they watch live on YouTube. All that hard work, everyone in this room getting these awards. You have done an immaculate job. We can't wait to hear. How did you get that great award?
Thank you so much. I feel deeply honored to be here tonight and receiving this award. I'm a doctor in psychosomatic medicine, currently working in the field of forensic psychiatric, and I'm a big mental health care advocate. A special thank you to everyone who believed and supported me and trusted me throughout my journey in my life and my career, my family, my patients, and yeah, thank you for everything. I dedicate this award to all of you. Thank you.
Wonderful. Wonderful. We keep going from mental health to AI. We got everyone here, right? Exciting. I get very excited about this stuff. All right, next to the stage, let's welcome Dr. Mohammed Imran. We are here to recognize your achievement in health. Give him a round of applause, please. Thank you. All right, come on over here to the mic. We want to hear from you. Congratulations.
Good afternoon, and thank you very much, Health 2.0. And I'm working for last 18 years in IT field as well as healthcare. I believe healthcare doesn't start from the hospital. Healthcare starts from the home or wherever we are. So actually, hospital is for sick care. I hope tomorrow I can share some more insight. Thank you very much.
Congrats, congrats. Okay, we're moving along. We got a next person. Please put your hands together for Paolo Lomonaco. Come on up to the stage. It's time to be recognized. Paolo.
Paolo is on his way up, and it's so exciting to find out the impact you've made to the industry. You hear people with 10, 20, 30 years experience in this industry. That's a lot of time. A lot of time, and we want to know, how are you impacting health today? Come on over here. Congratulations, Paolo. How are you? Congratulations.
Thank you.
You're welcome.
Hello. Yeah. First, I think I am not the only not doctor in the room. So I am here in representation of Al Kayat Investment, is one of the leading provider of healthcare and medical support here in the UAE. So we are obviously very happy and grateful of the recognition, and I take it is obviously in recognition for my company support to healthcare in the region. Thank you to everybody, and obviously very keen to get in contact with everybody who is interested to enter the UAE healthcare industry. Bye-bye.
Okay, bear with me for a second. We got a lot of experts. It's easy to get confused when this list is long. So let's welcome to the next person in the industry of health to the stage, Natsuhiko Yamada. Come on up to the stage. It's time to be recognized. You know, people are traveling all over the globe to be recognized, to get this award. It's great to have you here. Smile to the cameras. Congratulations. Come on up to the mic.
Good evening, everyone. I'm Natsuhiko Yamada from Japan. I'm the founder and former executive director of non-profit organization Glokaland. And I'm afraid to add that unlike other outstanding awardees and past awardees, I am just 26 and inexperienced. And now I'm currently work as a pediatric resident doctor. And I also belong to Global Shapers community, which is the latest addition to World Economic Forum. The organization is trying to solve health disparity within the country, especially in remote islands and rural areas in Japan and across the world, addressing social determinants of health. Thank you.
Wonderful. Thank you very much. Don't forget to thank your husbands, your wives, your kids when you come up here. You know, if they're watching, you know they want to hear their names. There's no doubt. Your friends, your colleagues, anyone that you feel needs to support you, they're watching online. If you shared the link on YouTube, they could watch it tomorrow if you missed it today. So take the opportunity, please do share, because we understood from, you know, the conversion of people that leaving jobs, people want to be valued. They want to be recognized, right? So if we use that as humanity, we all become a stronger place to live. Okay, next on the list, please welcome to the stage Randolph Kirschbaumer. Time to be recognized. Randolph. Yep. Great. Come on over here. Congratulations.
Hello, good afternoon. So I'm Randolph Kirschbaumer. I'm the CEO of OncoOne. I've got 25 years of experience in pharmaceutical research and development. I'm the CEO of OncoOne. OncoOne is a Vienna-based biotech company working on the next generation immuno-oncology medicines. And innovation doesn't come from nowhere, so we are actively looking for investments and also for partnerships in order to be able to advance our developments forward into the clinic and we move them forward to the patients in need. Thank you, it's great to be here.
Okay, next up to be recognized, can I welcome to the stage Mohammed Ramal. Come on up here, Mohammed. It's time to be recognized. All the way from the back, you heard him on a panel. Great insight from the Netherlands, right? We had a lot of information shared today. Let's see if you remember everything and everyone and what they did, because if you didn't remember them from the panel, we're bringing them up here to recognize them and their achievements. This Health2Conf is a hashtag. Be sure to use it. I love photographs. You must have enjoyed what he had to say. Oh, from Lebanon, welcome, Mr. Mohammed. Please take congrats.
Yeah, I got it. Thank you, Rachel. Good evening, everybody. My name is Mohammed Ramal. I'm the CEO and co-founder of Cure Leads, which is a Middle East, North Africa biopharma company. I've been in the pharmaceutical industry for more than 26 years, working with the multinational companies with a special focus in oncology. So it's great. Congratulations, Randall, for your work. Now, I feel really very humbled and privileged to receive this award tonight. And special tribute to, first, my family, Rana, my beloved wife, and my son, Firas, and the 3 daughters, my angels, Ward, Rahaf, and Ghazal. They are really behind of all the journey I've been through, and they made me who I am today. Second is also my tribute to my colleagues and friends at Cure Leads, with whom they have taken with me the risk as well as the obligation and the commitment to start up a company 3 years ago in October 2019, at the time when the world has been facing a lot of turbulence. So we started up Cure Leads 3 years ago out of Dubai and Lebanon. And in spite of all the challenges and the agony, it's been a journey of courage, a journey of determination and resilience. And we are right now one of the fastest growing startups in the region. So perseverance creates success, and that's my message to everybody. Never give up. It's always a shame to waste a crisis. So thank you so much for the award and for the recognition, and I look forward to speaking to you. Thank you.
Thank you. Okay, next up, we'd like to invite up Sylvia McCullough. Give her a round of applause. Sylvia McCullough, time to shine. She joined us already a couple times on stage. I recognize those shoes anywhere, so come on up, right? Congratulations. Let's smile for the world as we're all digital today. And if you liked anything anyone said, make sure to take a picture, put your thoughts, your questions, and engage. And fantastic. Come on over here. We heard you talking, so she has lots of expertise here to share in this industry, no doubt. Here's a moment to thank anyone you'd like.
Well, I'm Sylvia Micalo. I'm a biotechnologist as a professional, and I come from the pharmaceutical industry, where I've been there for 15 years making my career. Recently, 3 years ago, I decided to start Sunshine Oxygen and conceptualize some technologies that could contribute to the sustainability of healthcare ecosystems. Now we have a pipeline of three health tech solutions that want or aim to make this shift that we all of us want. But the biggest success of all this is having consolidated the team, which is it's not easy to create a highly talented team that what we do have in Sunshine Oxygen. From one side, we have collaborators, and from the other side, we have some volunteers that at the same time share their contributions to the company together with their collaborations in very big corporations, but as counselors. At the same time, I've written a book, which is Health Technology, Health Tech Innovation, and it's related to health tech, and where I share what my visions of the healthcare industry, the next steps that we have in front of us, the achievements, and I kind of share my impressions about where are the opportunities, and I highlight some of the opportunities in the different healthcare systems around the world. And also, well, I took or collected lots of best practices examples, like colleagues like us that wake up every day to make a shift, entrepreneurs, SMS, medium-sized companies, scale-ups, and startups that we are contributing to make this shift. All in all best practices collected in this work that I hope that helps a lot of people, as it helped me to write it. And finally, I collaborate with different things. I teach at university, and I also am a member of the jury of different startups contests, and I help day to day as a volunteer. I help many startups that they have different barriers along the path, and I try to do my best, give my humble opinion, and sometimes it works and others doesn't. But well, thank you so much to all of you. This is not an easy path. We have a lot of things to do, a lot of work forward in front of us. So I take this as a reminder of all the work that we have in front of us, and that we are for sure making a difference very soon. Thank you so much.
Okay, just got to remind everybody, we are on a tight timeline. I want to give everyone a few minutes to actually say thank you and say their regards, and of course, show their value. If you're looking for something from this event, now's the time on the mic, right? But let's be cautious. Everyone wants to speak. We just want to make sure that we keep to our agenda, or else the panelists for the next half a day do get cut short. So I appreciate your understanding here, and I'm going to call up the next person as we move along. Please welcome to the stage another Sylvia Vitos. Sylvia Vitos, come on up, come on up. It's time to shine. Well done. This is a moment of history for each and every one of you, and we want to make it special. So thank you for everything you've done for this industry. How are you? Take a moment to thank whoever you need to.
Thanks. Thank you so much. I'm really, truly honored to receive this award. My name is Sylvia Vitos, and it's a privilege to be in the healthiest room of Dubai today. May I ask you a question? How many of you think that you live a healthy lifestyle? Hands up quickly, please. Yeah. The global scale looks very similar. It's apparently less than 3% of the people who live a healthy lifestyle. And combining it with the fact that 95% of all chronic diseases are caused by lifestyle choices, this leads to my mission, which is to create a happier and healthier society, and to actively support UAE's inspiring leaders with their vision as well. We do that through empowering leaders to enhance their well-being so that they can lead and inspire others as their best version of themselves, mentally, physically, and emotionally. And we do that through coaching, mentoring, and training programs. And we also help organizations to cultivate well-being as a way of life through tailor-made programs and initiatives. So any of you, if you would like to connect, we are here with my colleagues throughout the weekend and looking forward to speaking to you. Thank you so much.
Okay, well done.
Amazing. Next one, up to the stage for amazing recognition of what you're doing for the health industry is Thivanya Raman. Thivanya Raman, come on up to the stage. Time to shine. I want you to get that picture. You're going to be sharing with colleagues, family. Years of experience in the health industry is not easy for any of us. We're going to hear the hardships, the difficulties, the challenges that are continuous throughout our life. Thank you for everything you guys are doing for this industry today. Photographers right there. Well done. All right, come on over here. They're watching live. Come on over to the mic. Let us know how you're impacting this industry. Congratulations.
Good afternoon, everyone. Thank you so much. Sorry about that. So thank you so much, Health 2.0, for this opportunity. I am really honored to be here and actually very excited to meet all of you here. My name is Thivanya Raman. I'm from Singapore, and I am the founder of Happy Days Collective. So what we do, we are basically holistic health and wellness service provider in Singapore, where we combine different dimensions of health and wellness practices. Namely, we focus on mental health, physical health, emotional health, financial health, and spiritual health. So what we try to do is to help our clients create a individualized or tailor-made wellness program that is focused on each specific individual's needs to help them live basically a happier life and a more fulfilling life. Once again, I would like to thank my family, especially my husband, who is here with me, supporting me throughout this journey, and I look forward to meeting all of you here. Thank you so much.
Wonderful. I got that she helps a lot of people. Don't you? Right? Everyone's listening? You guys awake out there? All right, I need you to stay awake with me. I need you to get excited because we got more people to recognize. Next person up, this is actually a business. We're going to recognize the Tuit Technology Solutions Limited. So would Robin Francis please come up to collect this on behalf of this business? Come on, Robin Francis. Give him a round of applause. Businesses are making a difference. We can't do it without them. Individuals are making a difference. The power each one of us has is incredible. So well done for everyone that's coming up. Today is day one of Health 2.0 Winter Edition, and it's so nice to be your host and be here with all these experts. Congratulations. You want to take a minute to just check?
Hi, good afternoon. And I'm extremely happy to be receiving this award. And this journey was not possible without a huge support from my family, my team. And a special thanks to all of them, especially my parents, my wife, my kid. And yeah, thank you, team. Thing is, I'm extremely happy to be around people in the same room, doctors, medical professionals, expertise, technicians, visionaries, entrepreneurs coming together to actually change the way we look about health and how we can actually build a better sustainable ecosystem. And extremely happy to be seeing and being able to be here. We see health change. Healthcare is evolving. When you look into healthcare, every country is trying different things, and things are not the same with country to country. We see primary care shifting to homes. We see AI-based services and products getting better and better. We see preventive medicines being popular. But in India, we Pivot.life is an advanced healthcare platform focusing on promoting and providing access to advanced healthcare like DNA-based services, genome testings, to understand health risk by birth and set up a preventive methods, lifestyle, stem cell-based regenerative therapies, unique mental wellness programs in the workspace, and many more things, these are all initial phase ones which I'm talking about. So it's been a wonderful journey, and special thanks to the organizers to make sure this is happening, and yeah, thank you. Thank you.
Thank you very much. Congratulations. Okay, let's welcome Karen Rosenstein. Can you please come on up to the stage? Come on up, it's time to get recognized. You've seen her up here. Fantastic insight. Really nice to see you again. Say hello to the world. You're being recognized at Health 2.0. It's great to have you here. Well done. Congratulations.
Hi, everyone. Good afternoon. I'm Ken Rosenstein, and for the past 3 years, I was working on building a technological emergency room. We build a unique model that provides high quality and time-efficient medical care for remote places. In those 3 years, I was able to raise funds to raise collaboration with Sheba Hospital, which is the #9 best hospital in the world, health startup, and the Ministry of Health. However, one person can't make a change by themselves, and I truly believe that you're only as good as the people you're working with. And luckily, I was able to work and to learn from the best. And this award actually dedicated to everyone, and there has been so many people. I was lucky enough to believe in this dream and come along with me to this journey. So thank you, everyone.
Man, we have so many professionals here. We're going to keep on going. Hope you're sticking with me. Next person to the stage, Sue-Ann Lee. Give her a round of applause, Sue-Ann Lee. Another person in health that we'd like to recognize. Again, I love to see what everyone does with these great awards. Do you stick it on your wall? Do you bring it to the office? Maybe you stick it at your home. Share with your spouse. Share with your kids. This is incredible, and this is part of the credibility of who you are and how you're going to be found by others that don't know you yet for the impact that you've been able to do. Congratulations.
Hi, good afternoon, everyone. My name is Sue-Ann. I'm a radiologist, and I've been in practice for 14 years. I'm also one of the directors of Quantum Medical Imaging Singapore. Quantum provides specialist outpatient medical imaging services in the form of MRI, ultrasound, and X-rays. We actually had this idea that we would be an affordable and accessible healthcare clinic that will reduce waiting and turnaround times. So I would like to take this opportunity today to thank my team, my family, and of course the organizers for this privilege and honor and a beautiful conference. Thank you.
Thank you very much. Okay, next, we're going to invite to the stage Dr. Anish Verghese. Come on up to the stage. Dr. Anish, it's time to shine. Give him a round of applause. We've been sitting all day. This is the best, exercise we can get today. All right, there's our music. Thank you, AV. Just think, everyone has a story of why they're here and what they're doing, how they're impacting this industry. Well done. Come on over. Come on down. Congratulations. How'd you get this great recognition? Let us know.
Good evening, ladies and gentlemen. This is truly a great honor to receive this award, And first and foremost, I also thank and congratulate Conference 2.0 to organize such a beautiful event. I represent Daman Health Assurance Hospitals Company. I'm the corporate director. We are a new set of HMO that is going to launch in Kuwait. We will be live by 23 March. We are a company, will be building up 2 hospitals, so 30 bed and 12 primary care centers, which will cater the healthcare needs of 1.8 million expatriate communities in Kuwait. So we literally is going to cater and concentrate on the preventive healthcare. So this is something, the first time in GCC, and this much in a massive style. Thank you again, thank you crowd, and thank you. Bye.
Congratulations, thank you. Well done. Okay, good. If you guys have any problem with microphone hearing, just let them know. Let them say, speak up, you know, you guys are here. I want to make sure you hear everything so you can connect properly. We're going to invite to the stage Dr. Dua Hamid Soliman, please. Come on up to the stage. Dr. Dua, come on up. It's time to shine. Moving along, day 1 of Health 2.0 Winter Edition. While they're coming up, it's great to connect. Take that opportunity. Did you find us online? Are you following the page? And can you find who is everybody in case you don't hear their voice? Who are they? What do they do? And how can we work together? Well done. Come on down to my microphone. Thank you, doctor. Please let us know how you're here.
Hello, so my name is Dr. Dua Hamid Al-Ahmadi. I represent Dr. Hamid Al-Ahmadi Hospital in Saudi Arabia. And we did a significant impact during the pandemic and the early days of the crisis, and that was amazing. We did great work for the health industry, and we're actually right now starting to build our hospital, our second hospital, and we're really looking forward to connect for any opportunities out there. I am very grateful and honored to receive this award, and I'd like to thank Health 2.0 for this opportunity and for thinking me of to be worthy of this award. Also, I would like to make a special thanks for my family and my sister at age, and also my father, who's my first supporter in this life, Dr. Hamid Al-Ahmadi. And special thanks for my mentor, Dr. Auda, and also for my friends, Ragad, Malad, and Razan, for supporting me. And we wouldn't be here for the people if it weren't for the people who are behind us. So thank you, everyone, and have a nice time. Thank you.
Great. I love how she thanked the family. I know they're appreciating that. Next to the stage, come on up. Give them a warm welcome. It's actually Fatima Shakoya. You saw her on stage. Fatima, come on up. It's time to come on up stage to shine. Hear more from you. If you missed her panel, you missed something good. But like I said, we're streaming live globally. You can always go back. You could always watch what you missed, because we have tons of fabulous content and great insight around health that we brought here to Dubai from people around the globe. Well done. Okay, come on over to the mic. Anyone that missed you earlier, you can give a little overview. Huh?
Thank you so much. I have butterflies. It's truly it's an amazing feeling, and it's an amazing event. So I'm also honored to be here as the CEO and co-founder of Truviva, fertility-focused startup. And yes, my first thoughts go out to my family, without whom I wouldn't be able to be here. My husband and my kids are my true inspiration. And I would also like to thank my team, without whom I wouldn't be able to stand here in front of you. I think they really made me able to express my potential as an entrepreneur and try my leadership skills. It's a lot ahead of me, but I see true inspiration in a lot of you, so I'm hoping to live up to the expertise that you're bringing to the table. And please don't be shy, connect with me anytime. I'm here throughout the conference. So thank you very much.
Great, thank you, and congratulations. Next on my list, can you put your hands together? Kaltrina, I'm gonna try, Shawitham. Come on up, you're gonna correct me, I'm sure, but give her a round of applause. She knows who she is, she knows what she's done, and it's time for you to know what she does, right? I love sitting here going, who's coming up next? What do they do? Congratulations, time to shine. 2 beautiful smiles up on stage. All right, well done, congrats.
Hello everyone, so my surname is pronounced Schwedhelm. I know it's not easy. I'm from Switzerland. I'm deeply honored and incredibly excited to stand here before you today and receiving this award. I'm happy to have dedicated my life into finding solutions to global health issues. This is shown in my 15 years experience in the healthcare industry, not only in my previous role as a CEO of a medical clinic in Switzerland, but also at my current global role at Roche Diagnostics. Receiving this award means a lot to me because I believe that the qualities which brought me here today are all obtained in my youth. Having an entrepreneurial spirit, a strong work ethic, and being able to adapt to changing priorities is the situation I want to create for people in order to enable them to bring their best to the whole organization. I also like to spend my time voluntarily as a mentor at the University of St. Gallen, actively supporting young people and potential leaders of tomorrow in order to find their everyday inspiration and to be able to become innovators across of specialities. But most importantly, I want to express the great gratitude to my family, to Roche Diagnostics, and to the University of St. Gallen for always believing in me and supporting me. So thank you, everyone, and have a great rest of the conference. Thank you.
Thank you. Congrats. Thank you. Okay, next, put your hands together. Dr. Devendra Punta-Becker, come on up. It's your time to shine. Give him a round of applause. Don't let me down. Those hands are still working. I see him texting on the WhatsApp. All right. Well done, and congrats for everyone to see. Great moment in time for each one of our participants today, standing up here and taking this recognition. One of the best things about this great event is to be recognized. Well done.
Good evening, all. To start with, I accept this award with utmost humility. WHO defined health as a state of physical, mental, and societal well-being. So if you look at what Health 2.0 tagline is, advancing healthcare, that definitely we have witnessed during COVID. Usually it takes 10 to 12 years to develop vaccines. We were able to develop vaccine in 3 to 4 years. That's because of the technology and the digitalization. But the second part, I would like to give some statistics. Being in the pharma industry, the world is spending more than $2 trillion on diabetes, on oncology. Every third to fourth person in the United States is obese. So food for thought, are we really heading for a better tomorrow? Sylvia stole my words. I was just thinking on the same lines. So health should go with wellness. So this is what I thank everyone, and I would like to extend my gratitude and thanks to my parents, my wife Shilpa, and I have 2 lovely daughters, Gargi and Maitreyi, who sacrificed for all my education. So thank you all, and thank you Health 2O. Have a great evening.
Okay, next on the stage, please put your hands together. Vardenik Rose Kalatan, come on up. No hands together? What happened, guys? Give me a hand. Thank you very much. Thank you. Now the question, Vardenik Rose. Vardenik, are you here? All right, she'll come tomorrow, but we're thanking you online because we are running live to thank you. We'll get you tomorrow. Next one on stage, could we put your hands together for Dr. Devendra Putabekar. Come on up to the stage. Dr. Devendra. You went up there already. You got two? No, you got one. Sorry about that. One person not being here. We're moving along. Next up, Professor Dr. Philip Plugman. Dr. Philip Plugman, it's time to come on up to stage. There we go. Let's give him some love. Show him your hands are still working. Long day. Thanks for being here. Thanks for being present. We want to make sure that you guys are getting the most out of this event. And we only have a couple more things to join on stage with. All right, thank you. Come on over.
Yeah, thank you very much. Hi, my name is Philip Plugman. I have 2 PhDs, dental medicine and medical sciences, and I'm over 20 years in the healthcare sector. I'm treating in my dental practice patients, but also I'm a multi or serial entrepreneur. We had exits in the field of software for surgery in the dental area or medical technology. For example, we're working also on stuff like self-driving hospital beds. And yeah, if you're interested in books, here's my book number 12. I would like to thank Sefer Azani, Patrick Launer, and Florian Thiringer for this 400 pages book. We try to bring research to public through publications also. So thank you again. I'm very honored and have a nice day. Thank you.
Well done. I love that book plug, you know? Anyone saw that? Anyone saw what he was pushing? Like the book specifically, really important. Great opportunity to get up here and just let people know what you are doing. So well done. This next winner, I want to just put our... It's a big award because when you see businesses that are making an impact in the region, specifically wherever you're from, it's time to really recognize and take a moment to appreciate the things they've done. So let's put our hands together for the next winner for recognition is the Burjeel Hospital. I want to hear you loud. It's our silver sponsor, and we are delighted to have them here. We do have a couple of them coming up to the stage. Put your hands together as they join us on stage. Oh, one of them. Only one. CEO is up here. Anyone else coming to join you? Oh, now they're coming. All right, keep those hands together, guys. Wonderful. Thank you. If you haven't gone to Burjeel Hospital, spectacular hospital. They're coming from Abu Dhabi. Really, they bring in the specialists from all over the world to really specialize. I even had toe surgery at that hospital, so I had my personal experience. We always love case studies. Well done. What a team of people here today. Great. And I know a lot of people are traveling, but if you get stuck and need health care, Burjeel Hospital, there's no one better in town. So again, give them a round of applause as they take this stage. Thank you, everybody. Thank you so much. All right. We got the paparazzi smile. You're global. It's not one, it's a team of people that really make huge leaps and bounds no matter what you do. So thank you, Burjeel, for everything you do. Dr. Abdul, come on up to the mic. Let people know. I know some new people came. Congratulations. Congrats.
Good evening. We'd like to thank the organizers and H2O the delegates and the attendee. It's quite exciting time for our organization. We are known to be one of the biggest organizations in the MENA area. Actually, to number-wise, we're number 2, and we're extending around the world. So we're becoming a universal hospital with branches in India, Oman, Saudi Arabia, Ethiopia, Liberia, Nigeria, going to the UK, and going to Indonesia. Is something that we are very proud of. This hard work reflects us as being a healthcare provider rather than just a hospital managers. It is something that we're very proud to be part of. I'm glad to hear that about Sheba Hospital, which recently we were together. We held the first conference in the MENA region in our premises, and we're extending hands to colleagues from all over the world. We're building a robust system for complex surgery care, and I believe this is our chance to see great people like yourselves for collaboration and future work together. Thank you very much. Success is a journey, it's not a destination. Let's work together for our planet Earth. Thank you very much.
Okay, moving along. Please put your hands together for Faisal Al-Shamari. He's next to come on up, be recognized. Thank you for being here. I want to see more hands. He has a little bit of a walk to go all the way from the back. Thanks for joining us. Can't wait to see what you're doing here and how you got this great recognition. Well done. Thank you, Faisal. Come on over here. Great, congrats.
So, hello everyone. This is Faisal Shamri from Fresenius Care, Saudi Arabia. I'm trying to make it very short. It's great to be recognized, right? So I felt like a movie star tonight, and I believe that we deserve it, as I can see lots of professionals here with their families. You guys deserve this night, and I really want to say thank you to the organizers, to the presenters, and also to the sponsors. We have a great host also. She makes it very nice. I really want to thank everyone here. We deserve it. So I must say that this should be an inspiration for leaders to participate in the next ceremony, inshallah. Thank you, everyone. Thanks.
Wonderful, wonderful. Thank you for recognizing me. I love it. And we're also grateful to be here, recognizing each other, being upon, all these great industry experts. The last one from day one of Health 2.0, we want to recognize, put your hands together, please, for Tariq Shadid. Tariq Shadid, it's time for you to shine, so come on up here and let's put your hands together for the final time for our wonderful recognition awards. Well done to everybody, day one, that's recognized. Congratulations. All right, come on. We got a lot of photographers, paparazzi for you. Well done, and thank you, Jennifer. You have been incredible. Thank you. Stay right here. I just want you to give a couple words if you don't mind. Congrats.
Good evening, everyone. I am Dr. Tariq Shadid. I'm from the beautiful village of Allar, district Tulkarem in occupied Palestine. I'm a consultant general surgeon and medical director of Mediclinic Al Ain Hospital. I am really honored and humbled by this award. If you say I deserve it, then that's great. I'm glad to hear that, but I would never brag about myself. All I do is try to provide good health care in my institution. I'm very, very proud of our healthcare workers, our nurses, our doctors, and I'd like to dedicate this award to my family, especially my father and my mother. My mother is a doctor, and she's the one who inspired me to always give it the best that I can in healthcare. One last thing I want to say, I think we're on the verge of transitioning to value-based healthcare, and the digitalization of healthcare is something that I think is inevitable and will really push us forward. And I'm very happy to be in the United Arab Emirates because I think we have everything we need here to be at the forefront of this revolution. Thank you very much.
Thank you again, Jennifer, for helping us today. I came over from the education event. Thank you so much, and congratulations to all of our award winners for being recognized for their achievements in health. It is not an easy task what you're doing. Just want to let you know. Might start singing to keep you guys awake. I see everyone on the phone. If you need to get some coffee while we wrap up, we have a couple more things we want you to know. And we're going to welcome to stage our next panel discussions. So please, we're going to bring in conversation of implementing AI. This has gotten very interesting for every industry. So let's talk about AI with our next panel guest. Please, let's learn about medical data analysis and how AI plays a huge part. The CEO of Cure Leads is going to be moderating it. So please put your hands together for Mohammed Ramal. Please come on up, Mohammed Ramal. Implementing AI and machine learning for medical data analysis. Mohammed is coming. All right. Come on up. Yeah, we're waiting for you. She's a moderator? You're the moderator. Okay. New information. I love this. All right. Come on up. Tadashi, is that you? No. Jaron. All right, let's try it. Third time's a charm. Jaron Kato, come on up. Looks like information changed. Happens at these events. Welcome. Announce everybody and please introduce your panel.
Thank you so much. Thank you. Good afternoon. And it's been a long day and an exciting day. I know that everyone's tired due to travel schedule, but good news, this is the last session. In this last session, a team with diverse background will walk you through how AI is used in the value chain of drug discovery, and we will touch upon the power and issues with AI. If time allows, we'll speak of future with AI. Let me introduce a panelist, Tadashi Miyahara. Raise your hand. He's a founder, and then he's a CEO of Accel Stars. And then may I also add that he's a serial entrepreneur. Previously launched a startup for data management, handling real-world data, which was successfully acquired by one of the largest real-world data company called JMDC in Japan, and then later, recently IPO'd in Tokyo Stock Exchange. And second speaker is Mohammed Ramel, CEO of Cure Leads, and then he has decades of track records in life science. He's a leader in previously leader in regulatory science in Novartis Oncology, and then another expert is Ravi Ramaswamy, CEO of RV Consultants. He has a track record of life science over 40 decades, including his contribution in GE and Philips. And George is a consultant for data security and contributing to a medical society across the globe. And then lastly, myself is Jaron Kato, and then I'm leading a small startup in Japan, which is a spin-out from Takeda Pharmaceutical, currently developing a drug for rare diseases. And then let me share with my story why I became entrepreneur. There are over 7,000 rare diseases. Only 5% have access to medicine. I think innovation is more about delivering drugs for those people who need. Even there's a drug, if it's $1 million drug or $0.5 million drug, that's only for limited countries, limited people. And our approach in Gexfol is to rediscover shelved assets in pharmaceutical company. Japanese pharmaceutical is one of the leading companies who deliver new medicines. And then we have to deliver affordable medicine to rare diseases. The way we do is to reprofile and then combine that data with real-world data and existing data to rediscover the opportunity in rare diseases. So tell me, Tadashi, with your experience, how you worked on real-world data discovery.
One, two.
Get it on. All right. Here's one. Here's one. You guys got it on the bottom. You're going to have that little.
Yeah.
Hello?
Yes. Real world data is very important to develop or implement the AI because to accurate AI, in order to accurate AI, the data is the most important because AI is generated from the data, especially in deep learning. So, I think data is classified into two types. One is the data quality. The second is data quantity. And I think the most important is the data quality at first, because generate the data, the AI generated from the data is not accurate. So at first, I think the most important is real-world data, nice quality, real-world data. Yeah.
What are the challenges you are facing during the curation or cleansing of data?
Yes, in order to create good quality data, our company is a sleep technology company to utilize the AI. Our company developing the process to create cleansing data. Now we have the 5 steps of cleansing data. It's very important to develop the accurate AI system. Yeah.
What kind of people are involved in data cleansing process?
So first of all, thank you, Sujoran, so much for moderating this session. I really appreciate it. Just to build on Tadashi's story, what we're doing in CureLeads, so we have licensed one of the diagnostic tools, which would enable, as a point of care, which enable physician and lab specialists with a simple drop of blood to diagnose or to detect whether a patient has a trait of thalassemia or sickle cell disease, or a carrier, or a patient, or a normal, right? And this is a very important topic in the Middle East region because this is a region where there is a lot of genetic problems, abnormalities in the field of hemoglobinopathies. So the interesting part when we had this project and we want to bring it to the region, what we faced initially that, this is a simple IVD, that the question was, AI plays a role in developing an algorithm because here, the traditional approach was to use the big lab HPLC, high performance liquid chromatography, right? And now we're replacing the HPLC with a simple machine, less than the size of a laptop, which can do the reading in a matter of 8 minutes, okay? So we brought the machine in, we start really to commercialize it, and then we start to really try to detect, based, of course, on the clinical utility. Now, what happened is that, at certain level, so the machine, we had to do some local validation. So the more you give the system the data or the algorithm, the better it becomes more efficient to detect. And we had a very narrow therapeutic window, which is a hemoglobin of 3 to 5%, which is critical to really define whether the person, and we're not talking about patient here, a person has the trait or not. And why is this so important? Because simply premarital test is mandatory before any marriage, to really to avoid two carriers to marry and then have a child that is a patient. So with the importance of the algorithm, with the no more data that we brought from the Middle East, so we have upgraded the software, and then that software was able to detect that level. So it is really important that even at the clinical stage, but even at the time where you start to bring it into real life, the concept of AI and the data integration becomes a kind of across the whole loop of the life cycle of any product, and this is very, very important. So this is one of the experiences that we have lived in our at Cure Leads.
So I can take over now. I'm George Kavalakis, CEO and founder of Black Duck Consulting. I have more than 15 years in the healthcare industry, but I'm the tech guy. I'm cloud and security specialist. I'm also a certified Microsoft trainer. So what I'm gonna say, it's around, basically Microsoft technologies and all my knowledge around that, so Microsoft Cloud. In this case, I need to add on what my colleagues said here, that, the more data you put on the system, the more data you feed it, the better results you get, okay? The main systems on the back need us to provide them more information, more data to achieve the best level possible, even on the earliest stages of implementation or design or development.
I think we looked at the genesis of what an AI is used for. We saw what security is needed. We also talked about the quality of data. Now let me give you two instances of where an AI is actually used to bring in benefits. And what I really want to do is to first touch on a clinical use case, and the second one is more on the productivity side. Let's go with the clinical first. If we need to do a MR scan of a brain, a good scan takes typically about 40 minutes. Today there are softwares available by which we can do an underscan for a 20-minute scan and then reconstruct the balance of that last 20 minutes using software. Thereby, you are reducing the trauma for the patient, because the MR machine is very, very claustrophobic and creates a lot of sound. So in that perspective, we do have AI by which we are able to get the same quality of the image without compromising on the features, at the same time reduce the time by almost 50%. Given that the cost of a good MR machine is over $1 million, you can sort of calculate what the productivity gain could be on the financial side, as much as what the clinical gains are for the doctors and the patient experience. That's one portion of it. The second one that I would possibly want to touch is on the productivity aspects. We did do a tool development for one of the Middle Eastern states, wherein we were able to prioritize chest X-ray screening for the immigrant workers. There are about 2,000 scans that happen every day, and we said, let's sort of do a very, very simple analysis of what is normal and what is not normal. Typically, when you look at TB profile in this region, about 10% of them have TB, the balance 90% are normal. So what we said was, let's do a scan of these images. About 2,000 images were coming in every day, And then out of that, about 200 of them would be non-normal and the balance would be a normal one. So by doing so, we were able to create a work list with a percentage of confidence saying, yes, for the first 10, I'm 100% confident. For the balance 10, I'm 90% confident. So you have a graded sort of a thing. So when the radiologist walks in and opens the modality work list, he is able to look at what are the ones that needs his attention the most, and the balance of the 90% which are normal, he doesn't have to spend much time on it. Customer wrote back to us saying that they have seen a 35% productivity gain. So if we really put AI to use in the manner that you described in terms of having good data and building up your ground rules, your golden rules very, very well, I think the impact and the benefit that it can actually get for you is significant. Not to talk about the decentralization of care, which is anyway out there.
Yes, Ravi. So when I started my company, use of AI is more about increasing efficiency and power. By using AI technology, we identified hidden opportunities, and then indeed, our discovery, the drug candidates just entered in clinical study in Australia. So we made it happen to shorten the time to deliver drug for, to develop a drug for half time. But then what I'm hearing from Tadashi and then Muhammad is AI is not about just about efficiency, but also something that we cannot do without AI. So there's some uniqueness of AI. Can you elaborate more about it?
Absolutely. And let me again share with you another story on this topic, which is very, very important from a scientific and clinical value. So we're also working with a company, a European company that work in the field of endometriosis. And endometriosis is a problem, it's a gynecological problem that impacts mostly the young females, okay? Now the time to diagnose endometriosis, because the doctors, they go around to do scans and MRIs, and then eventually they end up with advanced stages to do what we call a procedure called laparoscopy. They take the tissue out and they detect. That time to really do all this journey ranges between 8 to 10 years. And the lady during that period, faces a lot of pain with every menstrual cycle. It's a very vague, and doctors, they don't do much about it because they don't have means and tools to really be able to detect so early, at an early stage, whether that person has endometriosis or not. Now what happened is that with the advancement of genetics and epigenetics, the researchers, they were able to identify the microRNA that can decode endometriosis. So out of the panel of 2,500, they were able to detect what are the microRNA that can truly define whether that patient has endometriosis or not. Now all the predictive analytics of the diagnostic, be it the scan, be it the MRIs, they maximum, the best they can make up to 75%. And to Ravi's point, sometimes the doctors would do laparoscopy, and 1/3 of the patient, 27% of the patient, they end up doing laparoscopy with a very high cost and unease for the patient, and the patient has no endometriosis. So the AI came into play here. So the researchers, they did the clinical study, they integrated the big pool of data from the AI system, and they were able to detect with a clinical trial of 800 patients up to a 98% accuracy and sensitivity of the test to detect endometriosis. So imagine you're moving from 70% accuracy to a 98% accuracy with integrating the big data plus the clinical trials. This is transformational. This is transformational. And guess what? The time to diagnose went down from 8 years to 20 days. To 20 days. This is the first of its kind of approach. And I'm just sharing one experience, one example of how the use of AI can significantly transform how medicine is being practiced.
In fact, you know what, I am tempted to pick up on what you said. There is a technology called as amide proton transfer, which is usually used for detection of brain lesions. Now, let me ask you a question, Juran. I have two cases. One is an 8-centimeter lesion in the brain, and the other one is an 8 mm lesion in the brain. Which one do you think will require a surgery?
8 centimeter.
Okay, now that's what the normal philosophy says. But when you do an amide proton analysis, you might find out that the activity, the veracity, or the way that the tumor spreads, the 8-centimeter one is something that is going to take a much longer time, and you don't have to interact with it now. You can just leave it as it is. Nothing much is going to happen. But the 8 mm one, which is out there, can actually spread like forest fire. So, and that is the one that might require an immediate opening of the skull and taking the lesion out. So, suffice to say that without opening up and doing a biopsy, we can have conclusive evidence of how a tumor is going to be treated, even at the least cost and the least trauma to the patient. So just to sort of add to what you said, we can do the entire analysis using non-invasive techniques rather than even touching it up.
It's a very impressive story because AI is not just the data management, but more application in clinical stage, especially for imaging, has so much power. So in my case, my asset is soon finishing phase 1 study and then entering to phase 2 study to measure efficacy in pediatric patient or possibly 16 years or above in a disease called Rett syndrome or Fragile X syndromes. Both are measured by questionnaire. So we will require some objective measures, and then we realize that Tadashi has a very good solution, possibly has a solution to such, more objective measures.
Okay. Regarding Rett syndrome, the famous symptom is tremor. And now we are developing our own wearable device to detect tremor through the acceleration meter. And if the algorithm is deployed to the real world, I think we can develop the new treatment for the pediatric patients, because currently drug is the target is the very general symptom. But if we can detect the real time, I think we can develop the new treatment called companion digital therapeutics. I think that digital therapeutics is very important in the near future. The companion digital therapeutics is a chemical drug with a medical device, yes, such as a wearable device. Yeah, I think.
So once during the development phase, if AI is applied, then eventually we have to enter the regulatory discussions. Do you have any insights in around the regulatory?
Yeah, I think this remains one of the challenges, really, to try to develop the regulatory framework, because we know in medicine, be it a pharmaceutical or an IVD, this is a very regulated market. So this is not like a free commodity, right? And historically and traditionally, this has been based on the evidence stemming out from clinical trials. Now here we are trying to twist the model a little bit, so we're still having the clinical trial evidence, but in a way this has been maneuvered to really integrate the element of AI to improve the accuracy and the
productivity of the data set, okay? We have faced that challenge with some of the regulators in our region because, even though you bring, stringent regulatory approval from different, reference countries, but they would always ask, you've got to get also local validation here. And I'm not surprised about this because, with anything new, any new concept you want to establish, people initially, they become hesitant and they have a moral responsibility to our patients. We as well, we do have the same. So I would definitely not debate this, but I guess that there should be an ongoing dialogue with the authorities as well as with the clinicians, because even doctors as a mindset, they still believe, whether I'm a radiologist, for example, in an imaging setting, is this going to replace my job at some point? How is this going to pan out? So I think this new concept, there is a lot of still unanswered questions. There are a lot of unspoken question of, because that has to do with the data, to do with the outcome, has to do with the human factor, and these are all need to be put on the table in an open way and have a dialogue with regulators, policymakers, physicians, as well as other stakeholders and insurance companies. So for sure.
I can jump in on that one. Generally, the providers, most AI solutions are being hosted in a cloud provider like Microsoft, Amazon, Google, whatever. What Mohammed says is a fact. Generally, providers try to help all the companies go to the cloud and use AI technologies in their infrastructure, cloud infrastructure. And there, they have all those regulations and all the policies that are different in different areas of the world. So what they're trying to do, they're trying to help each case to be able to work, like to be compliant. And yeah, because we had a discussion with Mohammed earlier on, right now we need to do an analysis to check if, let's say, a specific solution is can be supported in this area of the world. But generally, a discussion should be start with the governments and the policy creators, because technology moves very fast and everything else goes slow. Okay, so we're talking about AI, and that's why I'm also here about the part of security, protecting the data, because we're creating solutions right now, but do we know if we are protected? Do you know if any of your application or systems cannot be compromised tomorrow? No. So, yeah, that's the data privacy also, it's part of it. The anonymization of the data, it's also part of it. So the whole thing to protect the data and being secure and stuff like that can need to be discussed with the authorities, because this will help also, to move forward in terms of regulations and government laws.
I cannot agree more with you on this, George, because when WannaCry hit us a couple of years back, we know what disaster it caused for us in terms of bringing the entire hospital systems down. Any free port gets attacked, and the medical data is like gold today. So the consequences are disastrous. So I cannot agree more with you in terms of weaving the entire security from the development perspective, starting from the day that you want to start thinking about the product to the time that you go and launch the product in the market.
Yeah, because imagine that you have done all that much work and suddenly one hacker is a bit bored at his house and hacks everything. Data breach, trying to sell the data. Right now in Europe we have the GDPR, so you know that you'll be fined because someone hacked in your system. So right now, the whole idea has a lot of, it costs, okay? And we need to protect the data as also the solutions.
There was another incident in Germany, and this is even worse, where the hacker was able to get into a patient monitor in an intensive care unit and start changing the parameters of the patient. Now, if that happens, that can be a disaster. And that's all the more the reason why we really need to be extremely, extremely careful in terms of designing system and securities around it.
And I guess just one thing, Juran, just to complement what the colleagues are saying. I think even the model, okay, traditionally has been a sequential model, meaning we go phase 1, phase 2, phase 3, post-marketing, tuck. Here we're talking about a little bit different approach. We talk about an integration model, a kind of a circle model, because what George mentioned is so crucial. You cannot dissociate, that element of security, the element of data privacy across all stages, So that can also, we need to think about how the model of product approvals or regulatory approvals need also to evolve. So there is a lot of hype about AI. There is a lot of validity, and it really has proven its concept. There is no doubt about it. The question becomes now about regulations. It's about applicability and how this is going to transform also the model and the design of how we do clinical studies and product approval.
So the learning today is that AI has been used from discovery stage to development stage to deliver the product stage. Although yes?
But also the operation stage.
Operation stage.
Yeah.
And then it's been used for to enhance efficiency, although it requires so much of energy for data cleansing and then education and then validation and then quality control. And then it's not only for one-way direction, but like integrative process. That means we require a multidisciplinary team to continue the loop. And then AI is something that can make it impossible possible, like what you said, to be able to measure unmeasurables in future. But then the question would be, my question to audience and then to the floor and panelists would be, do you think AI is helping us when it requires so much of burden to make one product, or do you think AI is replacing us?
I think let me sort of just start here with another example, okay? AI is not a panacea for all the problems that we have. Take, for example, a computational pathology case. What you basically do there is you take a tissue sample, you do a biopsy, you take a tissue sample, you stain it, and then you put it onto a scanner, get the digital image from the scanner, and then you run your algorithm to see if there is a malignancy, and if so, what is the subtype of cancer, what's the level of malignancy, and stuff like that. Now, when you take, in the case of radiology, AI is pretty well defined. But when you look at computational pathology, the number of parameters that come in is significantly large. Like, for example, there could be differential staining of slides. Not all slides needs to be stained uniformly. Different scanners could pick up those stains. Like, for example, Leica could do differently, Hamamatsu would do differently, Philips could do differently. So when you do that, the type of images that you get is different. And then you're using the same algorithm to look at these differential images and then do interpretation based on which a surgeon is going to make a tumor board portal, is going to take a call on the patient. That's a difficult one. So will AI provide a solution in all the cases? The answer is may or may not. It will evolve over a period of time, but then at this point in time, can it solve everything? To me, the answer is a no. But will we get there? Absolutely yes, at some point in time. But what the AI cannot replace and will never ever replace is the empathy and the trust that a doctor and a patient has. That cannot be replaced.
Yeah, I agree. Definitely on the last point, definitely. There is no doubt the emotional part remains there, because at the end of the day, we are all human beings, right? I want to be a little bit philosophical here, and bear with me on this one. So if you go back in history, 150, 200 years ago, when the first industrial revolution came in, it really replaced the agricultural part. So the human moved from agriculture to industry. And that has significantly created a new dimension about how the world will look like, because a lot of jobs were lost because of the machine introduction, but at the same time, a lot of jobs were created because of that at the same time. Okay, so this is a defining moment in history, in human life at that time. Now, when we are now entering the fourth industrial revolution, as they name it, with the introduction of AI, I think the science and technology, it's an inevitable matter. I think that's something we should not be debating. The question becomes, and there are lots of pros and cons and different views here and there, but the idea is, you know, what is the outcome? What is the desired outcome here? Today, data are facts, and facts are cold-blooded. We are human, we have emotions, right? But at the same time, doctors make mistakes, right? When they diagnose, you know, it happens. Or not because, you know, they want to make mistakes, because also sometimes it's a capacity issue. Doctor, radiologists, if I take, for example, the breast cancer model, right? The breast cancer diagnosis is on the rise. 1 out of 8 females, they will at some point develop breast cancer, right? And part of the technologies is really to do the first scale of screening is mammography, right? There is a lot of mammography tests coming, and the number of radiologists is very finite in each and every market. That is creating a major capacity issue. So instead of having 2 radiologists reading and then not able to really do all the scans, and because of that also make mistakes, having a radiologist plus a machine learning, whatever you name it, software, AI, you know, whatever model, that would improve the outcome for the patient. That would also make the system more efficient. That would also enable the doctors to do something else. So I think it remains a big question. It's an unsolved question, but definitely this is something that, you know, we are heading toward that direction. The question is how we deal with it rather than we negate it. But that's my personal position about that.
So my point of view is that generally we don't need to be afraid of AI, machine learning, behavioral analysis, whatever goes in this chain, because the whole thing is still a baby. Each AI application is still learning. It has a lot to learn still. And the current need that we try to cover is to reduce time, to help everybody, the professionals to be able to work faster and more efficient. So I can say that they won't be replacing us, but rather that we will evolve, you know? We will work together, and at some point maybe, when I started like in IT, I was having, you know, servers, setting up systems, stuff like that. Now everything is in the cloud. Initially it was like, oh, what we are going to do? Are we gonna stop putting, you know, CPUs and RAMs in the systems? Yeah, we evolved. We became like, you know, cloud experts, DevOps, new professions that came into the whole idea of IT, and this will go to every aspect of life, including healthcare.
It's interesting because I never had an answer if AI is replacing us or not, but what I'm hearing is that AI and then us are complementary to each other. Quite interesting view. Any last minute thoughts?
And from my view, the 2 important jobs of medical doctor can be replaced by AI. One job is a diagnosis, because AI can work 24 hours, 5 days. So I think one job is diagnosis, and the second thing is choosing drug, choice of drug. Yeah. Because if the patient information can be detected from the wearable device, we can develop the algorithm for choosing correct drug. I think it's a very important view. But other jobs cannot be replaced by AI, I think.
Let me give you one example, Tadashi-san, to sort of complement what you said, okay? I don't know how to agree with you on all the occasions, so let me go a bit orthogonal to this. There was this case of a boy who was suspected with food poisoning. They tried all sort of things, they did all the tests in him. They looked for pesticides, which was not there. They looked for allergens, which was not there. They were sort of struggling to find out where that poison actually came from. Then they realized, saying that this boy had picked up a gene from a roadside vendor, and that vendor had got the gene transported in a fertilizer truck. Now, from the fertilizer truck, the chemicals was picked up, and through the skin, from the gene to the body, the chemical transfer happened. No amount of AI can ever detect these sort of scenarios. This is completely out of the world. So we need to be sort of discerning where AI can be used and where AI cannot be used. And at the same time, I think the world is heading to a point where we need to be AI enabled, just the way that we are digitally enabled in the financial and in the telecom world. So I would possibly leave it at that.
And just to mention, we just said it just one word, that AI is also on the operations, not scheduled operations, but the everyday stuff that the people do, creating reports, calling patients, for the next appointment, stuff like that. All this can be reduced by using AI, machine learning, and generally all the analysis that goes behind that. So besides the medical part, that's the most important, we can reduce time by using such tools, such artificial intelligence, with everything else besides the main job.
So I believe there are medical doctors on the floor, and they would like to open question or discussion.
Perfect, amazing. Give him a round of applause, guys. Great way to come to an end for day one. I wanted to leave, you see a few minutes are left for questions, right? Our audience likes to ask some questions. And now it's the end of the day, so now you can. Please join us at the microphone with any questions you have. Come on up, don't be shy. First one there is a winner. Welcome. I saw you all day sticking in the audience. Thank you for being here. Who are you and what's your question?
Hey, so my name is Ran Zielka. I'm the Chief AI Officer for Twill Health. And I want to thank you, first of all, for a very, very interesting discussion. I promise I do have another question. It's not just a statement, but two observations. One is that most of this discussion was focused on detection, prediction, analysis, and so on. What was absent potentially, maybe a little bit, is generative AI. So the ability to generate human-like text, human-like conversations, for example. And then related to that, there was a statement made here about it will never be empathic, or I forget exactly how it was phrased. So as a person leading a team who is entrusted exactly with this problem of creating conversational AI that exhibits a therapeutic alliance, I want to ask you, first of all, if you think providers that you know are always empathic and always compassionate to their patients. And secondly, what do you think about generative AI that could exhibit those properties? And wouldn't that be, what your thoughts are on this exploratory and innovative thing that is starting to happen commercially now? Thank you.
Well, I can say about, but Microsoft has already built a conversational AI, and besides that AI, you can connect medical databases, so the patient or whomever, or even the doctor, can go and have a real-time conversation with a bot, AI bot, and get real-time answers from that database. So for me, this part is being, it helps also the doctors and the patients, but it's also on the operational stuff that AI covers as well, but okay, in your case, you might take this to a couple of steps forward and to manage, even better results. But nevertheless, conversational AI that will make, us to go to Facebook, let's say, and send the message and start a discussion that a couple of companies are doing right now, is being not built, it's already there, but it needs more information. As I initially said, we need to feed the model to make it better, and from that point on, when those models are rich with data, then you and all the other companies can take these ready models and put them on their own solutions.
I think if we really look at multiple options, like for example Nuance, or if you look at Dragon, or you look at RPA, the robotic process automation, where the bots have taken over the BPO world, you'll find that there is a transition to conversational UI interfaces, and that's a very, very hot topic, Doctor, that what you talked about. Is it out of realm? The answer is no. Like for example, Google Translator. You speak into it and it gives you the stuff. Now the question is, has that been applied to the medical world? I have not seen it yet, but it's only a question of time before we have another startup which sort of perfects that part of the story and makes it available to the larger audience.
I think we are talking about this science fiction becoming a reality. And then actually we were working on natural language processing and then how we digest a diverse range of different data we can see in life science. My understanding as of today is that we will require a certain skill to be able to talk to AI. You have to educate yourself that you use AI-friendly questions to AI. But someday, I believe, there will be a merger between, there will be no boundaries between the AI language and an our language. So I'm hoping that a brighter future comes ahead of us.
Fantastic. All right, we keep the conversation going. Do we have any more questions for our panelists? Come on up to the mic. Come on back from the back of the room.
In fact, before he asks, Coke does the interview on first 3 levels of interviews are done using robots.
It's coming. Yes.
Hi, I'm an engineer, so very relevant. I built diagnostic and medical devices, diagnostic systems and medical devices. So this is a very different question. Like at this point, is there any domain, any subdomain in diagnostics or in determining prognosis that you will say, personally say, look, I don't buy AI in my office at this point of time. Anything that you hate AI for, you don't like AI for? Or you are seeing problems coming through AI?
Repeat the question.
Sure. Can you repeat that question for our panelists, please?
So any specific subdomain or any specific thing, any experience that you had while using AI in your life, with your patients, where you say, look, I am not comfortable with AI in this particular case. But have you experienced any failures in AI in your career, in your life?
Great. So the question was, did you experience any failures? I want to make sure you guys got it in your life with AI.
Yeah, absolutely.
Good. Who wants to hear? What was it? Your microphone's on?
Before I let Muhammad, I will start that AI starts by failing.
It starts by failing. Okay.
Failing is experiencing. No, yeah, you're right. I mean, we have that. I mean, we faced it with the thalassemia trait detection. So at certain point, the algorithm was not able to detect a certain range of the trait. But then with the more data, with the algorithm development, that has improved, and the accuracy was there. So, but I don't know whether we call that failure or we call that part of the process improvement. It's difficult how you categorize it, but I guess the question of AI failure for me becomes a big question if there has been a complete misdiagnosis or has been different outcome on the patients, which is something yet I haven't come across such kind of data at the moment.
Let me sort of address it slightly differently. There are 2 parameters that are widely used to talk about the quality of AI. One of it is sensitivity and the other one is specificity. Never ever can you get an AI with 100% sensitivity and 100% specificity, whereas the human brain can at some point achieve it. The AI that you build is contingent on a model that you are using for building the AI. And that is a finite set. There could be corner cases which were outside of what the AI the caseload was actually used. And therefore, the prediction of that, suppose, like for example, if you are building a AI with say 100 data sets, there could be a 101st and the 102nd which is outside the realm of what the 100 is. And at that point in time, the predictivity of AI on those sets is a question. So will it fail? The answer is yes. And that's where the AI is always used as an advisory and not as a definitive line of treatment. The final call that is made by the surgeon final call is made by the physician. And we have not come to a point where an AI can make the final call in terms of what the diagnosis ought to be.
I think one thing I thought of is AI learns based on existing data. If the existing data is biased, AI could be biased. So there are some examples like AI could give a biased answer. But is it a failure of AI? Maybe no. It's a matter of how we educate AI. So it's more about like how we train, how we educate them, not AI's failure itself. That's how I feel.
Yeah. So human interaction is key to AI advancement, I think. There's no doubt.
Well, we need to put unbiased data in the model, and we will never have 100% accuracy. 98% or 99% is not 100%. There's 1 or 2% of failure.
Statistically, we can look at all of this, but that 1% means a loss of life to an individual, to a family. And there it is 100%. So I think that says it all.
Absolutely. And what a way to end day one. Give them a round of applause. Great AI panelists. Thank you for our panelists. Stand up. Let's take a great picture of you guys. I see you getting rambunctious. I hear talking in the audience. Everyone's ready for what's coming next. We got a great networking activity coming. You guys have been incredible. Experts from around the world. We're talking about the globe, and we're talking about health around the world at Health 2.0 Winter Edition. Hashtag Health2Conf is how you're gonna post on social media on all the channels so that we can find you and share your content and let people know who you are. Let them find you, right? You are who Google says you are. So let's make sure Google has you at this event in Dubai in December 2022, coming to the end of a very eventful year. Thank you, panelists. Great job. We loved having you up here. So, as they say goodbye, unfortunately, thank you guys. Thank you. You're welcome. Thank you for your great knowledge on stage. We loved having you here. What a wonderful day. Day one is full of information. We really went across the board talking about anything and everything in health and that addresses health. And I want to thank every single one of you for being here and in my audience, and you online as we stream live on YouTube. This is amazing. Not only do we have experts from all over the world, we have people engaging in conversation that is shaping the industry for tomorrow. So before we sign off, I want to wrap up the day with a final thank you, a big thank you for our silver sponsor, Burj Hospital in Abu Dhabi. We couldn't do it without you. Professor Dr. Abdul Rahman Ahmed Omar, we appreciate your contribution to this great event. So please give him a round of applause for helping make it possible. It's been an incredible start of an event. We have 2 more days. 2 more days. Who's coming tomorrow? Raise your hand. Great. And we got day 3 as well. Lots of great expertise, great recognition to really let people get the opportunity to shine on stage. And I thank every one of you for being participants in my audience. As I mentioned, I hope you find yourself challenged, inspired. I hope you're learning new things, and at the end of the day, I hope each and every one of you are having a fun time while engaging and connecting with your industry peers. So from a show of hands, who's connected with people on LinkedIn today? Who's connected with one person? Keep your hand up. 2 people, 3 people,
4 people. Keep your hand up. 5 people. 6 people. That's it for today? That's your cutoff? That was your threshold? 7 people. Anyone over 7? Because I'm going to give you that target. 7 from the panelists or people you met walking around. Well, guess what? Fantastic. 7's my lucky number. And as I wrap up, right is outside these doors is our networking opportunity where you can take that number and increase it for day 1. There's hundreds of people here today from 6 different industries, and I want you to make the most of it. So thank you. Without further ado, enjoy tonight. Enjoy the networking. I'll see you tomorrow. My name's Rachel Muleman at askrachel.info if you're looking for me. I want to close with every day is a chance to get stronger. Every day to eat better and to live healthier and to be the best version of you. So thank you from the bottom of my heart, and thank you from Health 2.0 for being here. Have a great evening and enjoy Dubai, one of the best cities in the world. Thank you, everyone.